Assembly chamber. Sound. 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 Assembly chamber. Assembly chamber. Sound. 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 Assembly chamber. Sound.
Point of order, Philip Brett.
Madam Principal Deputy Speaker, you'll be aware of the written statement issued by the Finance Minister last evening awarding £16.2 million to advance the much-needed Enniskillen bypass. This is of course good for the constituency, improving economic growth and connectivity, and I pay tribute to my colleague Deborah Erskine for pressing the issue. Equally important to my constituency's economic growth and connectivity is the York Street interchange. Could the Principal Deputy Speaker inform this House if Mr Speaker has received notice from the Finance Minister of her intention to come to this House to outline a similar funding award to advance the York Street interchange project?
Thank the member for his point of order. Which isn't really a point of order because I don't know if the Speaker has received any notice, but the member has his point of order on the record, and certainly we will refer to the Speaker to see if he's received any notice. Thank you, members. So before we commence the consideration stage of the budget bill, I would like to remind members that the amendments for further consideration stage may be tabled in the Bill Office for up to 1 hour after the conclusion of the consideration stage. If amendments are made to the bill at further consideration stage, the Assembly will suspend for a period before final stage debate to allow for time for the necessary legal checks to be conducted. At consideration stage of the budget bill, I call upon the Minister for Finance, Dr. Kiva Archibald, to move the bill.
Moved.
No amendments have been tabled to the bill. I propose, therefore, by leave of the Assembly, to group 13 clauses of the bill for the question on stand part, followed by the 2 schedules in the long title. The question is that clauses 1 to 13 stand part of the bill. All those in favour say aye. Aye. Contrary if any noes? The ayes have it. The ayes have it. So the question is that Schedules 1 and 2 stand part of the bill. All those in favour say aye. Contrary if any noes? The ayes have it. The ayes have it. The question is that the long title be agreed. All those in favour say aye. Contrary if any noes? The ayes have it. The ayes have it. That concludes the consideration stage of the budget bill. The bill stands referred to the Speaker. Thank you. The next item on the order paper is a motion on an action plan on waiting lists. Clerk, can you please read the motion?
That this Assembly believes it is deplorable that none of the formal waiting time targets for health and social care services in Northern Ireland have been met since 2014, notes with concern a recent Northern Ireland Audit Office report which indicated that a number of people currently on the health and social care waiting lists was equivalent to 26.3% of our population, more than double the figure in England. Further notes regional inequalities within Northern Ireland and the urgent need for same-time access regardless of where anyone lives, acknowledges the need to turbocharge investment towards tackling the waiting list backlog over the remainder of this Assembly term, stresses the value of partnering on a much larger scale with national and independent providers to maximise existing capacity, and calls on the Minister of Health to publish an updated action plan to tackle waiting time crisis within 6 weeks.
Before I call Diane Dodds to move the motion, I just want to inform members that one of the urgent oral questions on junior doctors' strikes has been accepted by the Speaker. There's no decision made on the other yet, so I call on Diane Dodds to move the motion.
Moved.
Thank you. The Business Committee has agreed to allow up to 1 hour and 30 minutes for this debate. The proposer of the motion will have 10 minutes to propose, and the winder will have 10 minutes to wind. As an amendment has been selected and is published on the marshal list, the Business Committee has agreed that 15 minutes will be added to the total time for the debate. Diane, please open the debate on the motion.
Thank you, Madam Deputy Principal Speaker, or whatever way round that actually is. I'm pleased that we are having the opportunity to discuss this important topic, and I want to thank the Health Minister for his attendance in the Chamber. I'm sure that every MLA in this House this morning can attest to the fact that every week they are meeting with constituents who are ill, in pain and on a waiting list. They have lost hope and faith in the very NHS which was meant to look after them from the cradle to the grave. Let me reinforce my belief that a well-funded, properly functioning NHS, free at the point of delivery, is my sincere goal. It saddens me that we are very far from that objective. I would also say, Madam Speaker, that tackling this issue is one of those pivotal issues in which the success or failure of this executive will be judged. We cannot fudge the issue or talk about everything else, but not address this most fundamental of issues that impacts our constituents every day. I would like to make some progress. Minister, I understand and appreciate that you have a challenging brief, and hope that in highlighting this issue in the Chamber today, that we will lend weight to your arguments for resources to tackle the problem. Equally, Minister, this is an issue that will not go away, and we will hold you and your executive colleagues to account on the progress in tackling this one. In bringing this debate, I want to be clear about the uncomfortable truths about waiting lists. The Northern Ireland Audit Office report of 2023 makes stark reading. No formal waiting time targets have been achieved since 2014. Between March 2017 and 23, patient waiting lists exceeding maximum waiting time targets have increased exponentially. The equivalent of 26.3% of the Northern Ireland population is on a waiting list, compared to 12.4% in England. This means that more than twice the proportion of our population are currently on health and social care waiting lists compared to England. In Northern Ireland, 51% of those on a waiting list were waiting over 52 weeks for assessment or treatment, compared to 5.4% in England. From the Department's own waiting time statistics, we know that 87.9% of patients diagnosed with cancer received their treatment within 31 days, versus the 98% target, with gynaecology having the poorest outcome of 78.1%. Within the statistics, there are huge regional variations, with some trusts performing much better than others. This postcode lottery of treatment is unsustainable and unfair. Within the Southern Trust area, the wait for a routine urology assessment is 153 weeks, and a potential further wait of 151 weeks for treatment. The wait for a rheumatology outpatient assessment is 201 weeks, and for neurology 172. I have used figures for my local trust. Other figures are available, and the wait times are just as shocking. This is long past the point where we can call this a service. It is clear that very poor waiting time performance is significantly increasing the number of patients who are at risk of developing serious conditions and illnesses, and their quality of life will have been reduced by spending protracted time on tests, waiting on tests, treatment or surgery. There is also deep concern about the prevalence of late diagnosis. Between 2012 and 2017, a quarter of all cancer diagnoses were made in emergency departments and not in primary or elective care. It is morally unacceptable that we are allowing patients to reach this stage in their journey before serious illness is detected. Minister, we all know that this is not a sustainable position. We know that Northern Ireland has the worst waiting lists in the United Kingdom. Simply doing a little more or investing a little extra won't make a significant difference, and that is why it is imperative that you and executive colleagues have a clear plan to reduce waiting times. In its latest funding offer, the UK Government has said that it will grant an additional £34 million to tackle waiting lists. However, the Northern Ireland Audit Office report indicates that £909 million would be required to substantially reduce waiting times. In practice, and the elective care framework estimated as £707 million was required to ensure that by 2026 waiting times do not exceed 1 year. The Department has now conceded that these targets cannot be met. And I know that you're very soon in post, Minister, but is this still your view? Stabilising this fundamental public service will require significant investment in funds. And we need, Minister, your department to provide robust figures on the cost of stabilising the service. And we will be watching the future budget proposals for investment. However, funding is not the only solution. Recruitment and investment in staff is vital. And I hope, Minister, that you will be able to reverse the decision taken last year to halt the recruitment of nurses onto our university courses. We trust that you will be able to reach satisfactory agreements in relation to pay, that our staff can feel valued, and that you will work with trusts to ensure that staffing levels are safe and appropriate. While there is a need to increase the number of staff, this must also be accompanied by an overhaul of an adequate, out-of-date and poorly maintained physical and digital infrastructure. These investments will lead to more efficient delivery of services. Other options which must be delivered include the use of primary care for routine elective procedures and in tackling the extreme pressures on social care. We need to be realistic about the extent of progress our system in its current form can achieve. We clearly don't have sufficient capacity, and all the retraining and recruitment efforts in the world won't turn that around in the short term. We need to find partners who can assist us, and we need to also look beyond our usual local providers. Our small independent sector in Northern Ireland will undoubtedly have a role to play, but it is dwarfed by the volume of the additional capacity that is needed. I will shortly, if you just let me finish this point. Continuing in the old way with small contracts at the end of the financial year will have only minimal impact. Indeed, I was very concerned when contacted by one of the private sector providers, indicating that patients that they had been anticipating this month for urgent red flag endoscopies have not been forthcoming due to trust financial concerns. They had made arrangements to carry out 2,000 endoscopies and 1,000 urology procedures in the 6 weeks up to the end of the financial year. Have these red flag patients simply ended up on another waiting list? I can only imagine the fear and concern. I'll give way to the member.
I thank the member for giving way, and indeed I share the concerns she raises in relation to waiting lists and believe that it firmly impacts on each and every one of our lives. But does the member appreciate and agree with me that the absence of these institutions for 2 years and 3 years prior to that have contributed to the devastation inflicted on people and the huge and growing waiting lists that we face in Northern Ireland?
Can I thank the member for his intervention? I'm not interested in playing politics on this one today. It is extremely important for Northern Ireland that we now go forward with a plan to sort out this issue. And every day those people are in pain actually want us to do that. Northern Ireland can only do so much ourselves. We must seek to partner on a much larger scale with national or global providers that can work alongside us and provide the additional skilled staff required in the short term as we enhance our own capacity. Let me be clear, investing in our own staff and infrastructure is my preferred option, but the needs of our waiting lists and the urgent requirement to address capacity will take radical short-term solutions. And I know that some in this chamber may have an aversion to considering working alongside the independent sector, but I'm not necessarily even suggesting that we have to pursue private providers. There are a number of non-profit organisations from the United States, for example, which operate internationally. The Pittsburgh Medical Centre is a global non-profit health enterprise with 92,000 employees internationally, 40 hospitals and 70 cancer centres. It has partnered with a number of hospitals in the Republic of Ireland since 2006, providing state-of-the-art radiotherapy treatment in Cork and Waterford, and also involved in hospitals in Kildare and Kilkenny. There is an undoubted political and broader interest from the US in Northern Ireland's affairs, and perhaps there are ways we can encourage and harness that for genuine practical benefit and for the welfare of our patients. We should not underestimate the anxiety people experience waiting for a diagnosis or the impact on loved ones. We recognise that additional money alone is far from the answer, as Northern Ireland has already the highest per capita spend of the whole of the UK. But we must maximise the outcomes from investment. We must see more procedures per session. And it is surprising that this can happen in the private sector but not in our NHS. There must be a clearer separation between emergency and planned care.
Can the member bring her remark to a close?
Yes, I had assumed I was getting an extra minute. Because
not when you're moving.
All right. Sorry, thank you. And we need to sweat our assets. Can I take 2 seconds, Madam Speaker?
The member's time's up. Sorry.
Okay.
I'll call on Colin McGrath and move the amendment. Thank you. Colin, you'll have 10 minutes to propose and you'll have 5 minutes to wind. Please open the debate on the amendment.
Thank you, Madam Principal Deputy Speaker. There has been no greater issue on highlights how sick our health service is than that of the waiting list debacle. So the fact that we are raising that and discussing this so early in our return is welcome. People have been languishing for too long on waiting lists. And it's probably too simple to simply point to COVID and say that was the cause of any of the lengthy lists. It certainly didn't help. But the genesis of the problem goes back much, much further than that. To find the real answer, we need to delve into the strategy storage room in Castle Buildings, for it is here that we'll find the real cause of the problem. It's in that room that we will find many undelivered strategies, many that would have helped the waiting lists if they had been implemented. It's in that room that we would find many announcements to reorganise our health service. It's in that room that we would find plans that would reorganise and help if they had been enacted. But it's been the inactivity of Health Minister after Health Minister and Executive after Executive that has meant that we are where we are today with some of the longest waiting lists in Europe. I'll not, because you'll have your chance and I don't get any extra time. And just how bad is that problem? In September past, we had 116,000 waiting on an inpatient or a day case, 429,000 waiting on a first consultant appointment. That's 545,000 people here waiting to see a doctor with a population of 1.8 million. That's nearly 1 in 3 waiting. And the Sinn Féin DUP duopoly of power sharing, the stop-start government, which began whenever you took over back in 2007. Since then, waiting lists are 5 times longer. 5 times longer. That's not a success in government. That is an abject failure. That's an embarrassment. In Scotland, the figure is 627,000. Scotland has a population 3 times what we have here. In Wales, the figure is 734,000, and they have 1.5 million more people. And before we hear any of the Tories fund them as much as they fund here as well, so let's not trot out the old lines so quickly and have a look at our own actions as well. It is political inability to solve the problem above anything else that is causing and feeding the waiting lists. It is stop-go politics that is the major harm of our health service. It is a health service that is crippled, being unable to take decisions because there is no minister that is causing the real problem. Now, the solving of the waiting list crisis will require a 2-pronged approach. One side will deal with those that are on the waiting list at the moment and need to be seen and sorted. The other is to make sure that we never end up with the lists as long as they are and have been. And I'll come back to that shortly. But on the issue of the political inactivity, having no assembly, having no executive, no minister for health, I'm somewhat surprised that it is the party opposite that is raising the issues of waiting lists, given that they have collapsed the government in this place for the past 2 years. And of course, an executive partner that collapsed it for 3 years prior to that. I am in no doubt that that hiatus, that double hiatus, has seen many people die while they were on waiting lists. They will have died with their health issues unaddressed, left in pain, left suffering, left as a burden on their family because their health issues could not be addressed in a timely manner. I think that of all the parties that could have brought a motion on the state of our health service, that it is the party opposite that collapsed government here for the past 2 years, paralysing our officials from managing the health service properly and causing the environment that has driven those waiting lists up, is a bit of an embarrassment. If you cannot draw the line between inactivity and having no executive and no government and the driving up of our waiting lists, that shows a major disconnect from reality. But we are where we are. We have waiting lists, and I have mentioned before, I think there's a two-pronged approach that is required. We must see the cash injection that will allow the backlog to be cleared. Those figures need to be driven down, down, down. And that will only happen by either asking our already overstretched staff to do more, which I don't think is possible because many of them are driven to the edge, or else we will have to use our private sector. It does exist out there, and we will have to use it. But let's not fool ourselves. These places are often staffed by medics that work in the NHS as well. How many of us have had constituents that come in and say, I went to my doctor and he said that I can't be seen by a consultant for another 6 or 8 months, but he's told me if I can go private, I can be seen next week. And often it's the same people. So we need to clear the backlog, and we will have to use that private sector. And this is where our amendment comes in to try and help with that, by explicitly calling on the Health Minister to refund the cross-border initiative and allow patients to utilise hospital and health services that are often closer to their own home than the places that they have to travel to. The scheme was successful. It was used by hundreds, if not thousands, of people previously, and I think that there's an opportunity for that to help and assist. If we're doing something right, which we've done in the past, let's do it again. The second approach is that we need to sort out the mess and see true and meaningful transformation. It is only that transformation of our health service that will allow the waiting lists to never grow to the length that they grew to. We must transform so patient flow improves. Just a few months ago, there were 4,000 people waiting on a domiciliary care package. And how many of them lay in hospital when they didn't have to, but they couldn't get home because there wasn't the care package? And that backlog goes out of the ward, goes down into the emergency department, it goes out into the ambulances that are parked outside, and it ends up when people dial 999, they can't get an ambulance to come and help them. The backlog is a chain effect, and we have to break that chain. That needs investment. It means recognising and valuing our domiciliary care workers so that it becomes a career that attracts people. And our cancer waiting times are horrific too, with many of the established targets not being met. Just one example, breast cancer patients. The target, 100% of referrals to be seen within 14 days. We haven't reached that target in 12 years. 12 years from we reached that target. And another example that people won't probably think about as top of the list, but dental waiting times. Before we talk about dental waiting times, let's talk about getting access to a dentist. Many in our community struggle to get a dentist to register with. They struggle to get an appointment. And if you're NHS, forget about it. But what is it that is the problem? We don't fund our dental sector properly. It literally costs dentists to be able to deliver NHS work. Who is it that would go to work if it's going to cost them to do their job? That isn't a real-world model. It isn't working. And when it isn't working, it's people that suffer. So we need to see a transformation plan with a budget, with an action plan, with a time scale for implementation on that transformation. We need to see what the changes are, but crucially, we need to hear what the benefits will be. The public need engaged with and informed so that they can see that the loss of a service from one medical centre, the gaining of another service from somewhere else, and the inclusion of a different one or a changed one, that will mean better services, better delivery, shorter waiting times, improved outcomes, and happier, healthier people. Then the waiting lists will come down. And then this House, if this House is to be an effective, proper, legitimate scrutiny chamber, will never let the waiting lists get to the heights that they have gotten to. Thank you.
I call the chairperson of the Health Committee, Liz Kimmins.
I welcome this opportunity to make some remarks as Chair of the Committee for Health before speaking as my party's health spokesperson. Tackling waiting lists will be a key priority for the Health Minister in the coming years. The Audit Office report on tackling waiting lists, published in October 2023, outlines some of the key challenges for the Department and the Minister. It outlines waiting time targets have not been achieved since 2013-14, and that the Department has already stated that the current framework will not achieve its waiting time targets by 2026. So we can't keep doing what we're doing and expect lists to get shorter. As of the end of September 2023, we had 428,858 patients waiting on a first consultant-led outpatient appointment. That's up from 127,095 in March 2014. In 9 years, that's almost 1 in 4 of our population waiting on a first consultant-led appointment. We have 115,929 patients waiting for inpatient or day case treatment, up from 49,341 in 2014. That's 1 person in every 16 of our population waiting for treatment. And we have 188,850 patients waiting for diagnostic tests, over double from what it was in 2014 at 69,042, and that's 1 in 10 of our population waiting for tests. Due to the size of these lists, it can be easy to get lost in the statistics, but the reality is that each of these numbers are individuals in our families and our communities. Each of these cases are on these lists for a reason, and they need to be seen by the experts as quickly as possible. Unfortunately, due to the size of the list, people are waiting for record times. The number of people having to wait over 52 weeks for an initial appointment or for treatment is at an all-time high as 69.8% of people waiting over 52 weeks for ear, nose and throat treatment. As individuals wait on these lists, conditions are getting worse. People are experiencing pain. People are understandably concerned about their condition, and this does have an effect on well-being and mental health. And it can be a bit of a postcode lottery in relation to waiting times. For example, if you live in the Belfast Trust area, 33.8% of people will wait longer than 26 weeks for diagnostic tests, whereas it's only 13% in the Northern Trust area. We do need transformation of the health system and long-term investment in the health service to allow the very capable and committed surgeons, doctors and nurses to deliver the service they want to deliver. We need to ensure we have the right infrastructure and resources to treat our most vulnerable people. We can't allow people to go on waiting lists and progressively get worse while they wait for the treatment they need. But that will mean needing to take tough decisions on services. That will mean learning from best practice across our trusts and further afield. That will mean the need for a fully resourced multi-year budget. That will mean training and recruiting more surgeons, doctors and nurses. In the coming weeks, the committee will hear from the Minister, the Department, the trusts and other key workforce stakeholders on waiting lists. The committee will undertake its scrutiny role and look forward to considering any action plan that is brought forward by the Minister to address this issue. I'll now make some remarks. Can Corla, as Sinn Féin Health spokesperson on this. And as we've discussed, waiting lists have continued to soar, particularly in the last number of years, and we're seeing some shocking figures over a short period of time. As people face unprecedented waits for the surgeries and treatments they badly need, inevitably causing their overall physical and mental health to decline further and creating additional pressures on our already struggling health service. In NDNA, commitments were made to prioritise tackling wait lists, yet 5 years later, not least due to cuts to the fund by over 30 million in an effort to manage budgetary pressures, but also as a direct impact of the COVID pandemic. I will, yeah.
I thank the member for giving way, and I couldn't help but think when she was talking there about Daisy Hill, which is obviously close to both our hearts, being near Armagh and Southdown, and she'll agree with me, Daisy Hill is strategically placed on the Belfast-Dublin corridor. I think roughly 3 million people can access it within 90 minutes. Would she agree with me that it is positive that Daisy Hill is now an elective overnight surgical hub, but that it can do so much more in terms of playing its role in tackling waiting lists? And what we need to see is the Minister publishing a plan for actual investment in Daisy Hill so that it can actually help to address some of the issues that we're speaking about today in terms of waiting lists.
Members, an extra minute.
I thank the member for intervention. I think that's a critical point. As she has alluded to, Daisy Hill is a hospital very close to both our hearts, but a very, very important hospital in our hospital network, and can offer so much to tackle the issues that we're dealing with here today, with the fantastic staff and services, and most importantly its key location in relation to on an all-island respect as well. So I think that's a very, very important point. But fundamentally, if we are to tackle the huge problem of waiting lists, then we need to address the workforce crisis that is impacting right across our health and social care system. If we do not have the staff required to deliver the services needed, that means the domestic staff in our hospitals, theatre nurses and doctors, specialist surgeons and consultants, auxiliary staff, domiciliary care staff and rehab staff, all of those staff who cover a wide variety of roles which a patient will come into contact with on their journey before, during and after they receive the surgery or treatment they've been waiting on, then this problem will only get so much worse. It is positive that the Executive has prioritised public sector pay, and I do hope this will go some way to ensuring we can retain the fantastic staff we currently have and in the longer term attract staff to fill the thousands of vacancies that continue to exist in every corner of our health service.
To a close, please. Time's up.
Can I have an extra minute? Oh, sorry. Thank you.
Okay, I call upon Deputy Chairperson of the Health Committee, Donny Donnelly.
Madam Deputy Chair, and could I thank Mrs Dodds and Mr Robinson for bringing this motion to the Assembly today. I look forward to working with both of them as fellow members of the Health Committee. On behalf of my party, we will be supporting this motion. Mr Speaker, Madam Deputy Speaker, the current waiting times in Northern Ireland are deplorable and unacceptable. As it is stated in the motion, none of the formal waiting targets for health and social care services in Northern Ireland have been met since 2014. Some of the more specific statistics are truly shocking. The Northern Ireland Audit Office report has highlighted there just how rapidly the number of people on waiting lists has risen. For example, since March 2014 to March 2023, the number of people waiting for an initial outpatient appointment has risen by 216%. The number of people waiting for hospital admission has risen by 147%, and the number of people waiting for diagnostic tests has risen by 151%. The same report also highlights how these numbers will only get worse without imminent action. For example, the Department of Health's elective care framework has projected that the outpatient waiting numbers could grow by 91% from 335,000 in 2021 to 640,000 by 2026. And the inpatient waiting list could grow by 206% from around 100,000 in 2021 to 306,000 in 2026. These numbers are surely not sustainable in a population of approximately 2 million. Madam Deputy Speaker, these are huge numbers, but it shouldn't be lost on any of us that these are our families, our friends and our neighbours and people in our communities. These are people living in pain, losing their mobility and suffering from mental health issues and loss of well-being while they're waiting on tests to see whether or not they may have a very serious illness. Previous attempts to reduce waiting times have not been successful. Previous departmental initiatives, such as the elective care plan in 2017, with a target of ensuring that all patients would be seen within 1 year, did not meet its prescribed targets. On the basis of the aforementioned 2026 projections, the department will not meet its targets as set out in the current elective care framework from 2021. We need to ask why waiting lists are so long in Northern Ireland, especially when compared to the rest of the UK and Ireland. Many of the issues facing Northern Ireland and our health system have been national or international in nature, such as the impact of austerity, Brexit and especially the COVID pandemic. But when we don't see such devastating numbers in England, we can't ignore or forget the damage done by political instability in this place, particularly the fact that we have not had an executive, a health minister or a health committee for 5 out of the last 7 years. And 2 of the years when these positions were filled, they were understandably had to prioritise managing the pandemic, making meaningful reform impossible. It is welcome that we are back in this chamber and debating this and other vital issues, but until we have a truly sustainable political system, we will not be able to deliver the transformation that is urgently needed. With that in mind, we must reform these institutions to ensure that never again one party can hold down the entire political process. It won't be lost on anyone that the waiting lists have got much worse during the period when the Assembly is not functioning. But there are a number of key issues specific to the health system I would encourage Minister Swan and the Department of Health to consider. One of the reasons why our waiting list is so long is because too many people are referred on to them in the first place, rather than being diagnosed or treated quickly along a more appropriate pathway. As highlighted in Bengoa report, the majority of HSE resources are invested in delivering acute care, and as a result, some services have been delivered suboptimally. The evidence is clear. Specialised procedures concentrated on a smaller number of sites and dealing with a higher volume of patients will improve outcomes. We support such reforms, focusing on providing diagnostics and treatments far more quickly, especially within primary care, and this will assist in bringing down waiting lists. Another issue remains the difficulties around recruiting workforce and vacancy levels in particular. On the 30th of September 2023, there were 6,920 HSC vacancies across Northern Ireland, a vacancy rate of 8.2%. This represents a 14% increase when compared to September 2018. A major issue remains the lack of legislation on safe staffing and adequate pay, two very important issues that I would encourage the Minister to bring forward legislation on before the end of this mandate. But we have other issues specific to Northern Ireland. For example, the higher wages available in the Republic of Ireland has led many consultants to work there while continuing to live in Northern Ireland. This has exacerbated consultant vacancies. On top of those other factors is the intensity of COVID-19 pandemic, which our health service has not fully recovered from. I know these issues are well known to the Health Minister, and I look forward to his plan for beginning to address and progress and transformation. Thank you.
Thank you, Donny Cullinan Chambers.
Madam Principal Deputy Speaker, and I welcome the chance to participate in this important debate. It's been 2.5 weeks from the restoration of the Assembly and the Executive, and today's debate, I hope, will act as an important and early opportunity for all parties around this chamber to put on record their commitment to making tackling waiting lists one of their greatest priorities. Northern Ireland waiting times position is utterly abhorrent. It's outrageous as much as it is morally intolerable that we have so many people on waiting lists. We must also never forget that with the passage of time, it is recognised that some patients come to even greater harm while they endure the stress and pain of delay. I'm sure every MLA in this Assembly will know a friend or family member on a list for either a consultation, a test or a procedure, and similarly, we will all have been shocked by stories, experiences and sometimes delays encountered by our constituents. But as the motion rightly puts it, our waiting times have been falling behind for the last decade. There are lots of reasons for that, but I'll only mention two. Firstly, decisions were consciously taken at that time by previous ministers and senior officials to no longer bridge the gap between limited capacity and increasing demand with additional funding allocations.
Would the member give way?
I will.
Would the member agree with me that the issue has been that there hasn't been the support given to the Health Minister during the previous period of time, and what we need to see now is a dedicated commitment from all executive parties and everybody around this table to be able to support our Health Minister in his difficult task?
I absolutely concur with those remarks. Whilst I understand that the Executive was facing financial constraints of its own, such unilateral cessation of funding put many waiting lists into a tailspin. And as I said during the budget debate yesterday, what would benefit the health service most is longer-term funding certainty. But in the absence of that, specific waiting list initiatives would have been critical in slowing the tide. And secondly, an equally damaging slate of decisions or steps were taken in relation to workforce. Critical training positions were either reduced in number or didn't keep up with the rate of expansion which was necessary. That unfortunately left a workforce too small and too fractured to be in a position to reverse what very quickly became a rapidly deteriorating waiting list position. Whilst I note the motion is asking for an action plan within the next 6 weeks, with respect to the proposers, we don't need any more words down on paper. We need focused and targeted delivery of what has already been said is deliverable and to which all political parties previously give their support towards. The proposer mentioned the capacity available within the private sector. I suspect that the Minister would love to take up the offer over the next 6 weeks if he had the money. And whilst every so often there is a glimmer of hope, such as the restoration of pay parity in January 2020 or a big expansion in training numbers, sadly the failure of politics often gets in the way of permanent improvements and regression creeps back in. I'm really fearful that in the time ahead that we will look back to the most recent 2-year period of political stalemate and the 3 years that happened from 2017 to 2020 and see just how much enormous physical and mental harm was inflicted upon so many of our people. Whilst there have been some hugely welcome progress made with the strategies and action plans published in 2021 and 2022, Like so many other important areas of work, they suffered as a result of funding uncertainty. And of course, it's not just those people stuck on a waiting list that have to endure the fear and the concern of delay. We should never forget the moral distress being felt by clinicians. They can see the needs of their patients, yet all too often they know that the patient isn't getting the support they need, that their skills and judgment tells them is really necessary. That is why it would be unforgivable if we didn't best maximise every single opportunity available to us, both within and outside of the health service here. The proposer, in her opening remarks, referred to uncomfortable truths. There should be no doubt that our absence from this chamber for 5 out of 7 years has not been helpful to any of our public services. We owe it to the people of Northern Ireland to work together to pull our health and social care system back from the brink. We will only achieve this by working together and not making health a political football. However, I have a sense that we may drift into that situation. The public of Northern Ireland will not thank us for doing so. Thank you.
Thank you. Our next speaker is Orlia Flynn.
And I speak in support of the motion and the amendment today. And obviously, just to say at the outset that we all know that the current situation in relation to our waiting lists at present is completely untenable for both patients and for our staff. I know that some other members have mentioned cancer, domiciliary care, gynae and oral health. But I would also like to say that we know that mental health and physical health are obviously very intimately linked. And I do want to touch on the fact that the long waiting lists also for mental health services in particular are also unacceptable at the moment. Poor mental health alone, aside from the elective care and the physical mental health, is costing the economy here $3.4 billion each year. And 1 in 10 of our children and our young people at any time are experiencing anxiety or depression. We heard recently, it was carried in the media, it was last week or the week before, the figures that 10,000 children have sought mental health support last year, and a third of those were still waiting on their first appointment just by the end of 2023 there. So I know that the motion also does refer to the fact that people need to receive that same time access regardless of their postcode or where they live, and we all know that at present that's clearly not the case. And just to go back to the children's mental health story that was covered the other week, again it just shows you how waiting times are varying between the trusts. So the average waiting times was going from 5 months wait in the Belfast Trust to less than 9 weeks wait in the Southern Trust area. So it's definitely an issue that we need to grapple with because it's not fair. And some children are literally waiting years on getting mental health supports. The longest wait was within the Belfast Trust, that some children were actually waiting nearly 2 years. And I think, like, obviously in terms of protecting our young people and looking out for our children, I think that these waits are just wrong, and no family, no child should be waiting that long on a waiting list. Again, the CAMHS funding at the moment is approximately 20 to 25 million per year, which is around, it's between 6.5% and 8.5% of the overall mental health budget. And I know that the mental health strategy, the hope is to try and increase that percentage of the budget up to 10%. So I'm hoping that that will be the case in the time ahead, because again, that will help with the overall waiting lists. The recent workforce review that was done in terms of mental health has shown that we need almost 2,000 additional workers to provide adequate mental health services. So again, when we're talking about, in addition to funding for waiting lists, which absolutely is an immediate priority, we also need the additional funding for additional training places and for our workforce. And again, in terms of mental health, that would be specifically around psychology and psychiatry services. Yes.
I thank the member for letting me intervene. I know mental health is a real passion of hers, and would she agree that also we need to ensure that the community and voluntary sector are included in terms of mental health provision as well in our communities?
The member has an extra minute.
Yes, thanks very much for the intervention, and I completely agree. And my next point was actually coming on to the early intervention and how we can get in there, you know, in some avenues, get in there quicker with children to try and prevent them ending up going on to different waiting lists for different issues when they grow into adults. So the community and voluntary sector are critical to all of that as well. So thank you very much for that. And again, it's important that people are getting provided with the right support at the right time. So regardless if you're starting off with a mental illness or a mental health problem, that will have an impact on your physical health the longer you have to wait to be seen. And then vice versa, if you're on a waiting list with a physical health problem and you've long delays to be seen, then that can also impact on your mental health. So we need a two-pronged approach to try and help and support people with both physical and mental health issues. And then again, just some stats on the waiting list for adult mental health services. We know that they've almost doubled over the past 4 years. The number of young people waiting for access to CAMHS has tripled over the past 4 years. So again, someone had mentioned earlier, we need to be making sure that it's not coming down to people's personal finances in terms of how soon they can be seen or how soon they can be treated, because we know that not everyone can afford it. And the people who can least afford them and pay for them are sadly the people that are living in our most deprived areas here locally. And again, just, yes.
I would agree with the member, and I think it should be noted that Northern Ireland households have the lowest disposable income in the UK as a whole, and certainly we have lower capacity to access private medical health care. So although I'm personally aware of people who have used large chunks of their savings and even borrowed money to access medical care, would you agree with me that this has created a two-tier health system?
It absolutely has, and it's completely unfair, I think, to expect any family, especially families who don't have the means and don't have the finances, to try and have that additional pressure of trying to pay to get their loved ones to be seen and treated in terms of their health care. I think I'm out of time, am I, Chair? No. Okay, so yeah, look, maybe just to finish off then, I know that the motion was saying it does recognise the impact of the mental health and physical health in terms of our patients, but we know that everyone that's out there and that's watching this debate at the moment and who are waiting on these waiting lists, it's having a massive, massive impact on their lives. And I think that, especially in terms of the amendment as well, any practical steps that we can take and the Minister can take and the Executive can take to try and help with these waiting lists, I think we need to make that a priority for everyone. So grateful for the motion today and in support of it.
Since this is Alan Robinson's first opportunity to speak as a private member, I would just like to remind the House that the convention is that someone making their first speech is made without interruption. Alan Robinson.
Thank you, Principal Deputy Speaker, and my congratulations to you in your recent elevation to this House. Before I begin my remarks on this very important topic, can I just step back 2 years to offer my appreciation to those across East Lothian who ensured that there would be 2 members of my party to represent their interests. I would also like to pay tribute to George Robinson, MBE, whose seat I replaced. George served 18 years in this place and began his almost 2-decade stint in here at a very youthful age of 62. Unfortunately, having enjoyed only 11 months of retired life, he was struck down by ill health, but typical of the man that George is. He's fought his way back, he's living independently again, he's back to driving, and he's back to enjoying and following local Irish League football. And I'm sure this House, especially those to my right, will extend its good wishes to him as he returns back to good health. Given that this is my maiden speech, I suppose it allows me to speak a little from a very personal perspective today, and it allows me to express my frustrations as someone with long-standing health conditions and with having been on multiple waiting lists and having just recently been put on yet another. Today we will all be able to share stories of constituents who have visited our offices seeking assistance in the hope of climbing a lengthy waiting list. All of us can give accounts of people who we represent having no other option but to part with their life savings or to borrow many thousands of pounds for urgent treatment, forcing themselves into a world of debt. Good, decent, salt-of-the-earth people who may have worked themselves to the bone all their days, who paid into the NHS only to be let down. And I mean this with the greatest of respect, but while they part with money they can ill afford, others cannot. They descend into greater ill health, which ultimately becomes more complex and expensive to treat, and some even die. That's the stark reality that we're dealing with. And whilst we could all fill the business of today with examples of human suffering, we must also deal in the hard facts. We've heard earlier, as of September last year, 429,000 people were waiting on a first outpatient appointment, of which half were waiting a year. Some of those people will die, and at best their quality of life will be poor. And those waiting times are the worst in the UK and amongst the poorest outcomes in Western Europe. And we heard earlier that a quarter of all cancer diagnoses between 2012 and 2017 were made in EDs. And that's a postcode lottery that has been played out in relation to cancer wait times, with the Western Trust seeing much better performance towards meeting targets than other areas. I could go on and on and on here today, but I just simply don't have the time. The new Health Committee meeting heard last week the stark reality that we all must bear. 34 million from the British government to tackle waiting lists is nowhere near enough, and indeed it would take hundreds of millions and even years to properly address. And that's not my words, but it's the words of the CEO. And that brings me to my own personal experience. One such waiting list that I was placed on several years back, where my GP had initially told me that I would have an 18-month wait. 18 months came and went, 19 months, 20 months, 21 months. And when I became aware that the consultant carried out work in the private sector, I queried, merely out of interest, how soon I could be seen. Could I attend next Thursday? Was the answer from the consultant's PA. Could I attend next Thursday? So the take-home message for me was that the wealthy can stay healthy, whilst the rest of us just have to wait. But the right to health should belong to everyone. But it also showed me that the capacity within the private sector is one that should be grasped. The use of private hospitals and providers across the British Isles and further afield is critical and looks like the only short-term option. This should not just be focused on surgery, but the full suite of professional skills and services needed to reduce the current backlog. I accept that there have been gains in recent times with the ongoing development of dedicated elective sites, including regional daycares and overnight stay centres. However, significant further expansion is required if we are to see better progress in dealing with waiting list backlogs. We must maximise outcomes from additional investment. Continuing with the same level of small contracts with independent providers cannot deliver the tangible progress that we crave. The Department of Health must be seizing opportunities to forge larger national and global partnerships with NHS in other parts of the UK and independent providers to crack down on waiting lists. We owe it to the thousands upon thousands of our constituents.
Time's up. Thank you. Colin McAllister.
Thank you, Principal Deputy Speaker. I rise to support the motion today. I'm grateful for the member who brought it forward. Indeed, in our first committee meeting that we had last week, it was an issue that all of the members shared, and we look forward to having the Minister at Health Committee to discuss plans to tackle the waiting lists soon enough. And as I said yesterday, or last week, when we spoke about health and the Women's Health Strategy, we recognise, Minister, that you're only in the post a number of weeks. But you were Minister for a number of years before suspension, so I don't doubt that you can really hit the ground running and that you will come back to us, maybe not 6 weeks, but hopefully soon enough, to actually set out what actions that we'll take to drive those waiting lists down. We've heard from many people in the Chamber today regarding the waiting lists. Despite us spending more per head in Northern Ireland than anywhere else in the UK, we have by far the longest waiting lists. And often those who have the means to pay go private, further exacerbating the problem, because as the previous speaker just said, and I assumed what you meant was it was the same consultant that you were waiting to see through the NHS, but you could pay private and see them quickly. Where is the equity in that for the people of Northern Ireland? We really need, as many speakers have said, an NHS which is free at the point of entry from the cradle to the grave. But one of the reasons that I want to focus on why the waiting lists are so long is because there are no spaces in our hospitals too, because their bed capacity is just maxed, and it's because people cannot be discharged on time. We have seen in recent years, especially around the Christmas period, when times are really tough, of families being asked to come and pick up loved ones, maybe look after your loved ones more at home, But really, we shouldn't have to do that in this day and age, rely on loved ones to actually take that care of people who deserve it, whether it's in hospital or in their own home. But why are we at that situation? Because domiciliary care is not sufficiently funded, but also it isn't sufficiently tackled in terms of how we appreciate that service. When we pay people the lowest of wages, what do we expect? They're not going to stay. They're going to go elsewhere, and so further exacerbating the problem again. We need to invest in the workforce when it comes to domiciliary care, so those who can enter either through short stays at rehabilitation or at home could actually be sufficiently targeted with doing that. I also raised at the Health Committee last week the options around domiciliary care and where we go with the future, and in particular the 15-minute wait. We all know elderly loved ones who do not want to have people come into their home to take care of them, but they need that, and so they accept it. But when they have people coming in, dropping and going, just doing a check, 15 minutes and out, that's not the service that really we expect. And I did raise that issue of the 15-minute visits, that can we get to a point where we move on from that? But investing in that service, investing in the workforce, upskilling people will really help to create that bed capacity and get people off the waiting lists. Yep, of course.
I think she raises a very important point, and it comes back to the issue of workforce. And I think therein lies the problem. To start to address the workforce crisis, we first need a plan to do this, and we need to see that plan. And I understand there are reviews going on, but we need to see a plan published, and we need the proper funding to support this. And that's why we need to continue making that case to the British Government to be properly funded here, so we can deliver on all these things.
No, I would agree.
Has an extra minute.
Thank you. I would agree, and I don't doubt that the Minister also agrees that the British Government should fund us to our level of need, and we will continue, like all executive parties, to make that case. And I was actually going to bring on to the issue of the Audit Office report in 2023 on tackling waiting lists. A number of people have mentioned it here today, and I hope that perhaps the Minister can give us an update on where we are with 9 of the recommendations within that report. We have a number of organisations here in Northern Ireland who do a lot of work for people within the sector, whether it's CARS NI, the Royal College of GPs, the Royal College of Surgeons, who all have their own thoughts on how we can actually move forward. But we need to listen to them. They are the experts. They work with people every single day. And in fact, one of them, the Royal College of Surgeons, did say that over the next 4 years, 91% we could potentially look at, 91% of surgeons retiring. Where is the succession planning? Where is the workforce training to ensure that there is not a huge gap there and further exacerbating the waiting lists even more? I want to talk about where we should go. We should go to a situation, and Alliance would like to see the policies that are kind of implemented in some of the Nordic countries. We have the 7 and 1990 process for non-emergency care. You see your GP within 7 days, a specialist consultant in diagnosis within 90, and treatment for that within a further 90 days for non-emergency care. That's the long-term vision, and I recognise there's a lot of work to actually get there in the process. But I recognise that this will not be done just by parties speaking up in the chamber. It needs to be done by leadership from the outside too. And I would call on all parties, not just within the executive, but actually the opposition parties too, to get behind the issue of reform in healthcare. I mean, I understand what the members from the opposition said, but whenever members such as Justin McNulty stand up at meetings regarding Daisy Hill Hospital, mocking Bengoa, what does that say about the opposition's credibility in leading on healthcare reform? We need to be serious. Well, I will, because I mentioned you, but I know I'm running out of time.
How can the member dare to deride me for standing up for the people I represent and who deserve equality in the healthcare system? How can you possibly dare say that you stand here and deride me for standing up for the people I represent and the patients who are struggling and dealing with their inability to access healthcare systems, healthcare the way everybody else can across the north? I think that's very
The member's time's up.
Well, thank you.
A call on Gary Middleton.
Principal Deputy Speaker, and can I congratulate you on your elevation to the position, and also congratulate my colleague Alan Robinson on his excellent maiden speech today. I want to begin my remarks by paying tribute to the fantastic and dedicated health and social care staff right across Northern Ireland. Many of them are working in conditions which actually are very difficult and stressful, and I want to put on record, obviously, our thanks to them first and foremost. As others have mentioned, it is the sad reality that here in Northern Ireland our waiting times are not only the worst across the United Kingdom, but indeed are the worst, or some of the worst, across Western Europe. Over a quarter of Northern Ireland population are on a waiting list. It is also the sad reality that a growing number of our constituents and people within our communities are dying whilst languishing on waiting lists. The findings of the Northern Ireland Audit Office report sends a stark signal of the need to urgently address the missed targets and the ever-growing waiting lists across the board. Of course, I have particular concerns around cancer targets. The latest figures I have is that only the Western Trust met their target for patients being diagnosed with cancer receiving their treatment within 31 days. Of course, as a Foyle MLA, I welcome this particular position and the target being met within the Western Trust, but the reality is that there's many different pictures across other trusts in Northern Ireland. Just 34% of patients urgently referred by a GP with suspected cancer began treatment within 62 days. That's against a 95% target. Western Health and Social Care Trust figure was 44%, whereas the Belfast Trust had the lowest percentage at just 22.6%. And of course, there are big disparities as well across the various specialisms within the sector. Just 52.9% of those patients were seen within 14 days of their urgent referral for breast cancer, against the 100% target. And unfortunately, no trust achieved that target. So this postcode lottery of services is simply not sustainable. Yesterday in this chamber, we spoke in terms of the economy and the need to address regional balance. Of course, we need to ensure that the health system is addressed in terms of regional balance and regional inequalities across the health sector. There are similarly concerning statistics right across all levels of the health and social care system. We heard today of the mental health services, drug and alcohol services. People are waiting extraordinary amount of times to access services which would no doubt go towards improving their life or actually saving their lives as well. I will indeed give way to my colleagues. Sorry.
I thank the member for giving way. While people are on waiting lists, and I'm glad he mentioned about drug and alcohol services, while people are on waiting lists, they obviously have a deterioration in their mental health, and some of them do turn to drug and alcohol abuse, and therefore that will be more of a cost to our health service while they're on a waiting list. We're actually seeing a problem in other services as a result of that.
The member has an extra minute.
And can I thank the member for that intervention? It's a very timely point because the member touched on the community and voluntary sector earlier as well, and the various organisations who can help alleviate the pressure and ensure that there's not a greater cost going down the line. The problem that I and the concern that many of us would have is that the cost ultimately could be a life. And I think that that's something which would concern us all. But I also want to raise the need to address urgent and emergency care as well in terms of our emergency departments. There's frustration at the amount of people, unfortunately, who can't get access to their GPs. The statistics that I have, it said that almost 20% of attendances had been referred to your emergency departments by GPs. That only accounts for those who actually were referred. There's many people, unfortunately, who actually can't get through to a GP, so they themselves just present themselves to the emergency department, even though that mightn't be the most appropriate place for them to be. Does the member? Yeah.
No, his time is running out, so I'll just make a quick point in relation to access to GPs. As others have said, when people are waiting on a waiting list for long periods of time, they start to develop other conditions which will require them to present to their GP or to the emergency department more often. And with that said, do you think then do you agree that we should be using all those tools that are readily available to us to reduce waiting lists in the here and now, including the reinstatement of the Cross-Border Health Directive, which we know has been very successful and works well for our constituents right across the north?
Yeah, no, absolutely, and I think that we need to look at every type of initiative. We see even within our GP services the use of multidisciplinary teams. There's various mechanisms we need to use. We can't rule things out. We need to be looking at what's the best possible outcomes for our constituents. Just in closing, the Audit Office report obviously sets out a number of recommendations. I think at this point, and I agree with members, we have had a lot of strategies. We do need an action plan. We do need something we can point to and say this is now the course of action we're going to take. We've waited far too long for our waiting list to be addressed. I think now's the time to bring forward that action plan and ensure we can deliver for our constituents. Thank you, Principal Deputy Speaker.
Thank you. Can I call upon Paula Bradshaw, please?
Thank you, Madam Principal Deputy Speaker. I rise to support the motion and the amendment. I will be focusing on what we've learned from the audit report and also from other reports and evidence on how we could do things differently. So the Audit Office report does refer to the need for extra money, and we need to be clear about one thing. The Department of Health already spends approximately £4,000 for every person in Northern Ireland, and I appreciate that we have an ageing population and that multimorbidities and more expensive treatments, for example, but we do have to recognise that we cannot continue to have a greater percentage of the overall budget share, and we need to be using our money more efficiently. So I want to ask the Minister if he could outline, if not today, sometime in the future, how he's going to ensure greater financial accountability in terms of commissioned services within our trust. Those who were on the former Health Committee and others who are watching this will know that if the trust is given a certain amount of money for a certain number of orthopaedic surgery, for example, for 30 and they only deliver 20, they don't have to give the money back for the 10 that they didn't deliver. Now, I have no doubt that the trust has used the money efficiently and for good ends, but there's no accountability and transparency in terms of the use of that money. And that leads me on to the second point, and that's really about the use of locums. I met with the former Chief Executive of the Belfast Health and Social Care Trust in 2016, I think, and he at that time said that we need legislation here in Northern Ireland to put a cap on the amount of money that's spent on locums. That was 8 years ago, and I very much take Colin McGrath's point there around the stop-start nature of our politics here, but we need to be looking at the amount we're spending on our locums. The third point I would make under this is the effective use of our consultants' time. So as people will be aware, consultants are given a certain number of slots a week that they have to deliver. If they use one of those slots travelling down to Skillen, spend some time doing it and travelling back, then they've lost 2 slots in the week. So I think we need to be looking at better use of our consultants' time. Moving on, Principal Deputy Speaker, we have heard a lot of quotation here today around how many people are on the waiting list, but we're talking about cases rather than people. Some people may be on 3 or 4 waiting lists. So I would appreciate if the Minister could tell us how he is going to use that information, bring it forward, so that we have a far clearer picture, because it is ludicrous that we would have so much of a percentage of our population on waiting lists. We need better clarity of how that information is collected and presented. Moving on then as well, my party will be supporting the amendment for the cross-border healthcare directive, but people need to be clear. What that means is that we are using public money from Northern Ireland to pay private hospitals in the south. And I have many constituents who are delighted about that scheme and want it brought back, and I want to see it brought back. But as the I'm going to allow an intervention from the proposer of the amendment, whether you would also be in favour if we extended that scheme so that anybody on the waiting list can use any private provider across these islands, north or south. Is that what the amendment's about?
It's about making sure that we drive those lists down by using any opportunity that there is and use any weapon that's at our disposal. People can't be on waiting lists any longer than they currently have been.
The member has an extra minute.
Thank you, Principal Deputy Speaker. So if the Minister can refer to that. I've never got a straight answer from the Department of Health, Deputy Speaker, as to why, if we're OK sending money south, and I have no problem if it gets people in my constituency off the waiting list, why we would not afford the same opportunity to private providers in the north to drive our waiting list down. So I would like an answer on that. The last area I want to focus, 2 last areas, and my colleague Nuala McAllister briefly referenced it. And these are very crude figures. It costs £700 per month for domiciliary care. It costs £700 per week for a nursing home, a care home, and it costs £700 per night for a hospital bed. So I would like the Minister at some stage, probably not today, to bring forward his plans for how we're going to bolster our social care sector here in Northern Ireland. I have no doubt that that needs a lot more investment, but I would like to see those plans. We had part of the people in 2016, and whilst there's been great work by the departmental officials, etc., we need firm action, and I would pick up Alan Chambers' point around that. Let's stop talking about it, let's get on with it. And the last thing I would like to say is that we as a party want to see transformation. We want to see Bengoa delivered. We very much have always supported the elective care framework, but we want to see the long-awaited hospital reconfiguration design plan. We need that consulted upon. We need to bring forward the plans, and that, again, action, not words. Thank you.
Thank you, Pauline, and I call Sinead McLaughlin.
Thank you, Principal Deputy Speaker. Imagine that everyone in this chamber knows someone who's waiting on a health procedure, whether it's a family member, whether it's a friend, or whether it's a colleague. We have all seen people wait an interminable amount of time for operations that they should be able to expect in a matter of months. I've lost count of the number of constituents that I have met who are wrecked with stress, anxiety, waiting years in an appointment that could be life-changing, but feels like it may never arrive. Last week we debated the priority given to women's health, and one such area of waiting lists is the gynae services. Responding to a survey that I delivered last year on women's experiencing accessing care told me that her long wait, she said, "It has taken me almost 4 years to get some form of outcome, even though I still believe that they have misdiagnosed me. I am worse now than when they tested me, but I am told a long waiting list is ahead again." This is really a moral outrage in 2024. It's a fundamental failure in government. And I welcome the urgency of this motion, but with the greatest respect, never mind the 6 weeks from now, we should have been here to deliver 2 years ago. The consequence of this latest collapse, and indeed the one before, had been that we have let more people wait in agony in a two-tier system, that where only those who can afford to be seen actually get through the door. These are the human consequences of constant collapse. It is yet another reason, in case we need any more, why we should really commit to never collapsing this place ever again. The transformation of our health service will take time, now much longer than it could have otherwise have taken, but in the meantime we need to follow what works, and that includes restoring the Cross-Border Healthcare Directive. We are one island, and we all know that health problems don't stop at borders. Brexit was a serious blow for our health service, not only because it removed the Cross-Border Healthcare Directive, but it also, under the freedom of movement, we had the ultimate cross-border healthcare directive for our medical professionals, and that is really something that we are all feeling and we all regret, and has added to the waiting times. Now, the very least that we can have is an arrangement again with our closest neighbours. This is sensible and it's practical step that could make a real difference to people right across our communities, and I know that it has served many of my constituents really well.
Will the member give way?
It certainly will.
I thank the member for giving way. Would the member agree with me that the announcement made by the UK Government yesterday about care workers and others not being able to bring their family members with them is utterly punitive, flies in the face of any sort of realisation of the struggle of our health and social care right across the UK, but also in the north? And would she agree with me that that needs to be rescinded at the earliest opportunity?
Sinead, you have an extra minute.
Thank you. I absolutely agree with the member. It's self-sabotage. It's unbelievable that any minister would take that tone and direction when the health service is in complete, disarray right through Tory government. That's all I can say. In the Western Trust alone, more than 700 patients benefit from the Republic of Ireland reimbursement scheme. Restoring it is just common sense, and I hope members from across the Chamber will support it. Of course, this is just one measure that will take while we grapple with the longer-term transformation of our health service, that we can bring down waiting lists once and for all. It will not solve this crisis overnight, which is the product of decades of underfunding, political collapse, dysfunction and poor accountability, but it will make a difference for some patients. Mr. Speaker, Principal Deputy Speaker, the motion rightly calls attention to regional disparities in access to our health service. It is true to say that there are huge imbalances in our health outcomes. Although this is a crisis that affects almost everyone, it doesn't affect everyone equally. In recent years, the figures actually show that the male life expectancy has declined in the most deprived areas of Belfast and Derry. While in the Western Trust, male life expectancy is almost 7 years lower than the Trust average, and 24 of our health outcomes are worse than the Northern Ireland average. In my city and region, we have a crisis of addiction and poor mental health, driven by poverty and the failure of government to address that poverty. Yet it appears our health service provision has been regionally blind, failing to step in to address the disadvantage with a weighted deprivation formula that is not apparent at all and that actually fuels the poor health outcomes. We actually need a different approach, one that prioritises disadvantage and directs investment where it is most required. So, Deputy Principal Speaker, I hope that this motion is... Sorry? I want to get this finished off, sorry. I hope that this motion is supported across the House, but more importantly, that it actually leads to change for patients who are desperately in need. And finally, can I thank our healthcare workers right across this province who are doing amazing work under very difficult circumstances, and a call out to our community and voluntary sector who have stepped in and have lost funding over the years and also deserve our grateful thanks.
Members, time's up. Thank you. And before I call the next speaker, which is Saoirse Eastwood, can I just say that Saoirse Eastwood, Justin McNulty and Jerry Carroll are being included on the speakers list known as a grace period. So if you take an intervention, you won't get an extra minute. So if that's understood, I'll call Saoirse.
Thank you, Principal Deputy Speaker. I just wanted to take the opportunity to speak on behalf of my constituents who are impacted by cancer. This is something that impacts everybody across Northern Ireland, and at the minute we are dealing on a constant basis with emails from people who are on red flag referral waiting lists, particularly for breast cancer, and these people are living in utter anxiety. Many families know what it's like to get that call or to get that letter or email or whatever the communication is to say, we think you may have cancer. And let me tell you, them hours are the longest hours and minutes you will ever deal with in your life. And we have condemned people right across the north to waiting unnecessarily, meeting our own targets, smashing through the targets that we have set for them. We need to get really serious about the fact that this is causing people hurt and harm. I feel it would be remiss if I didn't speak on behalf of those people today. The other thing that I think is absolutely crucial in addressing this crisis in terms of all waiting lists, not just elective, but every single function that we have out there, is that of workforce. And I sit in the Economy Committee, and this is something I have raised at every single turn in the road, to say health can't do this alone. It needs support from right across the board. And whenever it comes to economy, the wee bit of a difference that I can make is saying, what are we doing to make sure that we have enough training places in our universities? What are we doing to make sure that health and social care workers are valued, that they have career progression, that they have career pathways, that we as a society value that work and consider it important? Because let's be honest, in the past, far too many people have been content to sit back and regard that work as low or no skilled, unimportant, and worthy of very little pay. These are the people that pick our families up off the floor whenever they are at their most vulnerable. These are the people that go into our families' homes at 2 and 3 in the morning to help with pick lines or to help with drivers. And these are the people that we are not respecting and giving those pathways and that prestige to. As I've said, this is something we're not going to counter through one ministry alone. But what I do know is that Alliance will not be found wanting whenever it comes to supporting and working with the Minister, and we do so with an open hand and an open heart. Finally, I would just like to close by saying that transformation is something we talk about, and it's not easy, I get it. But whenever you have a loved one sitting in hospital facilities for 3 and 4 months, living for 16 weeks at a time, in accommodation that would not be fitting of anywhere else, you understand this is why we need to do transformation. This is why we need to do this. So my family member doesn't have to go through what your family member went through. It's easy to say we want everything, but the only way we're going to do that is by being realistic and honest and doing things in a structured and strategic way that means everyone can get what they want. But we need to do it together, not just one department in isolation. And I know that the Minister will have my support and that of my colleagues, and I thank the Principal Deputy Speaker for giving me the time and the grace period to make my points. Thank you.
Thank you. Saoirse, call on Justin McNulty.
I raise to support the motion and amendment. This is an extremely important debate, and I want to thank Ms Dodds and Mr Robinson for bringing the motion before us today. I also want to thank my party colleagues, Colin McGrath, Shane McLaughlin and Pat Smith-Long, for their very important amendment. Let's make no mistake about it. Waiting lists and waiting times for health and social care services in the North aren't just a crisis, they are a scandal. Throughout the course of this debate today, let us endeavour to reject any assertion that this crisis has been brought about as a consequence of the pandemic. As the motion quite rightly points out, we haven't met a formal waiting time target in the North since 2014. That's 6 years prior to the onset of the pandemic. The statistics are startling, scary and sad. People and family are languishing, trying to manage their pain and languishing, trying to manage their despair. However, I want to guard against the urge to complain about the problem. Instead, I want to focus on identifying solutions. One of the most obvious and inescapable solutions with respect to reviving our health service and addressing the crisis in waiting list centres around pay and conditions for health service staff. Whether it's burnout, sickness rates, attrition levels, forced migration, patient staff safety, or the inability to attract necessary personnel, health service workers are being failed. I've seen this clearly in my own constituency, where there was an exodus of medical specialists from Daisy Hill Hospital when the Southern Trust stonewalled them after raising legitimate concerns about management decisions and genuine grievances about the terms and conditions of their working arrangements. The most critical part of this debate centres around our NH staff. Without them, nothing works. If they aren't being looked after, patients and their clinical outcomes will be impacted. With that in mind, I believe that this Assembly, and indeed the Executive, should be tackling the basic and most fundamental issues first. We know the staff are at breaking point. That's why junior doctors have voted for strike action. That's why there are more nurses leaving the system every year than entering it. That's why bright brains and hard workers are taking their qualifications and practising in the UK, the Republic, Australia, Canada and elsewhere. I wholeheartedly welcome the commitment by the Executive to fund the public sector pay award, but we need to do better than playing catch-up with pay packets. We need decisive action and ambition from this Executive to make the North the most rewarding place on these islands in which to be a healthcare worker. I fully appreciate that this would be a long-term and considerable undertaking for the Executive, but there's no escaping the fact that we need radical action to address the crisis in our health service. If we need radical action in the long term, then we need sensible action in the short term. It's my belief that the most effective step that the Executive could take immediately would be to reinstate the Cross-Border Healthcare Directive, as stated in my party, the SDLP's amendment. This would allow people languishing on Northern Ireland waiting lists to access treatment in the Republic as a matter of urgency. This would help to remove the pain and to restore the dignity and quality of life of patients far more quickly than if we try to muddle through on already tried or rehashed solutions. Waiting lists in the North are not just a crisis, they are a scandal. Everyone is watching this place with hope and goodwill. The people we represent will expect an awful lot more than the same old storm of solutions branded differently and trotted out for show. We have heard and undoubtedly will hear more in relation to the transformation and fundamental reform of the health service. I would respectfully contend that fundamental reform should begin at the fundamental level, with pay and conditions and care and compassion shown for our health service staff. If we get the basics right, then we have a foundation to build on. But if we continue to pay our health service staff poverty wages and expect them to get excited whenever we sign off on a pay rise 2 years late, then none of us can be surprised when doctors, nurses, allied health professionals and medical specialists vote with their feet and take themselves and their talents to a jurisdiction that would pay them what they are worth. And who could blame them? I will finish by saying, Gora Mila Mila Mayogat to our healthcare and social care workers. Gora Mayogat, that's Canberra.
Walter, I call Jerry Carroll.
Thank you, Deputy Speaker, and thanks for calling me. I think a lot of people, and health workers in particular, will see today's motion as an admission of guilt from those who have gutted our health service. 3 parties from the current executive, the DUP, Sinn Féin and the UUP, have held the health portfolio over the last decade, and all 3 have overseen the growing waiting lists, unsafe staffing levels and attacks on health workers' pay. And I should emphasise the issue of workers' pay, Deputy Speaker, because we cannot hope to deal with waiting lists unless we pay health workers properly. We need to pay them properly so we can recruit and retain the staff in our health service. We need to pay them properly because they deserve it. They deserve to be able to provide for themselves and their families. And they deserve it because it is their self-sacrifice that has kept our health service afloat in the face of Stormon's negligence. It is not by accident, Deputy Speaker, that there are thousands of vacancies in our health service. Those vacancies exist because successive health ministers have cut health workers' pay in real terms and funnelled money away from our health service and into the private sector. And I want to stress and emphasise that the Minister should move immediately to bring private health facilities into public ownership to help tackle these waiting lists. So while I agree with the sentiment of today's motion, these sentiments ring absolutely hollow when they come from parties like the DUP and their executive colleagues. Health workers, like all public sector workers, are tired of the performative nonsense. They are tired of listening to politicians who bemoan the skyrocketing health waiting lists while implementing the cuts that are fueling the exact same crisis. People languishing in health waiting lists don't just want to hear their concerns, they want action to deal with them. And it's important to say, Deputy Speaker, that we are under no illusions about the Tory government. They have no interest in protecting our health service, and they have stripped it of resources time and time again. And indeed, Tory policy is the greatest threat to public health on these islands. The problem, as far as I can see, Deputy Speaker, is that instead of standing with our communities and challenging that policy, parties here have followed the Tories into the mire time and time again. They accepted the Tory logic that there is no money for our health service and implemented some of the most brutal cuts in accordance with that warped logic. Worse still, Deputy Speaker, the parties here accepted the Tories' supposed solutions, which are no solutions at all. Whilst refusing to invest in public services and public sector workers, they have handed record sums to private agency firms and private healthcare facilities who are profiting. They're profiting from the mess Stormont has made. They've surrendered domiciliary care to the private sector, which provides 80% of domiciliary care, giving them carte blanche to exploit health workers and bleed the public purse dry at the same time. Deputy Speaker, I'd love to be able to say those are all things in the past. However, between last night and likely later today, the executive parties are going to ram through another austerity budget with no qualms, no scrutiny and no opposition from the so-called official opposition. Make no mistake, the budget likely to be passed today will add to the waiting list that the executive claims it wants to address. I wonder, Deputy Speaker, if the executive parties truly believe their own propaganda or if they're deliberately trying to deceive the public. I'll leave it to health workers and others to decide, but they should know this. The The conversation is taking place primarily because 170,000 public sector workers took strike action over a month ago and demanded a pay rise and investment in our public services. Junior doctors are already preparing to strike over the pitiful sum on offer, and I fully support them. And while it is unfortunate that these life-saving workers have been forced to take strike action on the picket line, it is the surest way to deliver on their demands. If this executive is intent on cutting services, adding the waiting lists and impoverishing public sector workers, then they must be met with an organised response, and that includes workers taking strike action. Thank you.
I thank the member. It's now time for the Minister to respond to the debate. And Minister, you'll have 15 minutes to respond. Thank you.
Okay, thank you, Deputy Speaker, Principal Deputy Speaker, and can I welcome you to your post and look forward to working with you. And I welcome the opportunity to speak to the motion to address all of the many important issues that actually have been highlighted today, but also to thank colleagues for the positive collegiate approach that has been taken in regards to this motion and the very important topic that it brings. And I want to put in the outset my thanks for the contributions, but also how I look forward to working with the Health Committee as we tackle these issues together, and the opposition, as well as how we work together to do this. But can I say from the outset that I agree fully that it's deplorable that the waiting list targets have not been met since 2014, because the people of Northern Ireland are not receiving the care they deserve on a timely and effective basis. The member of the opposition wouldn't take an intervention when he talked about the 2014 date and all the programmes and all the strategies that have been set in place. And what I did want to point out to him, it's since 2015 that the Department of Health has not had a recurrent budget. So we've been working on single-year budgets for that entire period of time, which has allowed, or not allowed, many of those strategies actually to be fully implemented. So it's not that they're sitting there doing nothing, it's the fact that the recurrent funding hasn't been there to support them. There have been a lot of words written and spoken over the years about the state of our waiting list, and I don't intend to repeat them all here. However, I agree with many of them. It's a matter of deep worry for me and should bring real inner reflection to all that serve in this place, that so many people have been waiting for so long for diagnosis, so long for treatment, and so long for support. Because as members have said, these are real people. These are our constituents, our friends, our families, and indeed our Assembly colleagues. When someone joins a waiting list, their condition doesn't stand still. And that's the point I think was addressed with Ms Erskine's intervention in regards to the additional complications and the additional needs that actually come with being on a waiting list that hasn't been fully resourced or supported. So it's incumbent on me as Health Minister, but collectively upon us all, to ensure that we're doing everything that we can do possibly to address our waiting lists. Fundamental to that is actually having that clear, time-bound, deliverable action plan. And I agree with the Chair of the Committee. It should be fully resourced with a multi-year budget. So it's in that context, members will actually recall that in June 21, I published an elective care framework which detailed a 5-year plan that had that dual focus of reducing waiting lists and at the same time closing the gap between capacity and demand. That framework, costed at $707 million, contained a range of actions, 55 in total aimed at reducing waiting lists and improving capacity across our elective care system. It also set out how we would invest in and transform services to allow us to meet the population's demand in the future. I also made clear that delivering on that plan would require sustained investment to tackle backlogs, but also increase overall capacity within our health and social care system.
And I take the point around the investment. Would the Minister agree with me that had the budget that had been proposed by my colleague, the former Finance Minister Conor Murphy, for £1 billion for a 3-year budget for health, would have gone some way to tackling the situation we find ourselves in today?
I thank the Chair of the Committee for intervention, and I do look forward to working with them, because that £1 billion that was promised was also in the manifesto for the proposers of this motion as well. And it's also clear, and I've already made it clear, that £1 billion capacity gap, or £1 billion financial gap, was also what my department is already highlighting for next year to allow us to stand still. So I do look forward genuinely to work with all my executive colleagues in regards to honouring the commitments that they have publicly made. But I also made it clear then that delivering on that plan would require that sustained investment to tackle those backlogs, but also, as I said, increase the capacity within our health and social care system. So I was heartened by the fact that the framework was agreed to all the executive parties, and commitments were made then that the necessary resources as set out in the company funding plan would be made available. So whilst there has been some progress, of which I will touch on in a moment, no one, including the proposers of this important motion, can have missed the damage that the subsequent further political stalemate and interruption has inflicted. On my last day in office in October 22, after 6 months of a non-functioning executive, I said that patients and staff were being badly let down by the politics of this place, and I hope we'll see a renewed focus from the outset in regards to where we move in regards to supporting health. So in the absence of an executive, and critically in the absence of any budgetary certainty, that framework then was since has been starved of both the political leadership and the funding that it required. So regrettably, therefore, as we're halfway through the point of that 5-year time frame, my department last year already announced that its targets were no longer within reach. Because the situation we face at present is terrible. At the end of September 23, as has been said, the most recent validated figures, there are 430,000 patients waiting for a first consultant-led outpatient appointment, 115,000 patients waiting for inpatient or day case treatment, and just under 190,000 patients waiting for diagnostic tests. Principal Deputy Speaker, these are eye-watering figures for a population of our size. In addition to the backlog of patients waiting, new patients, of course, continue to be added, and inevitably that gap between demand and capacity means the waiting list continue to grow. But that said, and I do want to put in record here, there has been some progress. The 4th interim report of our elective care framework, which was published in January of this year, highlights the start of small but tangible improvements to the waiting list position. As of September 23, inpatient or day case treatment waiting lists have seen some promising improvements. So while still at unacceptable levels, there has been an 8.4%, or just under 11,000 people, decrease in numbers waiting since the same month a year earlier. There's been an improvement in the numbers waiting over 13 weeks. 78.6% of patients were waiting more than 13 weeks for admission, compared to 79.8% on the 30th September 22. And over 52-week waits have also reduced regionally, albeit still remaining far too high. So it's important we acknowledge and build on improvements to ensure any momentum is not just maintained, but increased. But these alone will not address the backlog and need.
For giving way, thank you very much. There's an issue in particular in the Southern Trust area with MRI scans for paediatric patients, and I'm not aware if it is at the same level right across the region, but could the Minister look at this, because this is a serious issue. I've been told 51 weeks is the wait time for a child that needs anaesthetic, and I know a family that have been told 18 months. These are children in their formative years who are going backwards in terms of their capacity, their building of their development, because they aren't getting the MRI scans that they badly need.
The member will appreciate I don't have a direct answer here today, but I will write to her in regards to that. Because, Principal Deputy Speaker, tackling our lengthy waiting list is undoubtedly a long-term issue that requires sustained and recurrent funding. It requires workforce development and that system-wide transformation. Our health and social care system is complex, and waiting lists are just one component, as has been said here today, when we've expanded the debate into domiciliary care, into care homes, into GPs, and that whole circle approach to health has to be addressed. And as such, our waiting list can't be addressed in isolation. Other fundamentals of the system must be considered and addressed simultaneously. That includes issues such as workforce pay, pressures and capacity in secondary and primary and community care, and ensuring that we maximise the capacity we have within the system. I know that when we see these shocking figures and appalling waiting times, there is an understandable desire to see them reduced immediately. That requires a whole system approach and not just piecemeal interventions that can only deliver for small improvements in the short term or in isolated areas. But that doesn't mean that there are not short-term measures that can be effective. But the key is to achieve the appropriate balance between the short-term effective measures and those longer-term sustainable developments that actually bring about that optimum effect. We know we need to transform our health and social care system to become more effective and efficient, and we know what's required, because that includes the reform and innovation in such areas as our treatment capacity, outpatient reform, imaging, pathology, workforce, and protection of elective care from unscheduled care demands. That work is already well underway, and elective capacity has been enhanced through the continued development of our elective care centres. Key examples that I want to highlight to members are already in place. 2 dedicated day procedure centres at Lagan Valley and Omagh hospitals. 3 elective overnight stay centres at Daisy Hill, the Mater and South West acute hospitals. The expansion of 22 post-anaesthetic care unit beds for elective care across all trusts. 3 specialty centres for cataracts at the Down, South Tyrone and Mid-Ulster. An orthopaedic hub at Musgrave Park Hospital, which includes the Duke of Connaught unit, which is a dedicated orthopaedic day procedure centre. 2 rapid diagnostic centres at White Abbey and South Tyrone hospitals. A regional extracorporeal shock wave lithotripsy centre in the Craigavon Area Hospital. Service reviews in general surgery, orthopaedics, urology and gynaecology, which will set the direction of travel for improvement. The introduction and the maintenance of our mega clinics to maximise patient throughput. Outpatient assessments delivered by GP Federation in primary care settings, and the development of in-house health and social care capacity and the continued investment in staffing. The members in tabling this motion asked that I acknowledge the need to turbocharge investment towards tackling the waiting list backlog. I not only acknowledge that, I stress that investment is actually fundamental to the whole backlog problem that we're facing. And the initiatives for which confirmation of sustainable funding would actually allow further development would include the enhancement of that sustainable workforce capacity through expanding skill mix and the development of specialist nurse roles and those allied health professionals across a range of specialities. The expansion of our pre-op assessment service to improve theatre productivity. Building our own diagnostic capacity to reduce the reliance on the independent sector capacity. Building capacity and throughput across regional elective care services such as urology, paediatrics and orthopaedics. Today's motion asks that I publish an updated action plan to tackle the waiting time crisis within 6 weeks. The action plan to tackle waiting lists within the health and social care system already exists. I don't want to waste time replicating what is already clearly set out in the elective care framework, because I believe enough time has been already lost. It is, however, almost 3 years since the plan was published, and as with all plans, it's important that it is reviewed to ensure that it takes account of relevant changes within our overall health and social care environment and is updated to reflect them. And it's for that reason that I have tasked officials to review the framework, and that review is ongoing and will be completed by June this year. Motion also tabled stresses the value of partnering on a much larger scale with national and independent providers to maximise existing capacity. I believe that's essential, and we take all measures and use all resources within our means to ensure effective delivery of services, and that includes the use of our independent sector. This is what we have been doing with the limited additional resources that have been deployed for waiting list initiatives. We need greater investment in this area, and we want to achieve the results and impact on waiting lists the people of Northern Ireland need and the people of Northern Ireland actually deserve. However, maximum efficiency in the use of the independent sector can also only be achieved in multi-year contracts, or at least 3 years when they're agreed. This will also provide better value for money. As members will be aware, I introduced the Republic of Ireland reimbursement scheme on the 30th of June 2021 as part of the elective care framework. In June 2022, I announced that the scheme would be extended beyond the planned deadline until an additional $5 million of new funding had been committed. The scheme closed to new applicants on Wednesday the 21st of September 2022 when that additional $5 million funding had been exhausted. I can assure members that I will be leaving no stone unturned as part of my broader consideration to resource investment in reducing waiting lists. I will invest what limited funding there is wherever it will have the greatest possible impact. However, the task ahead will be much easier if all parties will do all they can to support the adequate and multi-year funding settlements. In the meantime, work is also currently underway to provide further building blocks to tackle waiting lists. This includes plans for service reviews of paediatric orthopaedics, and I thank the Principal Deputy Speaker for her support in bringing this motion. I thank the members who brought it and the support of the entire House.
Thank you, Minister. Cara Hunter is winding on the amendment, and Cara, you have 5 minutes to wind.
Thank you, Principal Deputy Speaker, and I'd like to thank the Minister for his contribution here today, and hopefully I can get through this in 5 minutes. But I'd like to thank each and every member who has spoken here today, and I'll touch on some of their contributions and reflections. I'd like to thank Liz Kimmins. She touched on the importance of urgency in making tough decisions. Mr Donnelly touched on the dramatic increase of 216%, highlighting how our lists worsen without intervention and the issues that is causing. Mr Chambers touched on the importance of the point that the pain our patients endure while waiting to be seen, and Jerry Carroll, of course, touched on the importance of paying our workers, something I wholeheartedly share with him. We spoke weeks previous as well about the vital need for a women's health strategy, and I acknowledge Ms Diane Dodd's contribution around gynecological waiting lists. I've spoken with many women in my constituency office, many of whom have awful cramps, heavy bleeding, bent over in pain, and yet cannot be seen by a specialist, and that they can't work. It's just completely ruined their lives, and it can be indicative, as we've talked about before, as endometriosis or worse, potentially cervical cancer, and they're left with the mental agony of that, the unknown and the uncertainty. And as we stand here today, thousands of our people, our constituents, are waiting on these lists, and oftentimes are untreated and unmedicated. And Sinead McLaughlin touched on the importance of the postcode lottery aspect, as did Mr Robinson, and the issue of regional imbalance. Orlia and Deborah touched on the importance of children's mental health issue I know both of you care deeply about, and I too have talked previously about the delays within the Northern Trust for the access to CAMHS and the impact that that's having on children and families. So waiting lists impact the whole family as well. I'm also thinking today of a mother in my constituency who has a child with special educational needs who had an abscess in their mouth and was left for months without being able to be seen to receive oral health care, and no one in the house was sleeping. The child was in agony. So it's that real family impact of these waiting lists. I also recall a lovely young woman who I met in my constituency office who had cancer, who had surgery for cancer, and there was an issue with her bowel. She came out of surgery and was told that they would go back in and rectify the issue, and it would be a matter of weeks, but it was actually a matter of months, and she was just in agony, and again she couldn't sleep as well. So I just think it's really important that we touch on those personal stories here wherever given the opportunity. And you know, Miss Eastwood touched on just these challenges facing cancer patients, and she done so very eloquently. But how have we got here? But more importantly, what can we do to get out of this? And I think that's why we come to our amendment here today, and the Minister rightfully touched on maximising every opportunity given to us, and we know we've seen cross-border initiatives have been extremely positive, and reigniting those cross-border schemes is a real step in the right direction, a positive direction, especially I know my own constituency for those awaiting hip and knee surgeries. I think there's also the aspect that we really want to ensure that patients who are on health waiting lists are being told there is communication as to where they are on the list, how long potentially. That's been an issue that's been raised to me as an MLA, and that will help them, I think, have an understanding of where they are and when they'll be seen, because it does impact mental health. And I'd like to congratulate my East Derry colleague, Mr Robinson, on his maiden speech. And I think he really did touch on the aspect of this is a two-tiered approach for those who can pay due and for those who can't suffer. In 2015, I actually went to America for surgery. I had sepsis twice in a very short period of time, and was told by a specialist in Alton Galvin Hospital that if I had sepsis a third time, it wouldn't be good, but was also told in the same breath that I could be waiting 3-4 years for surgery. So thankfully I have a very good mummy who paid out so I could go see family in America and have surgery, and thankfully my health has been relatively good ever since. But that's just my own personal story, and the uncertainty that is present there when you don't know when you will get the health care that you so desperately need. And I think we can't have this debate without the discussion around this place is up and down. Sometimes I refer to the Assembly, it's up and down so often it's like a bouncy castle, and we can't deny that that's having a direct impact on our constituents who are sitting as we're here today in agony on waiting lists. So Minister, any opportunity that you have to utilise cross-border schemes in this House, certainly we will work as constructive opposition alongside yourself to ensure that we deliver for our constituents and essentially alleviate their pain in any way that we can. And I thank those who are supporting our amendment here today. Thank you.
Thank you, Cara. I call on Deborah Erskine to wind on the motion, and Deborah, you have 10 minutes.
Thank you, Principal Deputy Speaker, and I welcome this debate today, which calls on action for our waiting lists. Day and daily, as it's been said in this chamber, we're contacted by constituents who are sitting on waiting lists in Northern Ireland, and for many actually they simply don't know how long they will be on waiting lists, and that is an unsustainable situation, and we have to be realistic to the challenges. And it's been pointed out here today that whilst money is important and we need that extra investment, as my friend for Upper Bam pointed out, Deanne Dodds, we must also work to increase in training of our students, recruitment and retention of surgeons, doctors and nurses to ensure that there is a sustainable workforce going forward. And we are competing with higher pay in the likes of the Republic of Ireland, which I know the colleague there, Danny Donnelly, pointed out during his contributions, and that can affect health trusts like my own in the Western Trust, which are closer to the border, and that is an issue that we do have to tackle. The holistic approach to care must also be in place, which I pointed out during my interventions, to drive down not just waiting lists but stabilise the system, and we need a root and branch plan going forward. We need to have the maximisation of our existing capacity through, and the Health Minister pointed this out, in terms of designating more sites as dedicated elective centres, 7-day theatre schedules, multidisciplinary mega clinics, and establishing regional diagnostic centres and rapid diagnostic centres, which he pointed out. And there will also be the need to make sure that we organise our services in the most appropriate way as well through our transformation, and actually that's going to take a change of mindset within our public as well. And we must realise that maybe travelling to another site outside of our trust service may be needed, and it's on all of us in this chamber to actually step out of this chamber and make that point to the communities that we represent. And I say that as somebody who comes from a rural area, but I want to make progress, but it's just to say that our public transport on our roads must reflect the transformation that is needed once we talk about this. So there's a cross-departmental element. Principal Deputy Speaker, I want to move to some of the members' comments that were made today as well. And I want to thank Deanne Dodds, who mentioned the very stark waiting time figures and indeed the postcode lottery. And she mentioned ways in which we could bring forward solutions to be found. I have to say, moving to the SDLP and Colin McGrath's contribution, I hope that I have seen a Damascus Road conversion for the SDLP here today. I really do, because he talked about plans and strategies that sit in rooms. See, when they come out of rooms and get dusted down, I hope the SDLP step up and actually stand by those plans and don't go on picket lines to be parish pump about health on issues, and actually act with all of us in the chamber to implement transformation. I want to make progress. Liz Kimmins, in her intervention, thank her obviously in her role as a health committee chair. She said exactly, we can't keep doing the same thing and expecting the same outcomes, and I welcome the fact that her as chair of health committee will be using her voice to drive forward some of that change as well. And I mentioned Danny Donnelly's contribution as well, and I thank him for pointing out the differences in pay that is causing issues. Alan Chambers, he mentioned the stress and pain of those who continue to be on waiting list, and that is going to take further intervention from our health service, which was pointed out. And as I said, I thank Orlia Flynn for her mention of mental health services as well. Moving on to my member, Alan Robinson, and I congratulate him on his maiden speech. And please do pass on our good wishes to George Robinson from all of us in this chamber. We do wish him well in his retirement. And I thank Alan and Cara Hunter for sharing their own personal stories of being on waiting lists, which is not an easy place to be. And I thank Nuala McAllister for raising the equity of service and the discharge times, which is also very, very important as well, and the succession planning in terms of where we go forward with consultants and surgeons, because it takes a while to train people in our health service, and we have to be realistic that if we need to start planning for some of that stuff now. And I thank my colleague Gary Middleton, who paid tribute, as I know a number of people did in the chamber, to our dedicated health staff, which are at the heart of all of this. I want to move on. Paula Bradshaw, she raised very important points in terms of investment and timing around consultants' time as well. And I do agree with her in terms of if we're taking funding and putting that into elsewhere to shape our waiting list, surely that can be invested here in Northern Ireland to help, and it's a very fundamental point. I thank Sinead McLaughlin for raising about gynae issues following on from our women's health debate, and also for Sorcha Eastwood for mentioning specifically about cancer. And we send our good wishes to her family and her husband as well at this time. It's a deeply personal thing that she raised in the chamber, and I thank her for that. Justin McNulty, he raised about the burnout of our trust workers, and I think it's important to note that in this debate. But again, regrettably, when we come to Jerry Carroll, we see again the party politics creeping in relation to health. And I just want to say, I agree with him in terms of fair pay for our workers, but let's strip politics out of health. If we're taking anything away from this chamber today, let us work together collectively to deal with the issues. We will all, as I said, have to walk out of this chamber and try and put the message to our communities that we need to change our health service and shape it. And I regret the fact that people use party politicking over things where there are people behind these statistics, as has been stated in this chamber today. I would like to move on. The member has had enough time to make his comments today. Lastly, I thank the Health Minister for coming to the chamber to respond, and I welcome his commitment to tackling this issue. As he pointed out, his elective care framework. I'm also pleased to see that he reads the UP manifestos in terms of the 1 billion that we would like to see invested in our healthcare. And I welcome that he will review the waiting list framework, which was published 3 years ago. Whilst it will be, I think he said, concluded in June, from there on in, my plea is that we see action in relation to that action plan, and certainly from my point of view and my party's point of view, and I think that was collective in this chamber today, we want to see action on this. So I thank everybody for their comments today in this debate.
Thank you, Deborah. The question is that the amendment standing in the names of Colin McGrath, Sinead McLaughlin and Patsy McGlone be made. All those in favour say aye. Aye. Contrary if any, no. The ayes have it. The ayes have it. The question is that the motion as amended be agreed. All those in favour say aye. Aye. Contrary if any, no. The ayes have it. The ayes have it. Members, would you take your ease? Do we change the staff at the top table? Please, thank you.
Members, the next item on the order paper is a motion on speech and language therapists. I ask the clerk to read the motion.
That this Assembly recognises how speech, language and communication difficulties can be a contributory factor in offending and re-offending within our criminal justice system. Applauds the work of speech and language therapists while recognising the concerns of the Royal College of Speech and Language Therapists in respect of the impact communication difficulties can have on mental health, and calls on the Minister of Justice, in consultation with other ministers, to examine how speech and language therapists can work with the Youth Justice Agency and all of our prison estate to support the communication needs of prisoners and to develop training for prison officers to allow them to identify and support prisoners with communication difficulties.
Thank you. I call on Doug Beattie to move the motion.
That's moved.
Thank you. The Business Committee has agreed to allow up to 1 hour 30 minutes for this debate. The proposer of the motion will have 10 minutes to propose and 10 minutes to wind. All other speakers will have 5 minutes. Please open the debate on the motion.
Thank you, Mr. Speaker. And in opening this debate around speech and language within the criminal justice system, I need to acknowledge two things. First of all, to thank the Justice Minister for coming along to respond today, and also wish her well in her role as the Justice Minister. I don't envy her, but she will certainly have my support. The second one is to absolutely be clear that this is not an issue solely for the Justice Department. In fact, it covers so many different departments. Indeed, it's a health issue because it's the Health Department which provides the speech and language therapists to provide the outcomes that we require. It's also an education issue because if we don't find the trouble early on with our children, then it stores up troubles later on. It's an issue for our economy because within our education system we have not got enough places to train people as undergraduates within speech and language, and of course finance, because if we don't get the finance, we don't have the resource and we can't provide the outcomes that we need. And I hope that within this debate, Mr. Speaker, that other people will outline some of those points that I've made, because it is important to realise this does not just sit on the shoulders of the Justice Minister. But I am talking about the criminal justice system and the youth justice system, and that's where the focus is. But there's so much to it. Mr. Speaker, communication skills are a central plank for social inclusion for a number of reasons. First of all, expression, to make ourselves understood. And just you all know what it's like and the frustration you feel if you cannot make yourself understood. Comprehension, our ability to understand what is being said to us. And if we don't understand what has been said to us, then again, it can lead to poor outcomes. And social communication, how to speak to different people in the right way at the right time. And I think we all take that a little bit for granted, but we shouldn't. Development language disorder is a lifelong condition characterised by significant and persistent impairment in understanding the use of language. Within and that actually goes back to the point that I'm making when we talk about developmental language disorder, that this is something that actually appears at a very early age within our youth. So this is not just about when they get into the criminal justice system, this is when they're at school beforehand. So that just expands that so people understand. But within the youth justice system, a study of 145 young offenders, it was found that 3 in 5 had DLD. DLD being developmental language disorder. In 2023, a screening of a sample population of Hyde Wood College found that 75% of those assessed had underlying speech, language and communication difficulties. Now, this screening was conducted by the South Eastern Health and Social Care Trust, but it outlines very much the problem that we face. Within the youth justice system, that means that many simply do not understand the terms of their sentence, what is required of them in court orders or under licence. We're literally having young people ending up in the youth justice system, finding themselves at a disposal and not understanding it, and because they don't understand it, they end up reoffending. 62% of people with DLD reoffended. 25% who didn't have DLD reoffended. So there's a real difference there. The Royal College of Speech and Learning asked for a three-pronged approach. The first one was to screen. Everyone entering the criminal justice system should be screened for speech and language difficulties. Now, this is no easy task. I mean, this is a huge task. Because we have limited speech and language therapists. We only have 28 undergraduate places per year at Ulster University, and 10 of those are provided by the Irish government, so we're likely to lose them once they have qualified. And that's from an application pool of 700. So there is a need to train people up. So you can't do this, we can't do the screening unless we have the people. The screening could, possibly should, act as mitigating factors with judges reviewing sentences. However, once an individual enters the prison estates or in probation within a sentence management plan, then they should have a personal development record outlining these very issues that they face. Train. The judiciary needs to be trained in order to understand DLD and other speech and language issues. This could help them understand the problem as youth offenders go in front of them. Prison officers must be trained from an early stage, as do probation officers, to understand the effects of speech and language difficulties. These could include... No, absolutely.
Thank you for giving way. The new Encompass programme that's been rolled out in the Trust, it is hoped that in the future other statutory bodies would have access to patient records. Would the member agree with me that the sooner we have that joined up approach across government, the better, so that when people are entering the judicial system, that they have access to medical records so that those assessments are there for them? Thank you.
I think that's a really good point, and I think that joined-up approach is the point that I'm making. And then I said, and I continue to say at the start of this is not just for justice. This is far wider than justice. But you're right, and thank you for that intervention. But these difficulties that can be faced with speech and language create challenging behaviour. It might be disruptive, violent, or aggressive, self-harm, poor mental health, segregation, and increased use of physical restraint and intervention. So we need to train to prevent, support. That's the third of the three-pronged approach. Direct speech and language therapy and intervention should be provided for those within the criminal justice system, particularly the youth justice system. This is provided by the Department for Health, but it must be a structured intervention combined with the screening and the training functions. so support to transform. The advantage of having speech and language therapists within the justice system is extremely clear. For staff, they have an increased knowledge and understanding of the barriers to engagement and helps communication. For those with need, to better understand what is happening to them. Because people fall into that criminal justice system and they find themselves at a disposal and then they simply do not understand it. And it's important that we work with them so they can understand what is happening to them. And the other clear advantage is for society. Speech and language therapist interventions can reduce offending by enabling individuals in the criminal justice system to access a wide range of rehabilitation programmes, empowering change. So it's about empowerment, empowering these young people who find themselves at the wrong end of the law. I want to revert back, if I can, to the very start, and I've repeated time and time again, and others will repeat time and time again, that this is not just for the Justice Department. This really does start from the bottom up. Because if we can't... I will do. Go ahead.
Thank you, and can I thank the member for giving away? Does the member agree with me that early intervention is critical to outcomes later on in life, including the predicting of interaction with the justice system, and that is particularly important for people with speech and language communication needs, and that is why another reason that we need to invest on our early years and early education and childcare.
Absolutely. I think the point you make is prevention. You know, it's always better to prevent than it is to deal with the aftermath. So I'm 100% with you in regards to that. You know, and I say that as I come to the end of moving this motion, that being proactive is important. It's important that ministries share and pool budgets to get the outcome that we want. We can literally save people, we can save money if we act early on before they end up in the criminal justice system. But once in that criminal justice system, it's incredibly important that we take action to stop them reoffending so we can get them out the other end. I think sometimes speech and language therapists don't get the credit that they deserve. They're not spoken about as often as we should do. The resource isn't there that is needed for them to provide the outcomes that we want them to provide. And I hope today that we can change that other departments can look to see what they can do in a joined-up manner in order to move this forward and in order to support our Justice Minister within that youth justice system and criminal justice system. Because at the end of the day, society will gain from this if we do. Thank you, Mr. Speaker.
Thank you, and I call Ciara Ferguson.
Thank you, Deputy Speaker. I rise to support this motion today, and can I thank members for bringing it forward. Firstly, I think this is an opportunity, like yourself has mentioned, to commend the work of our Royal College of Speech Language Therapists. We have over 700 plus committed professionals that work in the field here in the North, and they provide vital work in supporting our most vulnerable children, young people and adults who have speech and language communication delays and difficulties. Sinn Féin recognises and very much values the important role that speech and language therapists play, not only in our justice system, but in our schools, in our local communities and in our health service. And I've been fortunate to work closely, particularly in the communities, with our speech and language therapists, supporting particularly in early years with our Sure Start programmes, our communities, and providing language-rich environments to support our young people in the development of their communication skills. Speech and language obviously underpins everything that we all do. So just imagine your life if you struggle to be able to express your own needs to others, to express your own likes and dislikes, struggle to interact with others, build relationships, struggle to learn in school, struggle to understand and control your emotions and feelings. Unfortunately, for so many, that is still the case here today. We are aware that speech, language and communication needs are often hidden difficulties. And instead of your communication difficulties being identified and supported, instead, they may be seen as someone, well, they're just struggling to learn, or it's just pure behaviour, they need to improve their behaviour, or they're just difficult. They don't like socialising. They're very withdrawn. People with speech, language and communication needs can be so misinterpreted, misdiagnosed and missed altogether in our neighbourhoods and our community. The Department of Health Workforce Review from 2019 to 28 reiterated that speech, language and communication difficulties unsupported has long-term implications for educational attainment, employment, social inclusion, mental health and involvement with the Justice Service. Within the Justice Service, we have continuous research showing a prevalence of up to 60% of young offenders who have low language skills, and it's poor or very poor. A lot more needs to be done. Too many of our people, communication needs are being overlooked. The National Institute of Health and Care Research Report in February 21 found that young offenders with undiagnosed language problems are twice as likely to re-offend within a year. I have to say there is huge gaps, but there's also some great work that is being done by a Royal College of Speech and Language Therapists, such as the A-Box, which is a free e-learning package designed for the justice system to support people working in the justice system, the offenders team, probation board, prison staff, police and other professionals in our court system, our judges, our barristers and solicitors. Also, I welcome the appointment by the Minister of a speech and language therapist within the prison service back in 2018, but it's not enough. And as our previous speaker just mentioned there, I think it's pertinent. We need to look for solutions. And one key solution is that the speech and language and therapy degree that is currently located within the Ulster University in Derry needs or could be expanded. There is a shortage of therapists, and we should, or even call for a health minister who should be working with the executive to increase places within our campus there in Magee. As you'd mentioned, there's currently 28 commissioned undergraduate SLT places at Ulster University, but there was over 700 application forms in 23-24, 700. So obviously there is a clear, not only need, but there is a lot of young educated people here in the north that are keen to invest in this service. We need to explore also alternative routes to pursue a career, and I know the speech and language therapists and the Royal College of Speech and Language Therapists have recommended about us looking at or exploring the likes of apprenticeship schemes to train additional SLTs. I think we all kind of recognise that we must commit to work together to ensure that anyone with communication difficulties or disability have a right to expect and receive specialist support within our criminal justice system, and ensure, most of all, continuity of care. So I very much welcome that we should ensure, particularly for young people and adults, screening of their speech, language and communication needs when they come into contact with the criminal justice system. It's imperative. It's also imperative that we provide support to trained staff to recognise and support those with needs. And just finally, obviously, in relation to tailored programmes and intervention, we need to ensure that our people can benefit from rehabilitation programmes. So thank you.
Thank you, and I call Joanne Bunting.
Thank you, Mr Deputy Speaker. This is a really interesting topic, and I'm really grateful to the members for bringing it forward. From the outset, it may be helpful to contextualise. Over 60% of people in prison have speech, language and communication needs, which is higher than the figure found in the general population. Some types of these needs experienced by individuals in the justice system include difficulty understanding spoken words and using language to communicate, difficulties remembering and recalling information accurately, difficulty understanding commonly used legal vocabulary, for example, liable, remorse, reparation, threatening or victim, difficulties in listening and understanding, difficulties sequencing information to tell a story, difficulties using abstract language like metaphors, and difficulties staying on topic, understanding non-verbal communication and relating to others in socially acceptable ways, difficulty expressing feelings and emotions in an appropriate way. For example, they may use aggressive behaviour instead of words to express themselves. Many young people in justice settings with speech and language communication needs have grown up with the experience of multiple adverse childhood experiences, including deprivation and poverty, trauma, neglect, abuse, and many are care experienced or looked after children. In turn, children who are looked after have a much higher rate of involvement with the Juvenile Justice Centre than the general population. Part of the issue is that the screening processes in prisons are still ineffective, and there's no nationally used screening tool for communication needs. Prison staff receive limited training on those vulnerabilities, but we know that failure to appropriately support people in prison can result in disruptive, aggressive or violent behaviour and increasing self-harm. In my remarks on the budget debate yesterday, I made mention of prisoners having problems with addiction, anxiety, depression and their inability to control their emotions. That does not just go away. A prime example of what I'm describing can still arise on leaving prison. Until the point at which they are released, their lives have been under the control and responsibility of others. Then they leave. And on exiting the gate, they may be sent to hostel because they're homeless. And that hostel can be very far from home. And I'm talking Belfast to Londonderry, Belfast to Newry, or vice versa. They may have no family support, and they're supposed to get there on their own devices via public transport, and perhaps with a daily requirement for a prescription in Belfast. They make their way to the pharmacy, something goes awry, the miscommunication cycle starts, and boom. They're tired, they're alone, they're with nothing and nobody, they're afraid, they're anxious, and they're frustrated, and then the temper's lost. Back to square one, defeated. And it can feel like we're teeing them up to fail. If the member, yes, go ahead.
The member refers to the number of people involved with the justice system and in prison, the previous speaker as well. To what extent do you feel it's a contributing factor to their involvement with the justice system, their frustration and their lack of support to be able to navigate the uncertain territory they feel they occupy as a consequence of their difficulties and their challenges?
The member has an extra minute.
Thanks, Mr Deputy Speaker. No, I think the member's absolutely right, and that's the point that I'm trying to make and will go on to emphasise. Interventions in the justice settings like counselling or education programmes are often verbal, and therefore they disadvantage those with prior speech, language and communication needs. The knock-on effect is that those schemes are potentially less likely to contribute positively to reduced rates of reoffending if participants' difficulties and needs go undetected or are misinterpreted as general aggression. That's why a joined-up approach is also needed, as the proposer has mentioned. There's little point in prison staff being equipped to communicate effectively with prisoners with SLCNs, but external providers delivering rehabilitative or educational initiatives lacking the knowledge on how to identify and address the needs of this particular cohort. Gaps in identifying SLCNs are also exacerbated when sufficient numbers of speech and language therapists are not being trained or in post, as others have mentioned. And we've got higher rates of SLT vacancies than Scotland and Wales, and this limits what can be achieved in terms of ruling out innovative multidisciplinary team working in other aspects of the system where SCNs could be addressed. But the picture's not all gloom. Strides have already been made. Recent examples at Maghaberry, for example, have highlighted that the provision of speech and language therapy has been very good. There are a number of issues that need concerted action. Training is only one part of the jigsaw. We need to ensure a sustained funding uplift for our prisons and the wider criminal justice system in order to ensure sufficient numbers of trained allied health professionals are working alongside prison staff and to facilitate adequate and ongoing training for staff in justice settings themselves. Apologies, new placement of microphones. It should also be noted that the Strategic Framework for Youth Justice 2022 to 27 and 5-year action plan led by the Department of Justice and Youth Agency places little emphasis on SLCNs, and there is perhaps a need for the Minister of Justice to revise those strategies and the operation of the Regional Care and Justice Campus to ensure there is a focused strategy when it comes to breaking down communication and language barriers. To conclude, we support the motion and welcome the focus on breaking down barriers to better engagement between those with speech, language and communication needs in our prisons and youth justice populations, those who care for them in justice settings, and the many rehabilitative, restorative and educational programmes in which they participate. Thank you.
Thank you, and I call Stuart Dixon.
Thank you, Deputy Speaker. Deputy Speaker, when individuals Particularly young people find themselves entangled in the criminal justice system, caught up in a cycle of offending and reoffending. This is driven by a broad spectrum of underlying issues from poverty, substance abuse, homelessness, mental health, and communication problems. A lack of early opportunity from the start of life, making the factors that contribute to criminal behaviour both widespread and deeply ingrained. However, in addressing these issues, we should not overlook the critical aspect that often remains hidden or invisible: the additional needs associated with speech, language and communication challenges. This is an area that is underassessed and can easily go unnoticed until an individual comes against the need to use a particular system. As others have indicated, research has consistently shown the prevalence of these challenges within our judicial system, with over 60% of young offenders and 80% of adult inmates affected by speech, language and communication needs. This starkly contrasts with the general population, highlighting severe disparity and underscores deeply rooted systemic failures. Let me be clear: people do not arrive in the criminal justice system and develop these issues. But once they're involved in the system, these issues can significantly hinder their rehabilitation, thereby fueling a cycle of crime. This not only devastates the individual caught within it, but also has far-reaching consequences for communities and society at large. The Royal College of Speech and Language Therapists has emphasised the profound implications of communication difficulties can have on an individual's mental health. Without timely and effective intervention, this cycle only worsens, adversely influencing behaviour and drastically limiting the opportunities for positive engagement within society. This underscores the necessity of early intervention outside and long before anyone interacts with the justice system, as part of our broader cross-departmental strategy, which undoubtedly could mitigate offending and reoffending rates. Here in Northern Ireland, under the leadership of my colleague, the Justice Minister, Naomi Long, and in conjunction with the Department of Health, the integration of speech and language therapists into our justice system has already begun, making pivotal steps towards systemic improvement. However, we are just at the beginning. The scope of the challenge demands not only continued but expanded efforts to ensure that all individuals within the justice system who struggle with communication difficulties receive the support they need. Therefore, and let us be clear, who delivers that within the justice system? It is actually the Department of Health. They bear the statutory responsibility for the provision of speech and language therapy services, to prioritise and ensure the allocation of adequate funding and resources. This is not merely an investment in the rehabilitation of individuals, but in the safety and well-being of our communities. By improving health outcomes and addressing the communication needs of those in contact with the justice system, we can significantly reduce reoffending rates and facilitate more successful reintegration in society. Moreover, it's crucial to foster a collaborative approach that involves educators, health providers, justice system professionals, the identification and support of individuals with speech, language and communication challenges. We need to create a cohesive support network that can more effectively address the root causes of criminal behaviour and ensure that individuals receive the holistic care that they require. So in conclusion, Deputy Speaker, I extend my appreciation to the members of this House for the recognition of the critical role of speech and language therapists within our judicial system. The journey towards a more inclusive and effective approach to rehabilitation and reintegration is long and complex. However, by committing to address the communication needs of individuals within our justice system, we take a significant step forward. Let us continue to work together to enhance our justice system's responsiveness and ensure that every individual has the opportunity for rehabilitation, recovery and a positive return to society. The focus of this debate today is on justice, but in truth, the focus of this debate should be on all departments from the earliest days of life. Thank you very much, Deputy Speaker.
Thank you. Members, the Business Committee has arranged to meet at 1 p.m. today. I propose, therefore, by leave of the Assembly, to suspend the sitting until 2 p.m. This debate will continue after question time and also an urgent oral question, when the next speaker in this debate will be Patsy McGlone. sitting is by leave suspended.
Assembly Chamber. Sound. 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 Assembly Chamber. Sound.
The sitting's resumed. It's time for questions to the Minister for Communities, and I call Liz Kimmins.
Question 1, please.
Minister.
Thank you, Mr. Speaker. As the House will be aware, the scheme of emergency financial assistance was introduced by the Executive in 2007. Its purpose is to provide immediate financial support to households who have suffered from flooding. It is not a compensation scheme, nor does it purport to be one, nor is it intended to replace or displace the assistance that households should receive from their insurers. An immediate payment of £1,000 was made via district councils to provide eligible households with assistance to make their homes habitable as quickly as possible. In Newry, Mourne and Down District Council area, assistance was provided to 119 households during the flooding event in October 2023. My department's finance support service is available for people who find themselves in financial crisis, including those experiencing financial difficulty as a result of disaster, for example, flooding. The service provides financial support through the provision of discretionary support, social fund and universal credit contingency fund. In addition, householders can contact My Department's Make the Call service to ensure they're getting all the money and supports they are entitled to. Make the Call offers a telephony service and has a team of community outreach officers who work from regional locations across Northern Ireland to conduct home visits and provide face-to-face assistance and support with benefit claim completion.
I thank the Minister for his answer, although I think it's very disappointing given that the scheme he refers to is 17 years old now and we're dealing with much higher costs, particularly a number of families in my constituency are still out of their homes as a result of the flooding and their inability to get flood cover in their house insurance. So I would ask the Minister if he would review his decision and agree to consider a dedicated financial support scheme like the Department for Economy are doing for businesses in phase 2 to enable people to get back on their feet.
Well, I'm sorry, I haven't made any decision, Mr. Speaker. I'm simply reiterating what support is available there for householders. First of all, can I say I completely understand the frustration that many of her constituents and others will be feeling as a result of the flooding issues that have been felt in her and other constituencies in recent months. Unfortunately, I can only operate, and my department can only operate within the scheme that is currently available. And this scheme does not provide any additional support for the uninsured properties that she mentions. And any changes to the scheme or additional financial support that would be required would necessitate legislation and executive approval.
Ryan Kingston.
Thank you, Mr. Speaker. And I wish to ask the Minister for Communities about flood insurance. What initiatives exist to improve the availability and affordability of flood insurance for those who live in properties in flood risk?
Well, Mr. Speaker, I recognise that this is an issue of concern, especially for those that have found themselves having their home flooded in the past and the difficulty that it is in order to secure flood insurance. To that end, Floodry is a joint initiative between the UK Government and insurers, which will run until 2039. And that programme exists to improve the availability and affordability, as the member has said, of flood insurance to those who live in properties in flood risk areas. Every insurer that offers home insurance in the UK pays a levy, and that money is used to fund the flood element of the policy and helps keep premiums down. The member, or indeed any constituent, will be able to check online for eligibility, and I would encourage those that are affected in this way to do just that.
Patrick Brown.
That a flat rate £1,000 payment is inadequate to cover household damage from flooding in many cases, and that a payment based on actual losses would be preferable?
Well, yes, Mr. Speaker, it's obviously the case that £1,000 will not, in the vast majority of cases, not provide the assistance that's required. That's why insurance is what everybody should have. It's not meant to be a compensation scheme. It's not meant to take the place of insurance. It is there to ensure that there can be that one-off payment that's made in hopefully a very quick period of time to help with the initial cost that some people will be facing. That's why we would encourage people, obviously, to have home insurance. That's why that programme, that's the joint initiative between insurers and the UK Government, is in place.
Colin McGrath.
Thank you very much, Mr. Speaker. Minister, your Permanent Secretary chaired the response to the floods back last November on behalf of the whole ministerial departments. Many of the businesses are desperately waiting on the £100,000, which is to come from another department. But are you aware when that's going to happen? They're crying out for this scheme to be opened.
Mr. Speaker, I'm not aware of when that will be delivered. As the member said, or has indicated, that is not a responsibility of this department. If there are any responsibilities that fall under the Department of Communities, I will, of course, look into that and see what can be done. But again, I place on record my sympathy with those who have been affected. It may only be on the news for a few days, but we understand that the impacts last for a long time after, and we want to be able to help where possible to get those businesses back up on their feet as soon as possible.
Honeyford.
Thank you, Mr. Speaker. Question number 2.
Sure.
Mr. Speaker, the Sports Council for Northern Ireland, Sport NI, is a statutory body set up under the Recreation and Youth Service Order 1986. There are no plans to undertake a reform of Sport NI. However, the New Decade New Approach document stated that there will be a review of arm's-length bodies with a view to their rationalisation. While Sport NI is one of the Department for Communities ALBs identified for review, this has not yet been taken forward. As the sponsor department, Communities continues to work in partnership with Sport NI to support the board and executive team to deliver the necessary changes to the organisation which will allow it to deliver effectively for the sports sector in relation to its core functions and within a proper governance framework. Over the last 3 years, Sport NI has issued exchequer funding of almost £39.4 million and lottery funding of just over £17 million. And this funding consisted of grant awards to over 1,900 organisations. This year, Sport NI plans to invest £7.1 million of national lottery funding across 40 sports governing bodies, with an ambition to boost this figure to almost £8 million next year. In addition, my department and Sport NI published a partnership agreement in November 2022, following the launch of the Northern Ireland Code of Good Practice on partnerships between departments and arm's-length bodies. This was the first such agreement between my department and an arm's-length body and demonstrates the commitment of both our bodies to deliver for the sports sector in Northern Ireland. Now, at the request of Sport NI last May, my department has agreed to carry out an independent strategic review of the organisation. The aim of this strategic review is to identify and understand the cause of governance and control issues so that they can be addressed and that the organisation can be stabilised going forward. My department has engaged an independent strategic partner to carry out this review, and the draft report of findings is expected before the end of the financial year. I will take time to consider the findings from the report and assess what further action is required by the department. In any event, the findings of this strategic review will assist Sport NI to identify and address a number of governance concerns and will also help inform the department of the approach required for any future review work as set out in the New Decade New Approach Agreement.
Minister, you might remind your officials that the 2 minutes is a limit, not a target. David Honeyford.
Thank you, Mr. Speaker, and thank you, Minister, for his answer. And it's the first opportunity I've had to wish him well in his new role. This morning there was an announcement, and we've heard of the £50 million commitment from the Irish Government for Casement Park, which I really welcome. And I look forward to future announcements for the UK Government and finally seeing Casement Park built. But can I ask the Minister, has he had any engagement with either the UK Government or the Shared Island Unit in the Taoiseach's office, specifically around increasing the funding also for the sub-regional football stadia and grassroots sport in general?
Minister.
Well, first of all, Mr. Speaker, I will endeavour to keep to the 2 minutes, because I'm sure when you were Minister you would never have dared go over that limit, and I will endeavour to do the same. And I thank the member for his warm words of welcome. I do have a meeting in the diary very soon to meet with the UK Sports Minister as set out in the Government's command paper. I look forward to that meeting to discussing some of the issues raised, because we're all in this chamber aware of really the underfunding of sports facilities right across Northern Ireland, right across all sports. So I'm looking forward to having that conversation to ensure that we do get the adequate resource from the UK Government's funds in order so that we can have new and improve the existing sports facilities in Northern Ireland.
Mike Desmond.
Mr. Speaker, and I wish the member well as Minister. As he suggested, this relationship between the Department and Sport NI has migrated from a management statement, financial memorandum, to a partnership agreement. Given that there's now a review underway, what does that tell us about the efficacy of these new partnership arrangements?
Minister.
Well, look, I don't think anybody in here will be surprised at some of the issues that have affected Sport NI over the last number of years, in particular in regards to budget allocations. I think it is important that all those issues are addressed, and the review will look into those as well, because I think we need to have an organisation that is able to deliver the support that is needed to sport and those grassroots facilities as well. And so I look forward to that review being carried out, and we'll see what further action needs to be taken.
Mr. McNulty.
Minister, wonderful news today with 50 million being agreed from the Shared Island Unit for Casement Park. And Minister, I know you're a soccer man, but would you agree to come into Casement Park to the Ulster final in 2027, the newly built Casement Park, supported by Sport NI, of course, and I will reciprocate by going to the Euros in 2028. Wouldn't that be just wonderful, Minister?
Minister.
So, Mr. Speaker, there are obviously a number of issues before we get to that stage. The member will be aware that there are still outstanding issues in terms of the quantum of funding that will be required and the quantum of funding that will be made available. Those are outstanding issues for the department, and we look forward to hearing more about that in due course.
Paula Bradshaw.
Mr. Speaker, I'm committed to ensuring that members of the deaf community have the same rights and opportunities as those in the hearing community and are able to access services in their own language. I am aware that profoundly deaf people consider themselves as part of a cultural and linguistic minority group rather than a disability group, and view their sign language as their language of need. Sign language users, like many other minority language users, cannot necessarily read or understand information on government websites or printed leaflets and various types of literature. One of the most pressing issues to be addressed to ensure accessibility and fuller social integration for the deaf community in Northern Ireland, therefore, is to increase supply of professionally trained and appropriately accredited interpreters. To address the current need for more British Sign Language and Irish Sign Language interpreters, my department is funding Foyle Deaf Association, a deaf-led sign language teaching centre in Londonderry, to provide an interpreter training programme to boost capacity. My officials are also exploring options with the Centre for Translation and Interpreting at Queen's University to provide an academic route to qualification as an interpreter to further increase capacity and expertise and to future-proof a sustainable supply of interpreters. In terms specifically of the legislation, my officials have been engaging with key stakeholders, which include the deaf community and their representatives, to develop the policy to inform the drafting of clauses for legislation. As a result of that consultation, I am pleased to confirm today that I intend to seek executive approval to introduce a sign language bill to the Assembly at the earliest opportunity. I also intend to seek the resources to put in place the infrastructure necessary to deliver on the intent of the legislation.
Ms. Bradshaw.
Minister, and I would wish you well in your new role. Minister, you'll be aware that they were promised this Act in 2003. 21 years that community have been waiting for this, and I would urge you to bring this forward as a high priority within your departmental priorities. Thank you.
I'm grateful to the member, and I share her frustration at the lack of time that has taken to progress this in the last number of years. We have seen obviously the sign language legislation introduced in the rest of the UK. There's also provision in the Republic of Ireland as well. I believe that this legislation could have a significant positive and hugely beneficial impact on the deaf community in Northern Ireland, and I look forward to being able to deliver this for those right across Northern Ireland who will benefit, and it certainly is one of my priorities for my time in office.
Call Colin Gildernew.
And take the opportunity to welcome the Minister to his role, and I look forward to working with you as Chair of Communities. And Minister, would you agree that deaf people have experienced generations of inequality and social exclusion as a result of underinvestment in these sources? And will you commit, and I know you've mentioned there, that the bill that you're laying will include both Irish Sign Language and British Sign Language?
Sure.
Yes, I completely agree with the member that this has affected many people, affected their educational attainment and their economic prospects as well. And I think there are steps that we can take to ensure that we can make that provision and improve those outcomes for people in particular. Northern Ireland, I suppose, is unique in having both users of British Sign Language and Irish Sign Language, and that's broken down roughly 3,500 British Sign Language users and 1,500 Irish Sign Language users. Those are separate languages, of course. Those are not just visual representations of English and Irish. And so, yes, there will be provision made for both in this piece of legislation.
Guy Middleton.
Thanks, Mr. Speaker, and can I thank the Minister for his announcement today and obviously for his investment in foil as well. Minister, will lessons be learned from other parts of the UK in terms of their legislation to ensure that the legislation that we have implemented here will be effective and that we can learn the lessons, of course, from other areas?
Yes, absolutely. I suppose one benefit, if we can call it that, of being a little bit behind other jurisdictions is that we can learn lessons from their experiences before. So we can look at what has worked and what additional work is still required. But what's really important for me is that we also listen to the deaf community here in Northern Ireland and their concerns as well. And that's what I intend to do as part of an extensive consultation process.
Robbie Butler.
I welcome the Minister's announcement today, and also I'd just like to give the Minister the opportunity to commit to achieving this in this mandate, and also would the Minister be minded to incorporate the UNCRPD in regard to the ambitions with the legislation?
Minister.
I have to come back on the second point of his question, but yes, my sense certainly around this chamber is that we have support from all parties, and that should make it easier to get the legislation through, and I look forward to support right across the chamber.
Trevor Clark.
Question number 4.
Mr. Speaker, implementation of 18 of the 20 proposals to change the housing selection scheme is ongoing. It is being carried out on a 4-phase approach by the Housing Executive with support and oversight from officials within my department. The aim of the proposals is to make the allocations process fairer, more transparent, and ultimately to enable it to work better for people in need. Stage 1 was implemented on the 31st of January 2023. Stage 2, containing the next 5 proposals, is almost complete. I will provide an update on this stage in due course.
Mr. Clark.
Can I thank the Minister for his answer? Will the Minister agree with me that in many instances, while people are intimidated from their homes, in many instances this has been abused in terms of making people's allocation of points more favourable? And in terms of each of those phases, has any consideration been done in terms of the intimidation points to review how those have been allocated?
Minister.
Yes, Mr. Speaker, that is absolutely the case, that intimidation points are being looked at. It's one of the 2 points that weren't progressed in the previous mandate. The previous Minister had asked for additional information, and that research is being carried out. Under the current scheme, those who are subject to intimidation receive 200 points. And I think we can all agree that intimidation, whatever form it takes, is unacceptable, as is the impact that it can have on the wider community. And I can assure you that the immediate personal safety of the applicant will always be addressed first and foremost. But independent research is currently being conducted on this matter. It's due to complete in March 2024 with a view to producing a series of options for the future of these points. I will consider these options, but I've taken on board what the member has said, what many other members have said as well, and look forward then to bringing forward proposals.
Andy Allen.
Can I echo the comments in welcoming the Minister to his post? He's many challenges ahead, and I hope he faces those head on. Minister, the review of the housing selection scheme is vitally important in delivering housing, but I think we'll all accept that the major challenge is the lack of available housing right across the board. So, Minister, can I ask what thought you've given to leveraging FTC within your department to deliver more social and affordable housing?
Minister.
Well, Mr. Speaker, obviously it is right that the housing selection scheme it's important that we get that right. But one of the reasons why there is so many difficulties is because we don't have enough housing stock, and that's where there are a lot of difficulties and a lot of people then that are waiting. So I absolutely believe that is an issue that we need to address. We can do that through a number of ways. We need to look at the number of empty homes that we have in Northern Ireland and what we are doing to try and address that issue. we need to look at the model for the housing executive and allow changes to take place so that we can build more houses in Northern Ireland. We need to make sure that we have a greater supply of affordable housing as well for those that are looking to rent or to purchase their own home, and of course looking at opportunities such as FTC as well to see where that can be used in order to build more homes, because so many of the problems that we're facing, the delays that people have in getting housing, is down to a lack of supply, and that's what we need to address.
Mark Durgan.
Speaker, thanks to the Minister for his answers and congratulate him on his new post. The Minister's outlined his intention to make the housing allocations scheme faster and fairer, and obviously one surefire way of doing that is increasing the supply of homes. Could the Minister outline how many homes he intends to deliver over the remainder of this mandate?
Minister.
Well, unfortunately, I'm not able to give those figures because so much of what we will be able to do will be dependent upon budget. And unfortunately, the member will be aware of the very constrained environment that we are in terms of our budget. But he was right to indicate at the start, in order to deal with housing in Northern Ireland, we can't just look at the number of houses that we ourselves are intending to build. We need to make it as easy as possible to build houses, to make homes as affordable as we can, and also to look at other ways for houses to be built, not just directly through money that's available in my own department.
Neil McAllister.
Response so far, and I also wish you good luck in your new role. The Minister will be aware that tackling violence against women and girls requires all departments in the Executive to work together, and until the housing allocation scheme is fully implemented, in the meantime, could the Minister commit that one way to do that was to include domestic violence as a form of intimidation in receiving intimidation points?
Minister.
Yes, and as I said to the other members, under the current scheme, those who are subject to intimidation receive 200 points, and the intimidation category is very specific and does not include domestic abuse. Under the current scheme, someone who leaves their home as a result of domestic abuse can be allocated points for homelessness and primary social needs points, or violence or the threat of violence. Now, independent research is being carried out and it is due to be completed, and this will help inform the next stage of the works. But I have a huge degree of sympathy with what the member is saying, and I will be looking into this issue.
Doug Beattie.
Thank you, Mr. Speaker. Question 5, please.
Mr. Speaker, in my department's role as statutory planning consultee on archaeological matters, the Historic Environment Division continues to provide advice to the Planning Authority regarding the ancient burial cairn at the summit for Knock Ive. This cairn is protected as a scheduled historic monument. There are several long-running planning matters concerning a wind turbine at this important historic site. These issues remain the responsibility of Armagh City, Banbridge and Craigavon Borough Council as the relevant planning authority. Over recent years, my department's officials have also undertaken an enhanced quarterly inspection regime to ensure the appropriate ongoing conservation management of the cairn. My department will continue to fulfil its statutory responsibilities to ensure that the scheduled monument at Knock Ive is appropriately protected under relevant legislation.
Mr. Beattie.
Thank you, Minister, and best of luck for you in your new role. People will know that I've been pushing this issue for quite some years now. We simply cannot allow our historical wealth to be destroyed in this manner. So my question is reasonably simple, Minister, if you would be willing, along with the Historical Environments Division, to meet the Save Knock Ive campaign group to discuss bringing this historical site into the care of the Northern Ireland Government?
So, Mr. Speaker, first of all, I understand the frustration that many in that area feel as to the process over the last number of years. The Department for the Environment is responsible for the planning application that was passed. Historical Environment Division weren't consulted. If they had, they would have had something to say about that. Planning Authority responsibility has now transferred to Armagh City, Banbridge and Craigavon Borough Council, and we're left in a position that is not good for anybody. The current problem that we are facing, I don't believe would have made any difference had the monument already been placed under state care. I think that the response that the Department for Communities under the Historical and Environment Division wouldn't have been any different. However, my department remains committed to providing any help and advice that it can in relation to this issue, and if a meeting with either me or my officials would be helpful to discuss what help or advice we can provide, I would of course be happy to do that.
Owen Tennyson.
Mr Speaker, and I congratulate the Minister on his new position. The Minister has outlined that Armagh, Banbridge and Craigavon Borough Council is the relevant planning authority, but would the Minister agree that, given that the original decision predated the Planning Act, that it is wrong that the burden of this decision is now falling financially solely on ratepayers in that borough?
Minister.
Yeah, I understand the difficulties for the council concerned whenever it now has to take responsibility for a decision that it did not make, but the member will understand it's not an issue for the department, for communities directly, but like I have said, I am willing for HED to get involved in any way it can to provide any help and advice as is necessary, and you may want to address some of those issues to the Department for Infrastructure.
Claire Sugden.
Number 6.
With the Speaker's permission, I'm going to group questions 6 and 8 together. I welcome my colleagues' interest in our local footballing infrastructure, which is badly in need of investment. The facilities used to play football across Northern Ireland at all levels are, in many cases, in poor condition and no longer fit for purpose. I recognise and share the deep frustration of many that this long-standing executive commitment has not yet been delivered. My officials are working closely with clubs at all levels to build strong relationships and understand needs, and are developing proposals in partnership with an advisory working group. I have asked my officials to present me with proposals and options for consideration to take this commitment forward as a matter of priority. Once final proposals are confirmed and approvals are secured, I will be able to provide a timescale for the process to apply for funding. I am committed to delivering this important investment, and I recognise the valuable contribution it can deliver for football and for wider society.
Ms. Sugden.
Thank you, Mr Speaker. I wish the Minister well in his portfolio. I also wish that he brings some of that money to Korean Football Club. We've been advocating for this funding for quite a while now. Minister, it seems, or it's expected, that there's not going to be enough money. Are you going to be advocating to the Executive to give more money so that it's not just Korean Football Club who benefits from this funding?
Minister.
I know that Korean Football Club is looking for funding, as are many other clubs, both at Premiership, Championship and grassroots level, and I will absolutely be going back to the Executive looking for more resource.
Mr Buckley, 1 minute.
Thank you, Mr Speaker. And the Minister will be aware that Portadown Football Club have been preparing for the redevelopment of Shamrock Park for many years, and I was delighted to see it shortlisted by his department to advance its business case. So can the Minister provide clarity on how his department will be ensuring these clubs who are spade ready are prioritised in funding going forward?
Minister.
Well, I'm delighted that funding was able to be made available so those business cases could be taken forward, and that a number of clubs will be in the position of being well advanced ahead of me giving final consideration to the different options that are going to be coming my way very shortly. But we look forward to analysing all of those cases as they come in. But it is very important that we look at the level of need and the business cases and everything else to make sure everything that is necessary is in place.
That concludes listed questions. Now move to topical questions. Mr Stewart had to withdraw because he feels unwell, so we move on to number 1, Daniel McCrossan.
Thank you, Mr Speaker. Minister, today is a positive day. €50 million has been pledged by the Irish Government, a solid commitment to the delivery of Casement Park. And sorry, Minister, if maybe it's just not you're having a good day, but you don't seem overly happy or positive about that decision. So in your response to me in a second, give some energy to this, because Ulster Gaels are very excited about today. This is a good day for football fans, for sport across NI. Would you agree?
Get the question,
Thanks very much.
Well, Mr. Speaker, as I said to the member's colleague, the member's former colleague, as I said to Mr. McNulty, there are a number of outstanding issues, both in terms of the quantum of funding and in terms of the total cost and where that funding is coming from. And I look forward to further clarity on that.
Mr. McCrossan.
Thank you, Mr. Speaker, and thank you, Minister. But Minister, 50 million is a fantastic start. It's a springboard. Have you had conversations with the Secretary of State of British Government about finding the rest of that money, or executive colleagues indeed, and will you commit to this House that you'll do whatever within your gift to ensure that casement is delivered?
Minister.
Well, Mr. Speaker, I have to be honest with the House and say that it is not going to be within my gift. This is outside of the control of any one department or outside of the control of the Northern Ireland Executive. I have explained to the member the difficulties that exist around uncertainty in terms of cost, uncertainty in terms of funding. But I can commit that I will provide that information to the House as soon as I can.
And I'll join the others when welcoming you, Minister, to the Department for Communities, the best department, if I may say. But I will ask the Minister, have you any plans in this mandate to deliver a national strategy on retrofitting that will take community-based area approach to include options for social housing?
Minister.
Well, Mr. Speaker, as I have indicated in my previous answers, I believe that we do need to see improvement in terms of our housing, not just in the number of houses that we have in Northern Ireland, but the quality of some of our housing as well. And we see that, I don't think a single MLA in here who's in touch with their constituency doesn't get complaints and concerns, justified complaints and concerns from their constituents. As I've said, and this may indeed be a frequent refrain from me, we are living in a very tight budgetary environment, but that's why we also need to look at alternative funding measures.
Ms McAllister.
Thank you, Mr. Speaker. I thank the Minister for his answer, and I really look forward to that. Recently I met with Bayview Contracts, a fantastic company in Newry who have been delivering retrofitting in the south of Ireland. Actually, what's interesting for me is when you talk about external funding, one of the routes to that external funding is making a decision on whether we go for BEAR rating, the building regulation rating, or the EPC rating. Has the Minister had any chance in a short tenure with communities to have a think about that?
Minister.
Short answer is no, but I'm certainly happy to find out more.
Neil McAllister.
Be aware that last year over 3 families had their discretionary housing payments removed. These families, often without security of tenancy, who will then go on to waiting lists and exacerbate the housing crisis in all of our constituencies. Will the Minister today commit that there will be an equality impact assessment before any more cuts are made to services on the most vulnerable in our society?
Well, Mr. Speaker, can I say at the outset, my job is to protect the most vulnerable in society, and there are many different ways in which I can do this within this portfolio. I have also committed to looking at where we are spending our resource and to make sure that we spend every pound that we have in the way that makes the greatest impact upon people in Northern Ireland. I wasn't aware of the exact figure that you had quoted to me, but I am more than happy to look at it and come back to you.
In that case, Minister, might I be cheeky then and ask if you would consider reversing that decision that was made, subject to a business case made to the Department of Finance, because it is the most vulnerable in society that continue to be affected?
Mr. Speaker, I will of course look at that, and if the member would like to meet with me, I'd be happy to offer a meeting to discuss.
Buchanan.
Thank you, Minister. The Arts Council back in October had a scheme for bands instruments. I understand the demand was very, very high. Can you provide me with an update on this funding stream, please?
Yes, I can, Mr. Speaker, because Cheryl Brownlee has already been asking me this question, so I can confirm to him that there were a total of 475 applications to the Arts Council of Northern Ireland's 23-24 musical instruments programme. A total of 296 of these applications met the eligibility conditions of the programme, and of these, 43 were successful.
Mr Buchanan.
Thank you for that answer, Minister. Based on your numbers you've just provided, can you provide assurance to those that were unsuccessful based on the high demand, due to the limited budget, that this budget will be looked at accordingly, and the process for getting this funding? It's one of the most difficult processes out there for any funding stream.
Well, to make a couple of points, Mr Speaker. First of all, it was clearly oversubscribed, massively oversubscribed. So I think that does necessitate us to look at it again and see if we are able to provide more funding. And I think it would be a fantastic programme to allocate more funding to. I also note what the member said in terms of how complicated this application process was. Often these are volunteers that are filling out these forms. They have huge pressures on their own time. They're maybe not used to filling in applications like this. Many of them maybe filled them in for the first time. I know I helped many people fill the forms in. Other MLAs will have done the same. So I do think it is important that whenever people are applying for funding, we make it as straightforward and as simple as possible. And if the member has concerns, I would encourage him to send those to me, and I will certainly look at how we can make application processes in the future as simple as they can be, not just for the arts councils, but for the other bodies under the remit of this department.
Mr Stewart's withdrawn. Mr Cullinan is not in her place. Paul first.
Housing is very important, Minister. Can you outline your priorities with regards to housing during your term in office, and how it will impact positively in my constituency of North Antrim?
Yes, absolutely. And first of all, I would say that housing is a priority. I don't think anyone can come into this department and say that it's not. But as I have outlined, there are a number of things that I think that we can do to improve housing in Northern Ireland. But I would, of course, first say this. This is a hugely important impact upon the lives of people. If someone has a warm home to live in, it gives them huge advantages moving forward, a safe place to live. Too many children are growing up without the security of a home. Far too many people are in temporary accommodation, being moved from place to place every few weeks or every few months. Too many people are having to move away from where they're living as well. So, as I've outlined already, I want to make sure that we are looking at those empty homes in Northern Ireland. Scotland and Wales have actually taken initiatives to ensure that they can tackle those high number of empty homes that existed there, and some with considerable success. What we also need to do is look at the funding model for the housing executive, and importantly, and this will require a cross-departmental approach, but look at planning, look at where we build our houses, how we build our houses, making sure that we have the infrastructure in place so that we can make housing as affordable as possible, and allow people to get on the housing ladder. Those are some of the things that I hope to tackle during my time in office.
I think the Minister for his answer. He'll know, and he'll live through the issues around the contracts with the housing executive over the last summer. Minister, can you assure this House that you'll do everything in your power to try and resolve those, so that when contracts ends and new contracts are renewed, that there's not this massive gap which impacts on not only the maintenance of houses but housing allocation?
Minister.
Yes, I absolutely can, Mr Speaker.
Down Dodds.
Mr Speaker. Minister, many churches in my Upper Bann constituency provide not just spiritual support but practical support to their communities. The House of Good report commissioned by the National Churches Trust indicated that for every £10 spent there was a return of £37.50. And you will be aware, Minister, of the difficulty there is in having faith-based organisations funded. Have you any plans to address this issue, and how quickly can we do it?
Minister.
I'm grateful to the member for her question. I absolutely agree with what she has said in terms of the impact that church and faith-based organisations can have right across Northern Ireland. In fact, I'm sure we all see it in our own constituencies, whatever background you come from, whatever faith or none that you might have. We can see the impact that has, especially among children and young people in particular. I have been approached by a number of people in recent years saying how difficult it is for some faith-based groups to get funding, and quite simply I don't believe that anyone should be discriminated against on the basis of their faith or religion.
Ms Dodds.
Thank you, Minister. I indeed look forward to working with you to realise how we can actually address this issue, because I do think of, for example, Emmanuel Church in Lurgan, the counselling services, etc. they provide, and they're very, very important, and would invite you to come down and discuss the matter with them.
Mr Speaker, I would be delighted to join the member in her constituency and engage with those faith-based organisations, and I hope by doing so I can highlight some of the work that they have done, often those unsung heroes that contribute hugely to people's lives right across Northern Ireland.
To the comments made in wishing the Minister good luck in his new post. Can I ask the Minister if at long last we are any closer to seeing the local and regenerational town powers transferred to local councils?
Well, Mr Speaker, that would be a cross-cutting issue and therefore one for the Executive.
Thank you, Mr Speaker. Well then, Mr Speaker, on something more specific, if I could ask that 10 years after the formation of the so-called super councils being created, are there any plans to review the structures and mechanisms around those councils which may, for example, be blocking the bringing forward of local development plans this far down the line?
Mr Speaker, you'll hopefully forgive me in not being just over exactly what the member's raising in relation to that. I know that there are a number of issues waiting for me in terms of the local government group within my department, and a few different issues which I will be taking on, but in relation to local development plans, that's something I'm going to have to come back to in writing.
And welcome the Minister and wish him well in his role. The Minister knows how important the rate support grant has been to local councils, particularly in the least well-off area. Can I ask him if he plans to reinstate it?
Yes, Mr Speaker, the rate support grant is a statutory discretionary in amount but is not ring-fenced, and if any further funding becomes available for the current financial year, I will consider the funding for councils in the context of my department's overall budget priorities. The budget for 24-25, as you'll be aware, hasn't been agreed yet by the Executive, and therefore I'm unable at this stage to confirm any funding for councils for the next financial year.
Thank you, Minister. Can I ask you if you would place in a business case on record for that?
Mr Speaker, this is discretionary in amount, and all of the decisions around the rate support grant will be entirely dependent upon the budget allocations that are provided to me and the decisions that come from that.
Questions. I commend you, Minister. You got through all of the topical questions, so you're to be congratulated for that. If members would just take their ease, there's an urgent oral question, and there's a change at the top table. I'm going to conduct the urgent oral. So, Colin McGrath has given notice of an urgent oral question to the Minister of Health. I would remind members that if they wish to ask a supplementary question, they should rise continuing at their places. The member who tabled the question will be called automatically for a supplementary. Clerk, please read the question.
To ask the Minister of Health to outline what steps he is taking to prevent the strike action announced by junior doctors on the 19th of February 2024.
Minister of Health.
Thank you, Speaker. I am acutely aware of the pressures faced by doctors and the concerns raised in relation to pay. I've been clear that resolving the ongoing pay disputes is my immediate priority, and that is why I have tasked my officials to move to immediately implement the DDRB recommendations for 23-24 pay for all doctors employed in health and social care. For junior doctors, this will bring an average pay increase of 9.07% in 23-24, with those in their first year receiving a 10.68% uplift. So that is not an insubstantial pay award when viewed across public and indeed private sectors, and will be backdated till April 23. The award will bring junior doctor basic pay above the level in Wales and closer to the rate in England. As members will be aware, there is a different contract in place for junior doctors in England, so precise like-for-like salary comparisons are not possible. Basic pay, however, is not the whole picture when estimating take-home pay for junior doctors, because all junior doctors receive further allowances ranging from an additional 20 to 100% of basic pay depending on their rota. My department has also engaged with the BMA to discuss the way forward on outstanding issues. That includes a commitment to further engagement on pay, and this will of course be better informed where there is greater clarity with respect to the outcome of the current industrial action being taken by doctors in England. However, my department is committed to ongoing engagement. Extra funding has been secured for public sector pay for this year alone. The agreement on the allocation of £550.6 million to my department for pay awards and other pressures allows my department to continue to move forward in its negotiations with unions, and we remain hopeful that a satisfactory solution for all parties can be reached. It must be recognised that this funding will have to be shared across all different sections of the workforce. The reality is that implementing the recommendations of the independent pay review bodies of mirroring the 23-24 pay settlements in England is at the very limit of what can be afforded at this point. As members, we should also be very mindful, Speaker, of the significant disruption that further industrial action will have on a wide range of our core health and social care services, not least on elective activity. The debate this morning illustrated clearly the need to ensure no opportunity for capacity is wasted, and that is why I would again appeal to BMA to recognise the financial limitations in which all departments are operating within, and to acknowledge that further action at this time, before a final outcome on pay has even been reached, would be highly damaging.
Thank you, Mr. Speaker. Mr. Speaker, 97% of junior doctors balloted voted for the strike action. They have suffered 16 years of pay erosion, which has resulted in 30% loss of pay. Junior doctors just this week in Scotland were awarded 12% pay rise. Is the Minister assured that the Department of Finance has given him the correct amount of money to be able to bring a resolution to this issue for both this year and going forward into the future?
And I thank the member for a supplementary. I'll deal with the last point first. I don't have any allocation in regards for next year, never mind honouring the pay commitments that I'm making this year. Of the 660 odd million that was given out by the Finance Minister this year, I did receive 550.6 million for those pay awards and other pressures that does allow my department to move forward.
Thank you, Mr. Speaker. Minister, only a matter of weeks ago, your party colleagues stood on picket lines supporting fair pay for striking health workers. Will we have the absurdity of your party colleagues joining junior doctors on the picket lines on March 6th and March 7th, where your department implements a real terms pay cut, or has your party abandoned fair pay for health workers now in government?
I appreciate the political points that the member tries to score in this regard. I can assure him of my commitment to all our health and social care workers. That's why I've moved to implement DDRB, moving the junior doctors to where they are now, but also continuing to engage with all my AFC, Agenda for Change, unions as well, to make sure that I can get a proper recompense to them as supported by executive colleagues.
Minister, we continue to lose junior doctors to other jurisdictions who can offer better pay rates, but in addition to the pay issue, can the Minister advise what steps he has taken to address the significant burnout that many junior doctors are experiencing on a daily basis if we want to try and retain the staff that we currently have?
And the member does raise a valid point, and that is why I would be keen to continue that engagement with BMA across their central committee and across all their all other disciplines as well, to make sure that we as a health service recognise the pressures that they're currently under, not just in regards to the financial situation that we're currently in, but also in that workload pressure as well, because we do recognise of how much we actually ask of our workforce and how much we depend on them. So it's how we engage on all aspects of those negotiations, and that's why I'm continue that engagement with BMA.
Thank you, Mr. Speaker, and whilst fully understanding the level of hurt and anger that there is among junior doctors who have faced a real-time pay cut, Minister, we have had a year of continued strike actions across our health service, so I ask sincerely, Minister, how impactful has the year-long strike action been on patient health outcomes in Northern Ireland?
I'll be honest, it has been impactful in regards to the waiting list, and that's why I would encourage junior doctors not to take that industrial action in March, because I am aware the ballot was taken while this place didn't sit, and I think that's the point the member needs to reflect on as well for those 2 years that was missed in regards to actually implementing this DDRB pay award and agenda for change pay awards that could have been implemented in the past 2 years rather than leaving it to this late stage.
Mr. Speaker, Minister, I'm very much aware of the vital role that junior doctors play within the health service. Pay decline has been a long-standing issue, but it's not the only issue that affects them, and it's not the only one that informs their industrial dispute. Since the announcement yesterday, has there been contact with the BMA in order to have ongoing negotiations in order to resolve this? A strike would have a huge effect on the delivery of care right across the system and would be felt for quite a long time afterwards.
My officials are continuing to engage with BMA, and I've a call out to meet with the chair of BMA Council next week, and that will be scheduled. We'll meet then, because we have, and I've always had a good working relationship with all healthcare sector unions, because our workforce is the core of what we do. So I've always been open to them, I've always been engaging with them, and I continue to be so, but it has to be a two-way street.
Thank you, Mr. Speaker. I thank the Minister for his responses thus far, and I agree that our junior doctors are an absolutely essential component of the local service. Despite no dedicated funding being immediately available to the Minister, is he considering contract negotiations, and if so, what would that look like?
I thank the member for a valid point. I am very keen to discuss a new contract for our junior and trainee doctors, because their contract was actually last updated in 2002, and I believe it actually no longer reflects the way in which a modern health and social care system works. The current contract gives a trainee junior doctor a basic salary with an additional supplementary payment for those out-of-hours work and the frequency of weekends worked, and that supplements those ranges that I mentioned earlier from an additional 20% to an additional 100%. So that's added to their basic salary as a multiplier of their pay point, which has resulted in a lower basic salary and higher variable supplement, leading to a large variation in pay. And I've already received evidence from trainees and employers that has indicated that this system of payment does not adequately reflect the work undertaken. The contract that was changed in England actually recognised that and introduced a higher basic pay and a lower variable rate that provided those trainees and junior doctors with a more stable income. And that's something that I would like to review in any contract negotiations.
Well, others, it would seem, would even prioritise funding for Casement Park over health. Could I ask the Minister, if he even had a fraction of the cash to be splashed on the A5 and on Casement Park, could he more than generously meet the junior doctors' claims? And in terms of the hemorrhaging of junior doctors away from Northern Ireland, are there other incentives as well as extra pay which you could provide to them to ensure that we retain those we train?
And the member makes a valid point in his last point in regards to my answer to Mr. Chambers in regards to how we actually look at that contract. So it's how we get the balance of a basic pay as to the supplements they actually get and realign that the way it currently is in England. And I think there's a considerable piece of work that has to be done in regards to that, because that last contract review was in 2002, so almost over 22 years ago. So some of our junior doctors wouldn't even been about at that point in time. So there is something can be done in regards to that contract. In regards to the spends of other monies, I'll always make bids in regards to where I think that money can be spent, and I did receive the 550.6 million in regards to those pressure points to honour the 23-24 pay awards, which I'm moving to do.
Corlia, thank you, Mr. Speaker, and I thank the Minister for his answers so far, particularly in relation to looking at renewing the contract. I think this is a really important point. Included in that as well as pay, can you look at the conditions that some of these junior doctors are working under, and actually in some cases living under in some of our trusts and some of our hospitals, that they're expected to to work in, sleep in, live in, and the conditions that they are currently in are absolutely disgraceful. So there's a capital element to this as well. Can you give us some reassurance around that for junior doctors also?
And I thank the member, because it is a valid point, and I've actually had the same and side conversations since I came back into the office in regards to even some of our consultants who have travelled to other hospitals to provide support being put in inadequate substandard accommodation as well that has been used by our junior doctors. So there is a piece of that comfort and care that we have a duty of care to our junior doctors and all our health service workers in regards to those who have to work overnight, spend allocations, actually working weekends, night shifts, all the rest of it. I think it was actually raised yesterday in a debate in regards where junior doctors were concerned they couldn't even leave personal possessions in regards to coats, handbags, purses, wallets, all the rest of it, that they were actually in fear of them being stolen when they're being actually on the wards doing their duty of care. So that's something that has been raised with the Trust. It's something I would like officials to further engage with BMA and junior doctors in regards to those ongoing engagements rather than just solely about pay. There's so much more we could be talking about to support them.
Thank you, Mr. Speaker, and thank you, Minister. We are all aware that we had a debate this morning on the impact of waiting lists on people. I know it's early days, but does the Minister have a sense of what industrial action will mean for patients in the coming days should the action go ahead and the pay negotiations not be successful?
And I thank the member, in light of this morning's conversation, is a debate as well in regards to the support that we need to give to our healthcare workers, and that would be across all our healthcare workers, including our junior doctors. And I did, in my initial answer, acknowledge that further action at this time will be highly damaging, because it's not just the removal of the junior doctor workforce from our wards, from our A&Es, from our GPs. It's the fact that they then have to be backfilled by consultants and other doctors as well. So it's how we have to move them away from the service. And that's why, again, I would ask for the BMA to recognise the financial limitations that departments are operating in, and acknowledging that further action at this time, before that final outcome on pay has even been reached, is going to be highly damaging.
Minister, thank you for coming here today and answering these questions. There was a report in BBC Northern Ireland in the last day or two about the epidemic of what's called quiet quitting among junior doctors. Does your department collect information on the destination of junior doctors when they leave? Because we do know there is an epidemic of people leaving, whether it's to the south of Ireland, across the water, to Australia, or simply out of the profession. We are losing people at an epidemic rate. Does the Minister's department collect that information, and will they use it to better design a long-term strategy for keeping and recruiting junior doctors?
And I thank the member. And it was a piece of work I commenced across all health and social care workforces before I left the last time, in regards to not just recruitment but retention across all structures, not just junior doctors but across our nurses, our AHPs and all professions as well. So I don't have the updated detail in regards to where that looks at specifically in junior doctors, but the retention piece was a high-profile piece of work that my department was undertaking.
Okay, members, that concludes the urgent question. We're now going to resume the debate. I'm going to change the top table here. So take your ease for a moment, and the next speaker will be Patsy McLone.
Okay, members, we resume the debate on the motion on speech and language therapists, and I call Patsy McGlone.
Good last Corlia, and I would like to say I welcome the motion and the opportunity to debate this issue today. The SDLP believes that speech and language therapy is a cost-effective and a very important service which can transform lives and empower individuals. If unaddressed, however, speech, language and communication needs can have a long-term impact on an individual's educational, employment, social inclusion and mobility with mental health, and as reflected in the motion, involvement with the justice system. At least 30,000 people in the North live with long-term communication difficulties, and that figure is likely to continue to rise, unfortunately. A large percentage of people with learning disabilities have communication difficulties too, along with around a third that is, of stroke victims and over a fifth of people with brain injuries. In the criminal justice system, research by the Royal College of Speech and Language Therapists has indicated that up to 60% of young people who offend in Northern Ireland have low language skills. The RCSL screening of a sample of residents at Hydebank Wood College found that 75% of the women and 100% of the men assessed had speech, language and communication difficulties. Studies have repeatedly shown that speech and language therapy results in better language and educational outcomes, and it can be particularly effective with young offenders. Furthermore, it has been demonstrated in the United States that an institution with a full-time speech and language therapy provision can have a reoffending rate less than half of the national average level. Better communication benefits the criminal justice system too. It enables provision of a specialist support to help reduce antisocial and offending behaviours. So, the SDLP is happy to support the motion. However, we would like to see resources made available to support interventions at much earlier points in people's lives. For a variety of reasons, and particularly in areas of deprivation, too many children are ill-prepared for learning by the time they reach school age. In the response to the recent independent review of education in Northern Ireland, the RCSL highlighted the need for the development of multidisciplinary teams, with classroom teachers supported by a range of other specialists in all schools, colleges and other educational institutions. They also argued very persuasively that early years settings and primary schools should have greater access to play therapists, speech and language therapists and educational psychologists, and I'm sure all of us know that from our experiences within our constituency offices. The Education Minister should restart the Healthy Happy Mind scheme, for example. But even in terms of the focus of the motion today, there will need to be more investment in the speech and language therapy workforce. The Department of Health Workforce Review Report on Speech and Language Therapy in 2019 recommended that the number of commissioned undergraduate SLT places at the University of Ulster needed to be increased on a phased basis to 40 places by 2024. This was after a decrease in numbers from 32 places in 2009 to 23 places in 2018. Last year, that figure had risen at the Ulster University to 38 places available, just short of the target. The number of applicants' places has more than doubled at the same time, from 261 people applying in 2019 to 543 last year, and the current number of applicants for 2024 is 643. The demand and the need, obviously, is there for places, and obviously the Department of Health has more than a significant role to play in this, clearly with justice in collaboration for where it affects the justice system. We need to be producing more qualified speech and language therapists, not just to meet the increasing demand in the sectors already provided for, but also to expand that provision into other sectors, like the motion indicates, where it can have a real and beneficial impact on people's lives. Agus Sinead Alaskon Corlia. Thank you.
And thank you. I call Arlea Flynn.
Miagat Alaskan Collia, and I'm pleased to rise today and speak in support of the motion that's been brought forward, calling for the enhanced supports and training within our justice system to help support people with speech, language and communication difficulties. And I'm also glad to see that the speech and language therapists are commended within the motion for the great work that they're doing across the prisons in supporting adults with these difficulties. And despite the prevalence of these vulnerabilities, I know a couple of people have mentioned that within the prisons it's that figure of around or over 60% within the prison population. But despite that statistic and the growing numbers of people that are coming forward with complex mental and physical health needs, prison staff are only receiving limited training on these vulnerabilities, including the speech and language communication needs. So unless those needs are identified and properly supported, they will act as a barrier to people receiving the appropriate referrals, assessments and treatment programmes. Speech and language therapists working across the prison estate can help support identify these needs. They can provide people with a proper diagnosis, and they can also train the workforce on the links, the important links between mental health, speech, language, communication and swallowing needs, and how to respond to them. And fully endorse calls from previous reports that's been carried out into these issues to support prevention and the early identification of mental health problems, where the whole prison workforce is trained in understanding the links between speech, language, communication and mental health. Mental health difficulties alone can create communication problems for people. And even if someone has no existing speech, language or communication difficulty, if they have a chronic or acute mental health episode, this can impair their communication with other people. Specific mental health conditions can also have communication and swallowing difficulties associated with them, including depression, schizophrenia, dementia, and psychosis. And there are also many people in prison with a primary mental health diagnosis who also might have dementia, brain injury or other long-term conditions. So again, this indicates a greater need for critical speech and language therapy support within this environment. Speech and language therapists can enable people who have mental health disorders to develop the skills that they need to access information about their condition, and also to give them the ability on how to express themselves more effectively. And crucially then, they can provide that support to the wider prison staff and the multidisciplinary teams in terms of how they can communicate effectively with people who are battling with these issues. Due to the high prevalence of speech, language and communication needs and other complex needs in the prison population, it is important that the entire prison workforce should be able to recognise these vulnerabilities, and they should be equipped on how to deal with them when they arise. And so, yeah, it was a couple of years ago now, our own Audit Office report was published, I think it was in 2019, it was more specifically around mental health within the prison system. But again, it's obviously relevant to this particular motion in terms of speech and language therapists. And in that report, it had outlined back then how organisations across all stages of the justice system were facing significant pressures as a result of the growing mental health needs among the general population. And just as the health system here has found it challenging to respond to this huge growth, our justice system is now also coming into contact with these increasing numbers of people who haven't been able to access key health and social care services that they need. So I hope that today's motion can obviously help support the Minister. I know it's not obviously just on the Department of Justice, it's also on the Department of Education, and I know that the Minister in the past has been supportive of different pilots and programmes in terms of mental health, justice and health, the pilots around the custody suites, around the multi-agency triage teams. So I know that the will and the want is there, but she'll obviously need support from other colleagues, particularly health, to try and bring the detail of this motion forward. Thank you.
And I call Maurice Bradley.
Thank you very much, Mr. Deputy Speaker, and I thank the members for bringing this motion before us today. Mr. Speaker, screening and assessing young people to determine their speech, language and communication needs is vital to assist those inmates who may have a high prevalence of language and communication disorders and could end up being more vulnerable within the prison system itself. Speech therapists are more important members of the legal workforce and improve the health, well-being and participation of people in contact with or at risk of contact with the judicial system through the prevention, early detection, assessment and treatment of communication disorders. Supporting young people to develop their own strategies to facilitate communication, to aid working with others to make treatment, education and information more accessible is vital. Training in the workforce could help identify who may need support with speech, language and communication and understand how this might impact upon them. Difficulty in language development has been associated with the higher risk of getting involved in criminal activities. A high percentage of young people who have committed infractions have some kind of language or communication difficulty. In general, the prison population is growing along with its health and communication needs. The impact of any communication disorder that affects an individual's ability to understand, detect or apply language and speech effectively can lead to a variety of conflicts. We would be supportive of a training needs analysis or audit among not just prison staff but the wider justice workforce in Northern Ireland. Prison officers and staff are often unaware how to best engage and support a person with complex needs. That needs to change. We recognise support calls for earlier interventions and SLCN screening in youth justice settings in particular. However, it is also important to note that gaps in identification remain across all age groups. We also need to challenge any perception that addressing these challenges is solely in the gift of health professionals, but also education as well as justice. Yes, SLTs will have a role to play. The member opposite alluded to the value of having trained speech and language therapists, the high number of applicants and the small number of university places available. Greater use of university places would be an advantage, and I would agree the University of Ulster would be ideally placed at Magee, but also at Coleraine and Belfast. However, we also need to build capacity among all stakeholders who interact with young people and adults with SLCNs. We need to support these people through their journey through the judicial system. Any sense of asylum mentality must be removed. I would ask, is there merit in evaluating the potential for national accreditation in some areas? In supporting the motion, I would add it is vital that we support a whole system approach to tackling SLCNs. In many ways, this motion is talking about addressing the symptom rather than the cause. We need to ensure fewer of our young people enter the criminal justice systems with unmet communication and language needs. That includes tackling many socio-economic drivers. It means tackling deprivation, poverty, educational underachievement and adverse childhood experiences. Mr. Deputy Speaker, I support the motion. Thank you.
I call Nuala McAllister.
Thank you, Deputy Speaker, and thank you to the members for bringing the motion here today. A lot has been said, in particularly with regards to those members or those people who are part of the criminal justice system, but I would like to focus a lot of my attention today on society as a whole, because we all know that people do not enter the criminal justice system and suddenly develop a speech and language communication need. If they have entered the criminal justice system, particularly as a youth offender, then society has already failed them. I just want to talk about a number of points that we could actually focus on here today, but in our role also for the entirety of the executive. Tackling poverty is one step. Ensuring that those who are most vulnerable in society are assisted in the best way possible. We all know about the advantages of Sure Start and the schemes in which they run in our own communities. However, we need to see the expansion of those Sure Start facilities, because not all communities who are in dire need are actually able to avail of all the services within Sure Start. The reason why I highlight this is because not only are Sure Start having not only does Sure Start bring much community needs, but they also have those professional backgrounds such as health visitors and those who have previously been midwives. I point this out because it is often health visitors and midwives who help families and help them to assess the needs of their own child and based on the individual, because we cannot take a whole approach. We need to take that individual approach from a young early age, and at those Sure Start services that can often point families to where the needs is best placed. We also need to look at other issues such as audiology waiting times. We know that a lot of people who have speech and language communication needs also have hearing difficulties. And if we are talking about 18 months for a child, and I must point that my child has been on audiology waiting list. I got a phone call last week and forgot when we first entered the list. It was whenever he was 3, he's now 5. But if we have children who have speech and language needs awaiting audiology appointments, then 18 months to 2 years is already failing them, especially in the first 1,000 days of their lives, when their minds are like little sponges and they're learning to actually communicate properly. Our ADHD diagnosis waiting times are drastically long, and instead the burdens are placed upon our schools to deal with children who have complex needs, and parents and families who aren't able to understand what it is can help their child best. We also can't underestimate how valuable reading and listening skills are within our young people. We all know how important it is to read to our children every night before they go to bed. This isn't just because of a bond, this is because actually creating that communication needs, because again, families can actually highlight when it is that parents, or when it is that their children might need that additional support. It isn't just about one department. I've mentioned health, I've mentioned education. But of course, the motion here today is relevant to the Justice Minister because it does speak about people who have entered the criminal justice system. I said before that once they've entered the criminal justice system, particularly as a youth offender, then society has already failed them. I have confidence in my I have confidence in my colleague, the Minister of Justice, Naomi Long, in developing the appropriate needs for all of the people within the criminal justice system. But in order to actually do that, we need to ensure that we actually adequately fund it properly. I don't doubt that coming forward into the next few months and years, we'll be able to see more training and developing needs for everyone within the criminal justice system so that they can reach their full potential. I remember when I studied law as an undergraduate at the University of Ulster, and there was, I don't know if any members have learnt it before, thank you, but there was a module on street law, which gave people the opportunity, particularly to go in to the criminal justice system for themselves to actually work with offenders in developing whatever needs and understanding that they had of the community. It was an absolutely amazing experience, and I do recommend that our undergraduates who are studying law, it's something that they can take on to understand the needs of people whenever they enter this system, that those people, particularly legal professions, who are representing them can actually communicate with them in a way in which they can understand. I thank the members again for bringing forward the motion today, but I just want to emphasise before I conclude, Deputy Speaker, that this isn't just about a justice approach, it's about education and health. And if people are already entering the criminal justice system, then society as a whole needs to look at the reasons as to why we have failed them.
Thank you. Robbie Butler.
Thank you, Mr. Deputy Speaker. I wasn't minded to, I know my name's on the motion, I wasn't minded to speak on it because my leader and Mike Nesbitt, who's going to wind on it, I know are very passionate about this, but I've listened to the debate with great interest, and I want to thank everybody that has so far partaken in this, but I think it would be remiss of me, given my experience as a former prison officer, not to speak in this debate, and my interest in children and young people in particular. But I want to start off with an analogy for the purpose of this motion. That analogy is to separate putting fires out and stopping fires from starting. This one here deals specifically with putting fires out as opposed to the preventative piece. And people have spoken very eloquently and rightly so in this debate, and they've intertwined the need to get upstream to stop our young people from falling into difficulties with the criminal justice system. And one of those quantifiable elements of that is the barriers that some young people find in their inability to communicate effectively or indeed be understood. But what we're talking about today, Mr. Speaker, is those who have unfortunately are known to the criminal justice system. That being the case, what I want to do is strip it into a number of areas of why this debate is so important today. And I'm going to start with staff of prisons, and I make no excuse for that as a former prison officer. I'm just going to paint this picture, and I'll do it every time for the people who work in our prisons. It's probably the most difficult job I ever did. And this is a difficult job. This is a job here that you know brings pressures every day, expectation and so on. But I just want you to picture this, what it's like to work in a prison. When you go into a prison, you're working in a quite combative, highly charged environment where there's lots of pressures on you, whether that's from the system that's demanding that you're there to protect and look after the people that are there, or those complex characters who are navigating a very difficult point in their life, but it's very difficult work to be a prison officer. That's compounded at times by the system that is there. And one of the biggest pressures on staff is staff numbers. And staff numbers have been reduced from, I was a prison officer in the late 1990s. And what that does, the impact of that then is on the failure to effectively rehabilitate inmates.
Never give way.
Absolutely.
I agree. the member says, having been in some of our prisons to look around them, but also the built form itself with the tiny corridors, the doors opening out, can all lead to massive problems for the staff.
I thank the member for...
Member has an extra minute.
Thank you very much, and I appreciate that. I thank the member for his intervention, because the reality is if you work there, it impacts on you too. It's obviously some of the prisons are old and archaic and not conducive. They're not therapeutic environments, and that's for the staff as well. That's why it's important that, particularly on committal, that the prison population, whether that is young offender or prisoner, is assessed across a gambit of conditions, speech and language being one of them. And it'll open so many doors. And I've got an example of where there was a failure, probably, I can't remember what year it started, but certainly in Hyde Bank Wood, there was an initiative started by, I think it was Governor Tracy a number of years back, with regard to early identification of ADHD, then awareness for the young people, awareness for the staff, and support. And it was fantastic. It was a game changer. But unfortunately, probably through budgets and nobody's intention, the project was pulled. And it was having a measurable effect. And if we're serious about making the conditions for those people who find themselves there better, then we will do it on committal. We will do it at the earliest chance that we get when people come in and there is an opportunity. And it's not just speech and language, although that's the one we're talking about today. Why else we do it for the staff? We also obviously do it for the young offender or indeed the prisoner. And it's easy to understand the piece, and people have talked about it, rehabilitation and to stop reoffending. But I'm going to paint another picture of you. One of the saddest things that I witnessed when I worked in the prison was the families who visited those people who were in prison, particularly the kids. And there's an unfortunate trend that happens, and not very often, but it's not unusual, to find that kids follow their parents into the system. Now, if we can get the communication barriers lifted, not just for the system, but within the families, what is the change that we can bring to a family and prevent that familial sort of cyclical event that happens? And what does that not do for the family structure? And finally, what's the societal benefit? The Minister will know very clearly that prisons and criminal justice is one of the hardest places to operate in terms of generating money and generating investment, because sometimes society may not look kindly upon those who find themselves in that position. However, I do believe that if there is a root and branch approach to this, and that we do take the opportunity that this gives, and this motion gives us the very early genesis of it, that if we take rehabilitation seriously and we see this as a fundamental seed in reversing the trend of ever-growing prison numbers, then it's perhaps something that we can all rally behind. But if there's something I just want to leave you with, that is, it's twofold. It is that there are two things that we're trying to do here, and we will have many more discussions about what we can do for young people, and that is rightly so. But for those people who are already known by the criminal justice system, unfortunately, the fire has already started, and it is our job to put that fire out. Thank you, Mr. Speaker.
I call Danny Donnelly.
Thank you, Mr. Deputy Speaker. And could I thank the UUP members for bringing forward this motion today. For many years I've worked with speech and language professionals within the healthcare. And it is right that we begin by applauding their hard work of the speech and language therapists for the vital roles that they play, and particularly today in relation to children and young people. Mr. Deputy Speaker, speech and language therapy should be seen as an early intervention, intended to save money and resources in relation to other services. Early detection of need and early intervention is essential for ensuring our children and young people are able to receive support necessary for them to be able to communicate their feelings. The risks of lack of intervention are clear. Up to 60% of young people in the youth justice estate were found to have communication difficulties, and 46% of these being in the poor or very poor range. I know we've had a lot of figures discussed in relation to this today, and we seem to be centred around the same shocking figures. 80% of young unemployed men have an unidentified speech and language and communication needs. Investment in speech and language therapy as an urgent early intervention will save in other services. By assisting rehabilitation in prisons and therefore reducing reoffending, as my colleague Stuart Dixon has pointed out, that this is already ongoing. Recently, the Independent Review of Education emphasised the importance of speech and language therapy and highlighted the commissioning of speech and language therapy services have not maintained pace with need, and therefore not all children are receiving the services that they need. It is essential that vacancy rates within each trust service are addressed urgently. As we've heard in previous debates today, we do have quite substantial vacancies across our health and social care system. And as other members have pointed out, this appears to be quite a sought-after career, although places at university do seem to limit that. Childcare is another important part of this debate which should not be underestimated. More needs to be done to connect the importance of speech and language therapy to the development of a childcare strategy, which we discussed last week. The development of a childcare strategy debate, my colleagues Kate Nicholl and Nick Matheson highlighted the work that we have done as a party through our policy document on childcare, Children First. Within this document is a commitment for child-centred care, particularly that providers should work with speech and language therapists and other education and health professionals to provide an integrated support system for children who need such additional support, to ensure that every child has the same standard of life and same standards in terms of health and education. I welcome the proposal within the motion for a cross-departmental approach to this issue, and given the overlap between health, education and justice in particular, I encourage Minister Given to consider the importance of early intervention in terms of speech and language therapy to the early learning childcare strategy that he is intending to bring forward to the Executive. I also want to highlight the links between communication difficulties and mental health challenges, as Orla Flynn has already highlighted today. This is a concern that has rightly been mentioned in the motion and appropriate in the terms of timing, given that we have recently marked Children's Mental Health Week earlier in February. For many children, speech, language and communication needs can impact on a child's ability to learn in school, to make friends and to join in the more sociable parts of their school day. This is exacerbated when children get older and move through the school system. Research has indicated that 45% of young people referred for mental health services also have communication difficulties, while 81% of children with emotional and behavioural disorders have significant language deficits, which are often undefined. Proper investment in speech and language therapy can reduce many of these difficulties and therefore avoid the problems within the justice system we often see later in life. Thank you, Mr. Deputy Speaker.
Colleague Cara Hunter.
Mr. Deputy Speaker, and I'm mindful that this motion falls under justice, but as our party's education spokesperson, I welcome the opportunity to speak here today. I'm mindful of the huge challenges that our children face with speech, language and communication difficulties, and I'm also mindful of the strong association of children's early language development and educational outcomes and behaviour and life choices later in life. Good spoken language is central to children's literacy and numeracy skills, their academic achievement, self-confidence and positive life outcomes. Sadly, evidence indicates that children from the most deprived backgrounds are most likely to have speech, language and communication needs. And we know sadly that 1 in 10 children here in the North experience poverty. So that's extremely worrying, as this is an unmet need that impacts those across our classrooms each and every day. I'd like to thank the Royal College of Speech and Language Therapists and all those therapists out there who are wonderful at what they do. I attended one of their events a number of months ago and I had the opportunity to really get a look at what they do each and every day in our schools. We must address the gaps in provision and services required to support early language development. We must help reduce educational inequalities and support accomplishment, and I have no doubt that this will help contribute to well-being in our young people and well into adulthood. I also welcome Mr. Butler's point there around ADHD and supporting our young people who have either received the diagnosis or are awaiting a diagnosis, and I know currently in the Northern Trust there's absolutely no ADHD support services, and this is an issue that's ongoing. And I've spoken with young people themselves and parents, and it's just so deeply frustrating because for so many of those young people, they're often labelled as problematic, difficult to work with, and sometimes they can internalise that and feel shame, and there's no need to. But that's where our speech and language therapists and our support networks and counsellors come in handy in building up our young people. Moving on, what brings me to this motion regarding prisoners, a speech or language difficulty can often make people feel embarrassed, overlooked, unheard or misunderstood, and I can't imagine how frustrating that must be, so I do welcome that this issue is being discussed here today. There is an urgent need to invest in and commission more speech and language therapists within our prison services, and we must reform how we plan to meet not only the needs of children with speech difficulties, but also those who are in the criminal justice system. We must address and get support in our Sure Start facilities, across our health service, for our adults in justice and our young people in the education sector. And I would ask the Justice Minister in her summary today to tell us a little bit more about how her department will assist prisoners struggling with speech and language difficulties, how she can provide training for prison officers, what might that look like, what steps have already been taken within her department to tackle this issue, and how long will training take to implement. And again, I really do welcome that this is being discussed here today. Thank you.
I thank the member for that. I now call on the Minister of Justice to respond. And Minister, you will have up to 15 minutes.
Thank you, Mr Deputy Speaker, and I'd like to welcome you officially to your new role. It's the first time I have faced you across the chamber like this, and I hope you'll be gentle. Mr Speaker, I'm very grateful to the members for Upper Bann, Lagan Valley and Strangford for bringing this important motion before the House, and I welcome the opportunity to respond to it. I want to thank all the members who contributed and participated in the debate today, because it is an important one. Whilst I'm responding to this motion as Minister of Justice, it is important to explain, particularly for newer members of the Assembly at the outset, that statutory responsibility for the adequate provision of speech and language therapy, including for children in the justice system, rests with the Department of Health, as with all healthcare provision in the justice sector. Mr Speaker, I'll outline shortly the important work that speech and language therapists perform within the justice system. But the reality of the situation is that people arrive in the justice system with pre-existing, often complex and sometimes undiagnosed needs. Like Robbie Butler, I am constantly impressed by the work of prison officers in engaging with and challenging behaviours amongst the prison population. However, ultimately the best solution is more investment in early intervention, where it would achieve the greatest impact via early years, education and community provision, as highlighted by a number of members, including Patsy McGlone, Orlia Flynn and Nuala McAllister. There is recognition across government and society that the most effective route to positive outcomes in adult life is to provide early help and support to individuals, families and communities by intervening early before problems become entrenched. That is also critical to reducing interaction with the justice system, which regrettably too often becomes a provider of last resort for those who have fallen through the gaps in other services in the community. As the financial pressures increase, so do the gaps, and more the department's already overstretched resources, whether in probation, prisons, youth justice or policing, are under pressure to plug those gaps. That is not a sustainable model for justice delivery, and it needs to be addressed. I want to work with my executive colleagues to deliver a coherent approach to early intervention with the aim of creating a long-term, whole systems approach in collaboration with other departments, criminal justice agencies and the voluntary and community sector. With that in mind, the aim of my department and its agencies, NDPBs and other partners, particularly those in the voluntary and community sector, is to align activities, support rehabilitation, improve outcomes for those in our care and ultimately build a safer Northern Ireland through a long-term reduction in offending behaviour. Evidence shows that it is only by working with those who offend that we can make communities safer and reduce future harm to victims. However, the criminal justice system on its own cannot provide the knowledge, expertise or access to the services needed to truly reduce offending alone. As my colleague Stuart Dixon highlighted, there are a range of socio-economic factors which have been shown to have an impact on offending, including poverty and social deprivation, mental health issues, substance misuse, homelessness, a lack of educational attainment and employment opportunities. To give you an illustration of what this looks like in practical terms, on the 1st of February 2024, 54%, that is 1,001 people, in our prison population had a history of self-harm. 50%, 934 people, had an addiction, and 37%, that's 693 people, had a mental health issue. Those challenges are often linked to language and communication deficits, as highlighted by Danny Donnelly in his contribution. So reducing offending and addressing reoffending not only means tackling these issues, but also creating positive connections back into supportive families and communities so that they can become enablers of change. Within the broad category of people who have offended, there are particular groups with additional needs who require further support in order to address their offending behaviour and successfully reintegrate back into the community. One such example are children, whose offending behaviour is a manifestation often of underlying issues whether those be problems in the family home, disengagement from the education system, poverty or social exclusion. This is why early intervention is so important as a preventative, not only a rehabilitative measure. Likewise, women who have offended tend to have a history of domestic and sexual violence, and so a gender-responsive approach to reoffending is necessary to support them properly. Making real inroads into reducing offending behaviour requires effective partnership working between departments and statutory agencies. One such area is through the provision of speech and language therapy. As Ciara Ferguson noted in her contribution, speech and language and communication needs are often called invisible or hidden disabilities. They're not always obvious. As a result, their significance can be frequently overlooked, whether that be in prison or in the wider community. In February 2021, I had the pleasure of meeting the head of the Royal College of Speech and Language Therapists in Northern Ireland as Minister, to hear at first hand the important work that they undertake within the justice system and the opportunities to further develop it. Individuals in the justice system are more likely to have significant speech, language and communication needs compared to the general population. That concentration of people who have demonstrated offending behaviour within the prison system, I think, reflects the links between speech and language difficulties and offending behaviour, and I think that was acknowledged by Maurice Bradley in his contribution. Indeed, that was also supported further by a speech and language communication screening carried out by a learning disability nurse of 20 young people residing in Woodlands in late 2019. That showed that approximately 50% of those young people identified as having difficulties which would require input from speech and language therapists. More recently, the screening of young men in Highbank Wood College in 2023 identified that up to 75% had speech, learning and communication needs. Such needs are often manifested in the individual, whether young or old, in a complex range of ways, outlined in great detail by Joanne Bunting in her contribution, and so I'm not going to repeat all of those here. The implications for a person with a speech and language and communications need within the criminal justice system can be profound. Unidentified speech and language needs can prevent individuals from fully accessing rehabilitation programmes, employment, and from building relationships, all of which can perpetuate the cycle of offending. Within the Northern Ireland Prison Service, speech and language therapists do play an important role. Since 2008, the Department of Health has had responsibility for healthcare services in prison. My colleague Paula Bradshaw made a very valuable point regarding the need for appropriate information sharing between health and justice, which does not always take place, particularly when it comes to those more sensitive issues around learning difficulties, acquired brain injuries, and how we can handle those behavioural issues. These services are commissioned by the Strategic Planning and Performance Group within the Department of Health in conjunction with the Public Health Agency and provided by the South Eastern Health and Social Care Trust. In acknowledgement of the impact that speech, language and communication needs can have on a person as they go through the system, the Department of Health has increased the provision of speech and language therapists in prisons over the last 4 years. In real terms, this means that there are now 3 therapists working across the 3 prison establishments, in contrast to having had previously just 1 therapist in Highbank Wood College. Recurrent funding for these 3 posts has also now been agreed, which is vital as it allows the service to be developed and for the Trust to make future plans. As currently delivered, the role of the service is to screen for speech, language and communication difficulties and to provide ongoing treatment and support to those who require it on an individual basis via group sessions or through the provision of communication tip sheets that individuals can use when communicating with others when the language therapists are not present. I will briefly.
Thank you. I think the Minister's made a really, really good contribution, but the last statement sort of concerns me a little bit because many people that have a speech and language difficulty don't even know that, so their ability to trigger that, that's why I'd suggested perhaps if we could look at maybe on committal some type of assessment that would mean that nobody falls through the sieve.
Well, that's what I've described as the service's screening for speech and language, so that's what the service does. In addition, the speech and language therapist can provide education and support for both healthcare and prison staff, as well as prison officers themselves, the people who are working daily with individuals who have communication needs. There have been examples of excellent collaborative working between the Trust and Prison Service, which has resulted in speech and language therapy representation at prisoner safety and support meetings. Therapists also provide input when required around those held in our care and supervision units to highlight patients who have speech, language and communication difficulties and advise on how best to support them. Another of the important roles that the speech and language therapists provide within the justice system is through registered intermediaries. Communication in legal settings, which was referenced by my colleague Nuala McAllister, is often complex, and so the Department recruits, trains and currently maintains a panel of 35 registered intermediaries who are communication specialists from a wide range of backgrounds, including speech and language therapists and social workers. Registered intermediaries can assist vulnerable victims, witnesses, suspects and defendants with significant communication deficits to communicate their answers more effectively during police interviews and when giving evidence at trial. The Department provides a registered intermediary on request from the PSNI, PPS or Defence Council, and approximately 1,300 requests are received each year, with about 80% received from the police. The scheme currently operates in respect of criminal cases being heard in all Crown, Magistrates and Youth Courts. On occasion, registered intermediaries will assist prisoners who are participating in court proceedings by video link from a prison establishment. When we consider young people in contact with the justice system, I'm sure that we all agree this cohort requires a specific focus in order to support them to turn away from offending behaviour at the earliest opportunity. The Youth Justice Agency works with children in both custody and community settings, and last year this involved working with over 2,400 children and young people. Of these, 110 individuals spent time in a custodial environment. Woodlands Juvenile Justice Centre is the only custodial facility for children in Northern Ireland. The Youth Justice Agencies work closely with the South Eastern Health and Social Care Trust in order to develop shared therapeutic and mental health services that operate across both Woodlands and Lakewood, Northern Ireland's regional secure care centre for children. This service, called ACORN, is co-funded by the Youth Justice Agency and the Department of Health and consists of a multidisciplinary team that covers a number of professional disciplines, including psychology, psychiatry, occupational therapy and mental health nursing. There are plans in train to expand the team to include speech and language therapists that will be implemented if and when funding can be made available. The Youth Justice Agency also carries out extensive work within community settings with children who have offended to assist those children to avoid further offending. The agency also advocates on their behalf with relevant statutory services, such as health-related, like speech and language, to help the child address their offending behaviour and reach their full potential. Ultimately, decisions on clinical priorities for health-related services are a matter for the health and social care trusts and primary care services. However, the Youth Justice Agency staff, many of whom are professionally qualified as social workers and youth workers, will advocate on behalf of a child where they believe that is necessary. In spite of the challenging financial landscape, the agency recognises the impact which the prevalence of mental health issues has on youth offending behaviour. Unfortunately, children who have offended often struggle to consistently access mainstream child and adolescent mental health services. In order to address this, the agency has worked closely with health and social care colleagues to trial a bespoke co-located CAM service in the Southern and Western Trust areas. The results have been very positive. The initial trials show significantly improved levels of engagement. Pre-trial, 14% of children known to the Youth Justice Agency exited CAMS with their aims achieved. This has risen to 88% during the first full year of the trial. We would like to identify funding to extend this trial across Northern Ireland, beginning beyond those two trust areas, but there is an issue with budget constraints. Developing and implementing a similar bespoke provision in community settings for other social care services, which are the statutory responsibility of trusts, is not something to which I can commit. But we will continue to advocate for those young people that we work with to receive the speech and language therapy and other services they need to help address their offending behaviour. In conclusion, Mr Speaker, I am grateful to the members who brought the issue before us today and who participated in the debate. Whilst support is being provided through the Registered Intermediary Scheme in prisons, further work is necessary to ensure timely access is provided in the youth justice system. Greater collaboration is needed with the Department of Health on a number of key issues in order to improve health outcomes for those in contact with the justice system. To that end, I have already raised informally with the Health Minister my intention to seek an early meeting to facilitate a discussion on how we can build on previous collaboration together and with other ministers, including education, economy and communities, to bring about more positive outcomes for both adults and children engaged in the justice system. They may for now be apart from our society, but they remain at all times a part of our society. Thank you, Mr Speaker.
And thank you, Minister, for that response. I now call on Mike Nesbitt to conclude and wind up on the debate, and I advise the member he is up for 10 minutes.
Deputy Speaker, thank you very much. May I thank every member and the Minister for contributing to this important debate. I also thank those members who welcomed the issue being brought to our attention. Also thanks to the Royal College for Speech and Language Therapists, who have defined the issue in 3 ways. It is our ability to make ourselves understood. It is our ability to understand what is being said to us. And it is also learning how to speak to different people in the right way at the right time. And I suppose, Deputy Speaker, I should declare that for most of my adult life I was making a living as a broadcast journalist. So every day I was able to practice, trying to make myself understood, trying to understand what an interviewee was saying to me, unless they were a politician, of course, and knowing that different people will react better depending on the way you approach them. Hard cop, soft cop, that sort of thing. And that's what this is about. And, I think it's scary enough for a young person when a police officer comes knocking on their door or figuratively feels their collar, when they know why the officer is doing that. But what we're talking about here is young people who don't necessarily even understand why the police have taken an interest in them, who don't realise they may have broken the law and they may be in serious trouble. So I've listened carefully to the comments from members, and I think I've broken it down into 4 categories. And first of all, perhaps being understood, and Mr. Beattie opened the debate by talking about how not being understood results in poor outcomes, in frustration, in not understanding what is happening to you. And Joanne Dobson, who I wish well in her new role as Chair, Joanne Bunting, beg your pardon, who I wish well in her new role. That's a blast for the past. Sorry about that. Yeah. I wish you well as Chair of the Justice Committee. And as you put it, these frustrations can actually end up in people becoming violent. They're so frustrated about their inability to articulate what it is that they want to say. And I should say, of course, I think this debate points out that this is a cross-cutting issue. And Mr. Beattie, of course, said it's not just the Department of Justice, it's the Department of Health, it's the Department of Education, the Department for the Economy, and the Department of Finance. So I think it's an excellent example of the need for an outcome-based accountable programme for government, which is all about cross-cutting. And I make no apology for repeating what I said last night. That programme for government must move from just looking at the inputs and the outputs of what we do and focus on the outcomes. Are we actually achieving better results? And if we think about the last programme for government, which sadly never made it beyond the draft stage, one of the high-end outcomes was to give people, children, young people, the best possible start in life. And I think this plays exactly into that. And as Stuart Dixon and indeed Nuala McAllister said, these issues don't develop in prison. These people, these young people who go to prison, they've already got these problems. And therefore, we owe it to them to have a regime which is fit to try and do our best for them. And Mr. Dixon, of course, developed the role of the Department of Health. Patsy McGlone talked about the role of education, of early years, of the requirement for multidisciplinary teams, for the return of the Healthy, Happy Minds scheme. Mr. Donnelly, talking from personal experience, also talked about early interventions and the need to embed this in the childcare strategy, something that we've already debated since we returned. And I very much take his point that certainly my emphasis in that debate was about the economically inactive, in other words, getting the parents back into the workplace. But the other side of the coin is the one Mr. Donnelly has referred to, is that using childcare to give the child the best possible start in life. And I think that cross-cutting was also mentioned by Orlia Flynn and Maurice Bradley, who interestingly said, does this motion address the symptoms, or does it actually address the underlying cause? And there are many causes, and Nuala McAllister pointed out many of them: poverty, failure to look after the vulnerable in the best possible way, calling for the Sure Start scheme to be expanded, talking about the implications of a long wait for an audiology department appointment, or an assessment for ADHD. And these are all complex issues that we have to look at. The other thing that members focused on, of course, was youth. Mr. Beattie talking about the high percentage of young people going into Hyde Bank with language issues. Patsy McGlone referred to that as well. Ciara Ferguson talked about the need for young people to grow up in a language-rich environment where they will learn to struggle to express their issues. She also suggested that the problem with many children is that they are misdiagnosed. They are felt to be maybe outsiders, problem children, when they're not. They're just children who need help. Mr. Dixon thought perhaps rather than misdiagnosis, the problem was underdiagnosis of the issues. And again, he said it's potentially about poverty, about mental health, about deprivation, about substance abuse, a lot of problems, which again emphasise the fact that this is a cross-cutting issue. And in a similar vein, Cara Hunter talked about people from deprived backgrounds being the most likely to present with speech and language and communication issues. And I move then, Deputy Speaker, to the asks which came, I think, from the Royal College of Speech and Language Therapists. There was screening, a screening of everybody entering the criminal justice system, and Paula Bradshaw very thoughtfully pointed out that actually assessments are held by the Department of Health and is calling for information sharing. And I understand, Deputy Speaker, that is a very difficult thing to achieve in the modern age with GDPR, but that doesn't mean it's not something that we should tackle just because it's difficult. If it's the right thing to do, I think we should do it. There was also the question of training, and Mr. Butler, speaking from lived experience, talked about the impact of prison officers who potentially don't understand exactly how to deal with this thing. Mr. Bradley talked about the need to train to understand who needs help. In fact, he called for a training needs analysis across the criminal justice system. And then there's also support. So screening, training and support, especially in the youth justice system. And again, I thank the Minister for her contribution. Again, she pointed out that there were pre-existing, complex and often undiagnosed needs, and that we do need early help and interventions, as many members have pointed out. She told us that there had been an increase from 1 to 3 therapists, outlined the role that they play within our prisons, and the progress on a multidisciplinary team. She also pointed out, of course, that it is a statutory duty of the Department of Health to provide the services within the criminal justice system. And I finish by making the argument, once again, Deputy Speaker, I think the Minister makes the argument that this has to be a cross-cutting initiative within a programme for government which is outcome-based accountable. In other words, it's about outcomes, and if we're not delivering the outcomes, then the executive sits down and says, let's do it differently, let's try something else, and we keep going until we get the solution that works for the people that we are here to serve. So once again, I thank all members, and I commend the motion to this House.
I thank the member, and that concludes our debate. So, members, the question is, the motion standing on the order paper be agreed. All those in favour say aye. Aye. Contrary, no. I think the ayes have it. The ayes have it. Members should take their ease.
All right, members, if you can take your seats, please. Further consideration stage the budget bill. I call the Minister of Finance, Dr. Kiva Archibald, to move the bill. As no amendments have been tabled, there is no opportunity to discuss the budget bill now. Members will, of course, be able to have a full debate at final stage, which is the next item of business on today's order paper. The further consideration stage of the bill is therefore concluded. All those in favour? Contrary? Okay, ayes have it. Ayes have it. Okay. Next item of business is the final stage of the budget bill. I call the Minister of Finance to move the final stage.
Moved.
The final stage of the budget bill has been moved. The Business Committee has agreed there will be no time limit on the debate. I call the Minister of Finance to open the debate.
Today's final stage debate concludes the financial legislative process for this budget bill in the Assembly. This has been a very exceptional situation we have found ourselves in so late in the financial year, and I stress again to members that I do not take lightly what I have asked this Assembly to do in considering this budget bill in such a short period of time. I can assure you this will not in any way be regarded as establishing a precedent. The importance and significance of ensuring that this bill is passed cannot be underestimated, as it enables us to keep delivering public services and prevent departments running out of money. Money and financial packages have dominated the agenda since this executive returned, and I, along with my executive colleagues, have been determined to take swift action to address the challenges we face. The executive has acted to prioritise public sector pay with an allocation of £688 million for public sector workers. This is really important for our health workers, teachers, police, transport workers and civil servants to enable negotiations with trade unions to take place, and I want to see these conclude as quickly as possible to ensure fair pay is delivered for workers. The vote on account in this bill will allow services to continue beyond the 1st of April to allow the Executive and this Assembly to consider the budget for 2024-25. The debate on the second stage of the bill yesterday was useful and informative, and I thank all members for their contributions that they have brought to the process. I wish to express my gratitude once again to the Finance Committee, who worked with us to grant accelerated passage for the bill. To conclude, this is the final stage of our financial legislative process for 2023-24. I now look forward to hearing any final thoughts from members on this important piece of legislation.
Mr. Speaker, and I am rising first of all to speak as the Chair of the Committee for Finance, and after that, with your permission, I'll speak as Leader of the Opposition. Once again, I would like to thank the Minister for her comments, and I would sincerely, both as Chair of the Finance Committee and Leader of the Opposition, congratulate her on her stamina in getting through the second stage of the bill. But I should warn her that future finance bills are going to be, if I and others have anything to do with it, even longer and more taxing than this one. So this is good preparation, but I congratulate her on her stamina, particularly yesterday when there were some issues with a frog in the throat which affect us all. Much like the second stage debate yesterday, members of the committee made a number of insightful and considered points around the nature of the budget process, and indeed many members, indeed I think all members of the Finance Committee had the opportunity to speak yesterday, including the Vice Chair, Diane Forsyth, around the nature of the budget process and the timing difficulties that we are dealing with. The committee has acknowledged these, but have also made clear that this must be an exceptional process, i.e. it cannot be a precedent. And I welcome the fact that the Minister confirmed that in her remarks, and I assume will do so again today, and we do intend to follow through on that. Officials reassured the committee during yesterday's meetings that this process would not set a precedent. However, as those of us who have served on the Finance Committee know only too well, the budget process has too often been compromised. The committee must not be put in this position again. There must be appropriate time set aside for proper scrutiny of budgets going forward, and that applies to all statutory committees. Mr. Speaker, it is worth restating that this budget process has compromised guidance set down in Standing Order 42 around, quote, appropriate consultation with the committee, as well as greatly reduced timescale between bill stages. Again, paragraph 20 of Strand 1 of the Belfast Good Friday Agreement around committee scrutiny of the bill has not been honoured, nor has paragraph 64(1) of the NI Act 1998, which puts the process in paragraph 20 into law. Members have also voiced concern around the 65% of current budget vote on account in clauses 7 to 11 of the bill. While the amount is not without precedent, it has happened before, it is much more than the normal 45% and would suggest that the Executive is not expecting to agree a budget for 24-25 any time soon. Officials have assured the Finance Committee that members will see the spring supplementary estimates before the end of March, but assurances of a Budget Number 2 bill before the summer recess are not as strongly stated as they were even last week. The Committee's expectation is that it will be given its proper place in the budget process going forward, and I believe that the Minister is the person to make this happen. She herself is a former committee chair, so I know takes seriously the scrutiny role that committees have. The committee has faith in the Minister to deal fairly with the committee and honour its statutory role, and we hope that she honours that. So, Mr. Speaker, I will now end my comments as Finance Committee Chair. I don't have a hat to take on or off, as I said yesterday, but I'll now speak as Leader of the Opposition. And one or two areas I may be somewhat less diplomatic and caveated than I was as Chair of the Finance Committee. Nevertheless, I do again reiterate the fact that I congratulate Kiva Archibald, the new Finance Minister, who is a well-qualified and talented politician and appointee as Minister. And I wish her well in all sincerity, notwithstanding our role as a scrutiny and accountability mechanism as official opposition. Mr. Speaker, I hope and I believe that in this place, whatever our politics, wherever we stand on the left-right spectrum, wherever we are in terms of the constitutional position, we all want to do our jobs as legislators and scrutinisers better. In that context, we do have to acknowledge that it can't get much worse than what we've done around budgeting here over the last decade. For 5 of the past 7 years, there has been no assembly. So budgets have been passed in an unforgivable, chaotic rush through Westminster, often without minimal debate. For a number of years, of course, there was only one party representing Northern Ireland that actually took its seats and spoke in favour, that outlined its position. Not, I'm afraid, a position that would be shared by everybody in this chamber or in our society. That was clearly suboptimal. And when we came back in 2020, we had 2 and a bit years of extremely rushed, chaotic budget making, which happened often with minimal information, accelerated passage granted, but minimal compromise scrutiny, 1-year budgets without a multi-year budget process, without a coherent programme for government to judge the budget against. Because, as I've said many, many times in this chamber, including yesterday, a budget is only as good as a budget bill, which is what we are authorising, I assume we will authorise today. A budget bill is only as good as the strategic document that it refers back to. That's the budget statement. The budget statement, by law, is supposed to be presented to the Assembly in draft form before the end of the financial year. I am concerned, from some of what's been said, both by officials and the Minister, that deadline is going to slip. We aren't going to see a draft budget. I'd like to see a draft multi-year budget before the end of the financial year, but I recognise that is an extremely tight timeline. So if we aren't going to see that, I would like the Minister to confirm what we are going to see before the end of the financial year. If it's not going to be a single-year budget, could she confirm that at some point in the months to come we're going to get a multi-year budget, and ideally a multi-year budget that's tied to the outcomes in a programme for government, because that's what we should all want to see. Over the last couple of days in this debate, we have talked about the vast range of priorities, but we've focused, I think we can all agree that we have focused on a small number of very urgent priorities. Number 1 is paying public sector workers, and I commend the Minister for taking that seriously, for opening negotiations as relates to the workforces under her direct remit, and moving forward with that. That is clearly an urgent and imminent priority. In addition to that, a rescue plan for public services. We supported the motion that was in the name of executive parties, and we added our name to it, but we also amended it because we agree with them that the UK government, an austerity-obsessed Tory government, that has inflicted hardship, particularly on the most vulnerable, over the last decade and a half, and then compounded its austerity obsession with the most preposterous economic folly of Brexit, the biggest act of economic self-harm any modern nation has ever inflicted upon itself. All of that has placed us in an unenviable position. So we support the executive parties when they say that London needs to reflect both its acknowledgement that this place has not been funded at need, and also proper backdate that. And we support the Minister in terms of those discussions and those she's having on the fiscal formula. We want the best, and we will lend our constructive opposition to acknowledging that. But in addition to that, the quid pro quo from our perspective, not just for us as an opposition, but for the people of the North, is that they get a detailed costed plan, that they understand what the executive is prioritising, how it's spending money raised locally, and also money, even if it's not enough, money that is dispersed from London. And I agree, the Finance Minister and I would agree, others in this chamber won't, that we should have more powers in this place. She should have more powers to raise more funding in the long term, and in the long term we should have a completely different constitutional arrangement which better enables us to meet the potential of all of our people, but that is still some way off. In the meantime, the job of this executive, all the parties who are in it, is to produce a costed, meaningful, targeted timeline plan for rescuing public services. Because why else did we stand for election? Leave aside all the arguments that we've had over Brexit and the protocol and some of the stuff that we deal with around identity. Think about people who at the minute are struggling to put petrol in their car. Think about the people who have had immense stress over the past couple of years dealing with, first of all, coming out of an historic and hugely traumatic pandemic, then dealing with a cost of living crisis that has made it difficult for them to put food on the table, put petrol in their car, pay for public transport, now dealing with a health service which is in chaos and crisis. I don't mean to simply list a litany of things in order to be destructive. I list it in order to be constructive, because we've all spent time listing issues with the public service, with our public services in the state of this place. And I say that in order to reiterate my basic point, which is that what we need is a costed public service rescue plan that is attached to a multi-year programme for government and a multi-year budget. That isn't so much to ask. In fact, it's the bare minimum that the people of Northern Ireland need and deserve. We, as a constructive opposition, will be asking for it. We won't be throwing snowballs, we won't be tearing lumps out of anyone. We'll simply be saying, what's the plan? How is it going to be paid for? What are the targets? When are they going to be delivered? And we won't be unreasonable, and we won't be irrational, and we won't be unfair, but we will ask those simple questions on behalf of the people we represent, and we think that can be a positive step forward. Just a couple of points in relation, Mr. Speaker, to the fiscal framework. As I said, the Minister is right, and she is dealing with a chaotic, austerity-obsessed Tory government right at the fag end of a very long and frankly chaotic time in government. So she has our support in terms of dealing with them and getting the best possible deal for this place. I will register again, there is a slight concern that we could have been in a slightly better place, to put it diplomatically, around parties in the executive not contradicting themselves and one another over what was already in black and white in a letter that went from the executive to the UK government. It was down there in relation to the agreement around revenue raising, and it should have, the promises from the UK government should have been put down in black and white, and they should have been clear up front and nailed down as we restored this Assembly and Executive. A couple of points around, I will give way, yes, of course.
Would the member agree with me that there was no good reason for the Assembly and Executive to be held to ransom, and is he now saying that having the financial package in writing and agreed by all parties then should have been a precondition for restoring that Executive?
No, I'm not saying that. I'm very grateful for him for inviting me to contradict policy, but that's not what I've ever said. What I said was that the executive parties, including his party, could have pressed for more detail from the UK government. That didn't ever have to be. You did, but it wasn't written down, and you didn't say publicly. You asked for it, but clearly you didn't get it. So that's all I'm saying to the member. Through the chair, all I'm saying is you might have asked for it, but it wasn't achieved. It wasn't delivered, and it wasn't written down. in black and white. So the member can sort of carp at me all he likes about what his party did or didn't ask for, but the simple truth is it wasn't nailed down in black and white. It should not, by the way, have been a deal breaker. We should never have been out of this assembly in the first place. I don't think there should ever have been, there's no justification for ever, and there never will be from our perspective, for bringing down governance here, ever. But that doesn't mean that when you are in a discussion in which a financial package is put on the table, that the parties don't say to the UK officials and ministers who were in the room at Hillsborough, put it on the table, publish it, because people were walking out of Hillsborough Castle and briefing the media with a piece of paper in their hands about what was being offered. So there was no reason for that not to be put in the public domain, so that there would at least have been a bit of clarity. And I would actually commend the leader of the Ulster Unionist Party, who in fairness was pretty consistent about saying the details of that should have been put into the public domain. But that is an issue that we've dealt with over the last couple of weeks, and it needn't get in the way of where we go going forward. As I said, what we need is for the Finance Minister to be able to engage with the Treasury around the fiscal framework. We will clearly in the Finance Committee be doing our job in terms of scrutinising that, but then a costed, timelined, targeted plan around public service recovery, and I'm sure my colleague on the Finance Committee will be joining me in supporting that, and I'm sure his colleagues will be doing that in the Executive. Just a couple of slightly more techy academic points about how we do fiscal policy here. We put down what was, I admit, a relatively tangential amendment to the budget bill around giving the Fiscal Council more power in law to report back on public service improvement. Whether this, it may not have been this particular moment to get that debated and into law, but we do think that is now the time for us to debate that. I intend, as Chair of the Finance Committee, for us to have those discussions in committee, and I will give way, yes, briefly.
I think maybe sort of directing myself through the chair so I don't get misquoted again. But I think this could be a good opportunity if the Minister in her remarks made a very strong commitment to bringing the Fiscal Council onto a legislative framework as quickly and rapidly as possible, as indeed has been indicated from her briefs and some of the things that the Department have been saying.
Yeah, thank you very much, and I agree with the member in question. So it would be helpful to have from the Minister her view on when the Fiscal Council will be put into law, and also would she commit to supporting the Fiscal Council not just having a remit to report on the public finances, but also to be able to report on a statutory basis on the delivery on key targets in a programme for government and delivery. So I think, Mr Speaker, this process has been deeply suboptimal. As the opposition, we are going to record the fact that we aren't supporting all of this bill, but we aren't going to stand in the way. We aren't going to be destructive. We're going to be constructive. And I recognise that there are particular challenges for the officials in terms of moving this forward at pace. The process, we've said this so many times, I've said it so many times, I've only been in MLA for 4 years, we can't do this again, we really, really can't. So that's why another thing that we need to focus on is Assembly reform to ensure that we don't collapse again. So I reiterate my point. What we need to see going forward now, having delivered this budget bill, which I'm sure will pass, is that we need a costed timeline plan for public service recovery, and I would urge the Minister to give us some reassurance about when we are going to see hopefully a multi-year budget and not just a single year one, whether that's before or after the end of the financial year, and her view about the role of the Fiscal Council. But with that, Mr Speaker, I'll conclude my remarks, I'm sure to some relief. Thank you very much.
With your permission, I will be reserving my maiden speech, and I will speak today solely as Deputy Chair for the Executive Office Committee. I do not plan to repeat the concerns that have been expressed over the past 2 days in relation to scrutiny of the bill we have before us. I have only to acknowledge those concerns and look forward to a more focused look at next year's budget. The committee is just getting to know a small yet complex department, but it is already clear that the Executive Office has huge responsibilities with limited resources. The Department has responsibilities for strategies to support victims and survivors of the conflict, support victims and survivors of historical institutional abuse, mother and baby homes and Magdalen laundries, the integration of refugees into our society, finding ways of building relationships between communities of different political, cultural or religious outlooks, and protecting people in our communities from paramilitary influence. The Department also has the very important task of finding ways to end violence against women and girls. At its meeting last week, the committee asked officials whether a budget would be assigned to the strategy, and yesterday the Finance Minister announced £2 million has been allocated to this. The committee will look into how this is spent going forward and whether it will be enough for the aspirations of this strategy. Following the approval and publication of the final strategic framework, the committee will carefully consider the actions going forward aimed at eradicating violence against women and girls and the associated costs and resources needed. The department leads on the Together Building United community. This broad, multifaceted strategy reflects the commitment to improving community relations and continuing the journey towards a more united and shared society. The committee will expect to be involved in the decision taken on the allocation of funds to activities such as tea-buck camps for young people, urban villages redevelopment programmes, planned interventions to divert young people during times of tension, and the many funded good relations programmes across Northern Ireland. This requires detailed information in advance, time to hear evidence, opportunities to engage with people affected most by these actions, and space for deliberation to offer support and guidance to the department while these decisions are being made. The committee needs to hear in good time how much the department's commitments will cost and how its money is to be spent. We will need to consider the financial aspects of the establishment of the Irish Language Commissioner, the Commissioner for the Ulster Scots Tradition, and the Office of Identity and Cultural Tradition. These are new structures that will call on the resources of the department and will take their place in ongoing budgets. The Minister of Finance told us yesterday that £4 million has been allocated for the Truth Recovery Programme. The figures, £1.4 million has been provided for actions related to historical institutional abuse. Is this an adequate amount? Again, we don't know. We haven't seen the sums in the committee. £3 million has been made available for the Homes to Ukraine scheme. How is this figure calculated? We haven't had the opportunity to see the working out. What about the figures allocated to people seeking asylum or the integration of refugees and to support people who have come here from other countries? I could go on. All these things require careful allocation of limited resources, which is subject to detailed and effective scrutiny. They are far too important to be rushed. They require careful consideration. This is what our committees are here to do. This is what the public expect us to do. And this is what the committee intends to do going forward. Thank you.
Concorla, once again, I rise here to speak on the budget bill. I'd like to thank the Minister for bringing forward this budget bill and for engagement with members yesterday throughout the debate. As has been said already, this bill will give effect to the allocations announced last week, including the £688 million which has been provided for public sector pay. Our public sector workers have waited long enough for a fair pay rise, so it's absolutely vital that we pass this bill today to send a message to workers that we do have their backs. In the debate yesterday, some members did mention the lack of scrutiny for this bill. And of course, as legislators, we want to have the chance to scrutinise legislation to the fullest extent. But as officials outlined to us in the committee, this is a highly unusual situation and these are exceptional circumstances. The simple fact is that the bill has to be progressed this week to ensure that departments don't run out of money. When we asked the officials in the committee, they did confirm that departments run out of money would mean the benefits would not be paid out to sick and disabled and frontline services potentially collapsing. And given the circumstances, it would be reckless not to proceed with this bill. As many members did outline yesterday at the second stage of the debate, Tory underfunding over many years has caused deep and lasting damage to our public services. We are in a bizarre situation where the Secretary of State has admitted publicly that we are underfunded, but yet he thinks it's acceptable to ask struggling families to make up for the shortfall with unfair charges, rather than asking the British Government to come up with the money that they do owe us. We need a new fiscal framework where we are funded based on our relative need. There was much discussion yesterday about the proposed fiscal floor, and I look forward to working with my colleagues on the Finance Committee in examining just how the fiscal flow will work and scrutinising the Fiscal Council's assessment of our relative need. Our current fiscal framework relies far too heavily on the British Government to properly fund the block grant. If we want to talk about fiscal sustainability going forward, then we need to ensure we have more say over our own budgets. But for now, Concorla, again, I want to thank the Finance Minister for bringing this budget bill to the floor of the Assembly, and I urge all ministers to support the bill at this final stage. Gar Miagat.
Call down for Scythe.
Thank you, Mr. Speaker, and thank you to the Minister for all of her work on this and to everyone who contributed to the debate. Finances available through the budget are critical to how our government is run, to the public services that can be provided, the policy, strategies and transformations that can be effectively delivered upon. So it's essential that we continue to make the case for the agreement of an effective funding model for Northern Ireland. Our chronic underfunding has led to the challenges in which we are today. Representations have been made to Treasury and long-standing issues need to be addressed, and a fair and sustainable funding package is needed for us here. And on this budget bill, again, I make the point that this is not where we want to be. We have not had time to scrutinise as we would have liked to have, and I trust that in future we will enjoy a much more appropriate level of scrutiny of budgets. This has to be an exception, not the norm. We need to be moving forward on a clear footing that priority is given to developing a programme for government underpinned by a comprehensive budget, which we will be afforded the opportunity for appropriate scrutiny and to set us up moving into multi-year budgeting. However, today the DUP are supporting this budget bill to enable our government departments to function in these next 6 weeks to the end of the 23-24 financial year and to commence 24-25 with a 65% vote on account, on the understanding that this is not defining the future direction of our public spending, that the new 24-25 budget is a priority as soon as practically possible, and that we continue to call on the Treasury to fairly fund Northern Ireland on a sustainable basis, with the issue of resolving public pay on a recurring basis a key priority. Thank you.
Call on Tennyson.
Mr. Speaker, and again I rise on behalf of the Alliance Party to support the bill at final stage, and as I spoke at some length at second stage, you'll be relieved to know that I intend to keep my remarks relatively brief. As has been well rehearsed by many members over the course of this bill's passage, the circumstances in which we consider the bill have been far from ideal. However, short of the Minister coming to this chamber with a time machine, I believe that allowing this bill to proceed provides the best and only means by which we can safeguard continued delivery of public services and make progress in terms of public sector pay negotiations for 2023-24. It is worth emphasising again that some of those members who have decried lack of time for scrutiny and exalted the role of MLAs are often the same members who prevented us from sitting in this chamber and doing that job for the past 2 years, and so bear the responsibility for walking us to the position in which we now find ourselves. I trust that those members, having had an apparent epiphany about the importance of this place, will now join my party's call for reform of these institutions, to remove the ability of any single party to hold this process to ransom and guarantee the political stability necessary to underpin good governance and robust scrutiny moving forward, recognising that we simply cannot have financial sustainability without that political sustainability.
Member Goodway.
Of course.
Can I ask the member, does he agree with me that it's important that we get commitments from people, first of all, who are in government now, that they are, whether it's First or Deputy First Minister, that they are not, that they'll see out the term as what left this mandate, but also that they are serious about a reform programme and making it a priority for the executive?
Absolutely, I concur with the member that all, the First and Deputy First Minister in particular, must be committed to seeing out the end of this term in the interest of our public finances and public service delivery. My party would go further than that, in that we believe there needs to be a process between all of the parties and the two governments that are co-guarantors of the Good Friday Agreement to properly complete a root and branch review of these institutions, because it's been suggested that the issue could be batted to AERC, which is toothless and which has not delivered. So I don't think any of us should be prepared to accept that answer from either the First Deputy First Minister. And it does relate directly to our finances, because much of the challenges that we have now in terms of scrutiny and in terms of our ability to do long-term planning and public service transformation stems to the fact that we have stop-start devolution and hokey-cokey government, and that needs to end. So absolutely concur with the member. Some have criticised rightly the financial package tabled by the UK Government, and as I set out clearly in my remarks yesterday, there are indeed huge shortcomings in many areas. Shortcomings, to be clear, which the Alliance Party has highlighted at every opportunity, in this House and outside of it, through negotiations with Government, correspondence with Government and in the media. We, however, come to the table not just with a list of problems and unfunded asks, as others have done. We have set out clear solutions to the challenges that we face. We recognise that the additional £1 billion allocated by the Executive in 23-24 provides significant relief for frontline services and provides space and time for further engagement with Treasury on the substantive issues. I trust that now, with an Executive in place, we have a stronger collegiate position with which to progress in that regard. The alternative strategy, to be clear, of no, nay, never, would have left us with no Assembly, no Executive and no additional funding for public services and hard-working public servants. We must be clear, Mr Speaker, that a very small minority of members have either misunderstood or wilfully sought to misrepresent the purpose and scope of this bill. We must be absolutely clear that this bill is not about setting out our future ambitions or strategic allocations for the time ahead. It is simply a bill to give legislative cover so departments can continue to draw down cash, to deliver services without interruption and to make progress in public sector pay in the short time that is left of this financial year. In closing, as this bill completes its final legislative hurdle today, we must ensure, as others have said, that this is the last time any budget bill is passed in this fashion. As we look to 24-25, the budget for that year must progress at pace, and I concur with other members' remarks in that regard. We must then swiftly move to multi-annual budgets, and I hope that those budget processes will be more coherent, aligned with the programme for government and the priorities of the Executive and this Assembly, as well as being informed by levels of engagement, consultation and scrutiny that the people that we represent rightly deserve and expect. Thank you.
Call Danny Donnelly.
Thank you, Mr. Speaker. Mr. Speaker, I will keep my comments brief, as many of the critical points in relation to health have already been made by my party colleague Nuala McAllister and other members of the Health Committee. Mr. Speaker, we in the Alliance Party are supporting this bill, since without it, our departments and public bodies will struggle to maintain basic public services. The difficult financial situation we face today is primarily a consequence of instability of this Assembly. And like my colleague Owen Tennyson, and for the second time today, I must stress the need for reform to ensure political stability and to prevent one party from walking away and pulling down these institutions for several years. We saw last year the particular difficulties faced by departments, not least by the Department of Health, when a punitive budget was set by the Secretary of State in absence of local accountability or scrutiny. Political instability also prevents us from having long-term planning, which is how we will be able to deliver on the urgent transformation of our health and social care system and to reduce our waiting lists, as we have discussed in previous debates. A multi-year budget is needed to enable the Department and the Health Service to plan ahead and to deliver that urgent transformation. This cannot be done through comparative annual budgets. Mr. Speaker, public sector pay must be a priority for the Department and the Executive, and I welcome that Minister Swan has indicated that this will be one of his priorities. With regards to the junior doctors' strike, which was announced yesterday, it is important that we do not simply wait for the conclusion of Westminster pay negotiations with the doctors in England. Pay here is a devolved issue, and we rightly should seek to resolve this here in Northern Ireland without waiting to see what happens elsewhere. Also, as I mentioned in previous debates on waiting lists, there exist different circumstances here in many regards compared to the rest of the UK, not least the alternative of working in the Republic, which is often better paid compared to jobs here. If we want to attract more people to work within our health service, it is essential that these issues are resolved. To conclude, I welcome the passing of this bill, but I recognise that this is only a very early stage in the hard work ahead of us to deliver more sustainable politics and more effective public services, and I look forward to working with all members of this chamber and particularly members of the Health Committee. Thank you, Mr. Speaker.
I conveyed the absolute absurdity and recklessness involved in ramming through a budget bill without a modicum of scrutiny. The Executive is behind a false sense of propriety, while denying people both inside and outside this chamber the opportunity to assess this bill properly. They claim to follow the letter of the law while disregarding the concerns and views of those impacted by this bill. Nurses, teachers, doctors, classroom assistants, bus drivers, and all those who were forced to strike recently will be affected by what's in this bill here today. And it is the executive who will have to answer for the budget to come and its impact on those people and more that I mentioned. We haven't put this bill today, Mr. Speaker. The Minister and her colleagues have talked up the money set aside for public sector pay. I'm here to state on the record they are pulling the wool over people's eyes. First of all, trade unions, Mr. Speaker, have already expressed concern that the money on offer probably is not enough to address their demands. And unfortunately for the ministers, it is for those public sector workers to decide if this funding is going to cut it at all. Anything less than inflation as a pay offer will be a real terms pay cut. And given the fact that parties here effectively cut people's wages for the best part of a decade, the executive will have some way to go to make up for the money that has been lost. Just days ago, Mr. Speaker, the Minister expressed regrets to the Finance Committee that the money is not enough to meet the full estimated pay costs. So I would ask, Mr. Speaker, which is it? Is the money there for public sector pay or is it not? And I fear, and certainly workers will fear, that the Minister is following that age-old Stormont tradition of speaking out of both sides of her mouth. The lack of scrutiny in this bill may well suit the Executive's short-term agendas, but it's our public services and communities who are likely to suffer in the long run. We'll keep the receipts, Mr. Speaker, and when the proposed cuts do come, which likely they will, we'll be pointing the finger at everybody who endorsed this budget bill. And we'll be calling, alongside the trade union movement, on all those 170,000 public sector workers who took strike action to take on those who did the bidding of the Tories once again. The full scope, Mr. Speaker, and impact of this budget is yet to be seen. But in my mind, there's no question about people will lose out due to this budget. The only question is by how much. With all this said, Mr. Speaker, we should also mention that this bill comes without any guarantee that the Tories are going to stump up the $3.3 billion as promised. Not only did the Executive not nail that down, but they opened the door to the threat of things like raised rates, higher tuition fees and prescription charges. The Tories played them like a fiddle. Now they expect the Executive to do their bidding once more. But I have hope, Mr. Speaker, not necessarily in this Executive or the Tory bedfellows, but in the power of working class communities to organise and to push back against attempts to further impoverish them once again. And we're here to offer real opposition to this Executive and a socialist opposition. So I will try to oppose this bill today, and we will do all in our power to build opposition on the streets and communities to this administration in the period ahead. Thank you.
Thank you, Mr. Speaker. As said yesterday, I will not rehash the many comments that I did make, but this is not the appropriate way to do business in this House, and I hope that this is the last time that we have to deal with this important budgetary process in this way. That said, things have slightly shifted from yesterday in terms of the financial situation facing this place, with a substantial cash injection and commitment from the Irish Government, which I'm sure members of this House will agree with me is much welcome, and the largest commitment from the Irish Government in terms of these projects. It will alleviate pressure on departments, particularly the Department for Infrastructure, and will be welcomed hopefully by the Minister for Finance, who I know gave a joint statement earlier with our colleague in the South, Michael McGrath, and I'm sure many will be glad to see such a substantial investment and commitment from the Irish Government of €600 million for the A5, which, as many members in this House will know, I've spoken of very passionately for many years. This brings the project a step closer, and it will come as a considerable relief, not just to the Minister for Finance because of the substantial commitment that is there, but also to many of my constituents and people of Derry and Donegal also. As I've said on many occasions, this road does not discriminate. It claims lives every single year, and there's many people that left in the morning to go to their work, children going to school, going to do some local business, and never ever returned home to their families. Unfortunately, 70 such incidents has happened since 1998. 70 people lost their lives, 70 families left with that pain and devastation. No money, no price can be put on a single loss of human life, and colleagues in my constituency and neighbouring constituencies know too well the devastation and pain that has been caused. So today this is much welcome, but there is much more to be done, and I would hope, Mr. Speaker, that the Minister for Finance and her colleague, Minister O'Dowd, with the Department for Infrastructure, will work collectively and proactively to ensure that the other funding is found for the A5 so that we can avoid any further delay, because delays cost lives, and ensure that the project is delivered in everyone's interest as soon as possible. Further to the discussion or the announcements today, a €50 million cash injection as well with Casement Park, and we know it's been featuring strongly on the news over recent weeks and months. And I would hope and I wish, Mr. Speaker, that the Minister responsible for the Department for Communities was a bit more excited about it today. He looked a bit glum, to be honest. A lot of people, Ulster Gaels, people associated with all forms of sport in Northern Ireland, will be excited by this announcement because it is a tremendous opportunity. Sport unites people, brings people together, creates a sense of community, and it is important that we ensure that whatever needs to be done to bring about the funding to deliver a casement is done, and that includes the Minister for Finance, the First and Deputy First Ministers, the Minister for Communities, knocking down the door of number 10 and the Secretary of State to ensure that the commitments that have been made loosely in the press are followed through, and to ensure that casement will be delivered. There's much wrong with our infrastructure, and there's many challenges that we face, but we do need money to deliver them, and only if we work collectively with one vision to ensure that that happens will that happen. So I am more positive today, Mr. Speaker. Many members will be glad to know, because an €800 million cash injection is a huge commitment to this place, and certainly will take and alleviate pressure from departments and ministers, and has been welcomed from across the board. So I thank our colleagues in the South for this vote of confidence, and obviously they've done it in a time where we're extremely positive about these institutions returning. So let's look to the future with some positivity, work together and deliver the A5, deliver Casement Park and deliver for our people. Thank you.
Before we proceed, Minister.
Thank you, Concordia. And I want to say a word of appreciation and thanks to members who have expressed their views again today in this debate. I've listened with interest, and while some have different opinions than I do, it's still very useful to me as Finance Minister to hear all of these views. I will address some of the remarks, or as many of them as I can, to address members' points. So first of all, to turn to some of the points that were made by the Chair of the Committee and Leader of the Opposition. I'm committed, and I think that I made this commitment yesterday as well, to him and to Mr Aiken's point, to bring him forward a bill to put the Fiscal Council on a statutory footing and to provide the legislative framework to underpin its work. A draft policy document was developed setting out the legislative framework for the bill, and it was approved by the former Finance Minister in August 2022. Now that the Executive has been restored, I will need to give fresh consideration to this with a view to bringing a policy document to the Executive for its agreement to progress this important work. Thankfully, significant preparatory work was undertaken. The former Finance Minister circulated the draft document to the then caretaker ministerial colleagues and the NIO to seek initial views. A number of comments were received, and these can be... Yes, go ahead.
I think we have here the Chair, members of the Finance Committee and the Vice Chair here. I think we could give a commitment if you bring it forward. I'm not putting the words within the Chair, but we would expedite that to make that happen very quickly.
Well, I'll let you work that out. A number of comments were received from ministerial colleagues, and these can be referred to within any future executive paper. In addition, officials engaged with the Office of Legislative Counsel, who had agreed to begin the work at risk to develop the legislation, given it was an NDNA commitment. A draft of possible clauses and schedules have been compiled, where OLC and officials continue to have discussions on these. Although much work on this has already been undertaken on an informal basis with OLC, more time is required to be ready to introduce the bill, given the Fiscal Council bill team were reprioritised during the Department's response to the COVID inquiry in the Executive's absence. My department is seeking to reallocate resources to the bill team to progress this work as urgently and speedily as possible. The legislative programme has to be managed across the Executive as a whole, and drafting of legislation needs to be at a significant state of readiness to be prioritised in the 2024 legislative programme. The Leader of the Opposition also asked about a multi-year budget before the start of the financial year. I covered the timescale for Budget 2024-25 yesterday. He is of course correct that in normal circumstances it would be unacceptable not to have a budget in place before the start of the financial year. But as I think has been well covered, we're not in normal circumstances this year, the Executive only returning at the start of the month. It's important that new ministers are provided with time to scrutinise their own departmental budgets before articulating their funding requirements. It's also important that the Executive can consider these fully before reaching decisions. The slight delay is intended to facilitate this. In terms of a multi-year budget, that's outside of the Executive's control. Section 64 of the Northern Ireland Act 1998, which the member has already quoted, also requires me to lay a statement before the Assembly at least 14 days before laying a draft budget, specifying the amount of funding for that year notified by the Secretary of State. As 2024-25 is the last year of the current spending review, the Secretary of State cannot tell me how much funding will be provided in the following 2 years, and without that confirmation, I cannot lay a budget for the years beyond the end of 2024-25. However, as I have rehearsed on a number of occasions, I am determined to have the discussion with Treasury about the fiscal framework to address both the underfunding and to put our public finances on a sustainable footing, and multi-year budgets will be part of that discussion. A number of members refer to the process, and I think that I have set out clearly that I agree that the process that we are having to put in place to pass this budget bill is not ideal. I welcome the support of members in terms of what we are trying to achieve, which is to keep departments being able to deliver public services and to deliver pay for public sector workers. And I want to assure Mr Carroll that I want to get that money to public sector workers as quickly as possible, and I allocated as much money as we could to public sector pay awards. I was able to obtain flexibility to allocate an additional over £100 million to public sector pay on top of what was provided in the financial package. It will of course be for trade unions and employers to negotiate out in relation to those pay awards, and I will respect that process. Yes, I will.
We're going to do. Whilst she has explained the process that we're in and the reasons why we're in this process with regards to time limited time that she has and her officials had to work on the budget, and she talks about the work on the 24-25 budget that could go well towards the summer recess, and then of course you have monitoring rounds. Can you give this House any reassurance that the actual work on budget 25-26, because we know these budget rounds usually take nearly a full year, can she assure this House that the work for that budget 25-26 will be able to go off schedule or on schedule throughout the time of that work?
I thank the member for his intervention, and I can assure him it will be my intention to get things back on track. I want to just address Mr McCrossan's comments, and I find myself unusually in agreement with nearly everything that he said today. And I agree, including that this is not the way to do business. I think I have been clear about that. I also welcome the announcement by the Irish Government today of an allocation of €800 million to a number of important projects, and I'm happy to give a commitment to working with ministers across the Executive to deliver on both the A5 and Casement Park. With that, Mr Speaker, I will draw my remarks to a close, and I thank you for your patience. This budget bill is a crucial piece of legislation which provides departments with the power to continue to deliver vital frontline services to all our citizens through the final weeks of this financial year and the beginning of 2024-25. I commend the Budget Bill 2024 to the Assembly, and I ask members to agree its final stage.
Thank you. Before we proceed to the question, I'd advise members that as this is a budget bill, the motion requires cross-community support. The question is that the budget bill do now pass. All those in favour say aye. Aye. Contrary, if any? No. Clear the lobbies. The question will be put in 3 minutes. There's a problem with the bell, so if the whips could get the word out to their members in the absence of that. Order. Members resume their seats. Order. The question is that the budget bill now pass. All those in favour say aye. Aye. Contrary, if any, no. Do we have tellers? Not what to call it. Yeah, but you can call it. Order. Tellers have been appointed as follows. Tellers for the ayes is. Give us a seat. Tellers for the ayes, I could remember, like, are Anya Murphy and Kathy Mason. Teller for the noes, Carol Hunter and Jerry Carroll. The House will divide. Ayes to my right, noes to my left. Secure the doors. Order, members, resume your seats. Clerk, read the result.
65 members voted, of which 63 voted aye, 96.9%. 23 nationalists voted, of which 22 voted aye, 95.7%. 25 unionists voted, of which 25 voted aye, 100%. 17 others, of which 6 voted aye, 94.1%. 6 members who voted in both lobbies are not included in these results. The bill is passed.
The bill is passed. Unfasten the doors. Members, we now move to the adjournment debate, so those of you who are leaving, can you do it quietly, and we'll take our ease for a moment while we change the top table.
Members, item 6 in the order paper is the adjournment. The question is that the Assembly do now adjourn, and in conjunction with the Business Committee, I have given leave to Deborah Erskine. Yep, she's definitely there. Yeah. To raise the matter of immediate progression on the A4 Enniskillen Southern Bypass. I call on Deborah. You have up to 15 minutes. Thank you.
Thank you, Mr Deputy Speaker, and I thank the Minister for coming to this debate today in relation to the A4 Southern Bypass, given the announcement last night from the Finance Minister, as she brought forward her written statement to announce executive funding to move forward on this much-needed infrastructure project, not least the fact that this announcement is welcome in relation to the soaring costs in terms of the project, so it's quite obviously timely. And I thank the Finance Minister and indeed all executive colleagues. My own DUP executive colleagues will be glad that I'm not going to be torturing them anymore on securing some of this funding for the project. I will speak in this debate as my capacity as DUP MLA for Fermanagh and South Tyrone, rather obviously than Chair of the Infrastructure Committee, but I'm sure I see some of the Infrastructure Committee members are here in the chamber, and they will join with me in welcoming the announcement as well from last night. The A4 Southern Bypass is much needed for Fermanagh, as has already been said. It's a key infrastructure project which will stop congestion in the town and, of course, will create construction jobs as a result of this announcement. And I want to welcome, as I said, the investment that has already been put into the project and the approval to provide £16.2 million of capital funding across 2024, 2025 and 2025-2026. It has to be said, though, in the summer I was dismayed that the £15 million which was previously committed to this project as part of the New Deal funding was withdrawn and paused. However, I am glad that this now forms part of the financial package which accompanied the restoration of the executive. What will also be great news for councils locally involved in the Mid-South West growth deal is the commitment from the executive that £12.5 million of the growth deal can be released early. And since becoming an MLA in 2021, I've continued to raise the Enniskillen A4 Southern Bypass. The Infrastructure Minister will be aware that in January 2022, site clearance and fencing works commenced and NIE diversionary works happened in summer 2022. And I recognise that the Minister himself personally committed funding before he left office as Minister, and certainly as a local representative, I didn't want to see public funds go to waste in terms of the work that had already happened, and so it's important that this scheme progresses without any further delay. It is a project that everybody wants to see delivered in my constituency, and I spoke to one man recently who said that he was told by a road service official, believe it or not, 47 years ago, that there were supposed to be plans created for a bypass in Enniskillen. Now, I hope the Minister we won't see another project like that. That'll take 47 years to deliver. But it certainly has been a long-running issue in the constituency, and it's important that we do see infrastructure projects progress as quickly as they possibly can. The West can often feel like a poor relation when it comes to investment and commitments to see the economy grow and create better communities. And I hope this commitment to the A4 Enniskillen Southern Bypass shows that there is a seriousness to deliver in the West and to level up in terms of our communities. And I know I will use my voice to keep championing our beautiful, lovely, resilient Fermanagh and South Tyrone. And I do want to quash the myth that there is an attitude of forgetting about Fermanagh and South Tyrone. I must admit, Mr Deputy Speaker, I am greedy when it comes to Fermanagh and South Tyrone, and I won't just stop now that funding has been delivered for my constituency on this project. We need more investment, and another matter is the All-Island Rail Review and the need to ensure Fermanagh is on the map. Right now, Fermanagh is the only county in Northern Ireland not to be included, and that simply is not good enough. With strategic road investment like this, we must match up other key infrastructure projects. So, while I welcome the investment last night in terms of funding, the hard work actually starts now. We must progress at pace, and I noticed in the Finance Minister's statement that procurement can now go ahead. Therefore, I would ask the Minister to detail the timescales for delivery and to ensure that there are no further delays to this project. I thank other members for speaking on this matter, which relates to Fermanagh and South Tyrone, and to the Infrastructure Minister, I thank him for coming to the Chamber today. I'm sure we can all agree that we look forward to the day when we are cutting the ribbon and driving on the A4 Enniskillen Southern Bypass. Thank you.
Thank you. And all speakers will have up to 7 minutes if they so wish. And I call Gemma as the first speaker.
And Gormiaga to my constituency colleague Deborah Erskine for requesting this debate this evening, and to you, Minister, for facilitating it. This is a topic that both my constituents and I feel very strongly about. The Enniskillen Bypass is an extremely important project, and I am like a child at Christmas with the news that the Executive has agreed to provide £16.2 million of capital funding across 2024-25 and 2025-2026 to see this delivered. Since I first ran as an MLA in 2017, this has been one of my priorities, and although this project long predates this, I am proud to say that any time Sinn Féin had the chance, we invested in progressing this. Therefore, I want to thank the Finance Minister, Dr Kiva Archibald, for making this next step possible. This highlights Sinn Féin's commitment to the priority of tackling regional inequalities and driving balanced and sustainable growth across the island. My constituency is one of the worst areas deprived of modern, decent roads. In order to drive regional balance, we need to invest in the right infrastructure that helps us achieve that. Currently, Enniskillen Town Centre can act as a bottleneck where local traffic mixes with passing and strategically important traffic, which results in delays for both. So this would be a huge economic driver for Enniskillen and crucial to helping unblock this area's full potential. The proposed Enniskillen bypass would provide a new transport link to the southern side of the town, improving the connection between the A4 Dublin Road and the A4 Sligo Road, offering the following benefits: reduced traffic congestion in Enniskillen, provision of a transport link across the A4 from the Dublin Road to the Sligo Road, facilitation of a more efficient movement of traffic in and around Enniskillen, and reduction in noise and air pollution in the town itself, to name but a few. Obviously, transport itself can't resolve all of Fermanagh's economic difficulties, and the Enniskillen bypass is not a magic bullet that will cure all the ills currently affecting the constituency, but it will be a massive help and a significant boost to the area, particularly in light of the recent shock announcement from BT that 300 people with responsibilities and aspirations may lose their jobs. Fermanagh has been neglected for too long, but this is hugely positive news. I look forward to continue working with the Executive and the Infrastructure Minister to see the timely completion of this vital scheme.
Thank you, Gemma. Patrick.
Thank you, Mr Deputy Speaker, and can I take this opportunity to thank the member for Fermanagh and South Tyrone for bringing this debate to the Chamber, the subject matter of which I know is important to the well-being of many in your constituency, and indeed the sustainable development of Enniskillen town and the wider area. And can I welcome the Minister for Finance's statement yesterday announcing the release of £16.2 million as part of the wider financial package, which will allow a further £12.5 million to be drawn down from the Mid-South-West growth deal and enable this project to move to procurement stage. Indeed, this is a very good day for roads right across the north, and I'd like to take this opportunity as my party's infrastructure spokesperson to also welcome the positive announcement from the Irish Government this afternoon regarding the A5 and Narrow Bridge, amongst other important projects. This €800 million investment is a further positive step in realising the huge potential of the €3.5 billion shared island budget to build north-south connectivity, which crucially will also alleviate pressure on the already stretched capital budgets at the Executive. It's worth noting that the Enniskillen Southern Bypass has been in works for a significant period of time. It was first formally proposed in the Expanding the Strategic Road Improvement Programme in 2006, but as the member has laid out, was talked about well before either of us were around, certainly. With planning starting 2 years after that in 2008 and the preferred route announced in 2015. To date, £2 million worth of advanced works, site works have taken place, and so this funding, enabling the procurement and construction phases to begin, is the final positive step for this important roads project. The proposed scheme has strong cross-party support, and I know my colleague in Enniskillen DEA, Councillor Eddie Roof, has been working closely with other local parties and local stakeholders to push these plans forward. Whilst this is a relatively minor works project at just 3 kilometres, it will have a huge impact on traffic flow and addressing congestion within Enniskillen town. This will pay considerable dividends in terms of air pollution, ease of access to the town centre and reducing traffic, which is particularly important for the safety of school children and pedestrians as well. The reduction of vehicular traffic may also open up the opportunity in Enniskillen town for smaller scale complementary infrastructure schemes such as cycle lanes, one-way systems and pedestrian zones, which can promote active travel and enhance the vibrancy of town centres. Given the rural nature of the area, the continued reliance by the local population on cars and the absence of viable public transport options, and I would of course at this point lament Fermanagh's exclusion from the All-Ireland Rail Review. Schemes like this are vital to securing the growth and well-being of rural communities. This road will also be vital to ensure timely and safe access to emergency services at the South West Acute Hospital, as are upgrades to the A32 Omagh to Enniskillen Road. I know there was great concern across the local area when funding for this project was put on hold as a result of these institutions being suspended for 2 years. And this announcement by the Minister is a welcome statement of what this place can deliver when it's functioning. I can only hope that the Ministers for both Infrastructure and Finance are paying similar attention to the need to finally deliver the long-awaited Ballinhinch bypass, which is right on the edge of my constituency, and indeed also wish to put on record the long-term aspiration and need for an eastern bypass around the county town of Downpatrick. Thank you, Mr Deputy Speaker.
Thank you, and I give you some latitude there. Okay, can I call on Tom Elliott, please?
Thank you, Deputy Speaker. And I welcome the discussion and the debate here this evening, and thank Deborah Erskine for bringing forward this adjournment debate. And I'm not going to talk about Downpatrick or Ballynahinch, by the way, but it is good to see the Minister of Infrastructure here, and indeed to hear the announcement yesterday evening of this long-awaited scheme in Enniskillen. And it's many, many years ago that I remember being on site on a number of occasions with, I think it was Department for Regional Development at that stage, and Road Service. They weren't called the Department of Infrastructure, about the project. And obviously it goes quite close to the old iconic Weirs Bridge that went across the River Erne there. And if any of you want to see a photograph or a painting of that, you just visit Fermanagh Unionist Hall, where there is still a big mural on the wall of the old Weirs Bridge there, and it looks really well. So it is a welcome boost, a welcome project, and for someone who is set in traffic queues, either on the Belfast Road or indeed coming in the Irvinstown Road on a Friday evening, and you sitting behind scores of caravans and caravanettes and campers waiting to get into the town, this will be certainly a welcome boost. I would put a couple of caveats on it though. We shouldn't forget about the town centre, because with less traffic going through the town centre, I'm just hoping that it will allow more availability for parking and will encourage more people to stop in the town of Enniskillen and do some shopping or go for a coffee or some food when they're travelling through it. Second issue is around landowners, and I'm sure we'll hear from the Minister if all the landowners have been sorted at this stage, but I'm sure there are a few that still maybe have to be resolved and their issues resolved, so I would ask that is done in a fair and reasonable manner, and that they're given the accommodation works that they require. Third element, Mr Deputy Speaker, is the issue around the visibility. Obviously it's in a very key tourist area. Lough Erne, you're just going into the upper loch there, and I would want to be assured that any enhancement works will look reasonably aesthetic to the general visitors to the area and indeed to the locals alike. And finally, that any of those local people who need accommodation works and maybe noise barriers there, that they would in fact get those accommodation works, because it is important. It is going to create a lot more noise, a lot more traffic, and there are a number of residents in that particular area, so I would hope that they are accommodated. So I'm just, I suppose, marking the Minister's cards at the moment, and hope that he takes recognition of all those issues. But in general, it's a welcome development, and I thank the Executive for bringing this forward. Mr Deputy Speaker.
Thank you, Tom. Mark.
Thank you, Mr. Speaker. Thank you for bringing this motion. While I'm a bit further from Fermanagh than most of the contributors today, I would certainly wish to echo the sentiments they have expressed here today, and welcome last night's 11th hour, if you like, announcement from the Finance Minister of £16.2 million capital funding to secure this vital transport link for Enniskillen and Fermanagh. This provision will help reduce pollution and congestion, revitalise the town centre, and enhance journey times and improve safety for all road users. For too long, Fermanagh has been very much the forgotten county. Well, one of the forgotten counties in terms of transport infrastructure. This project has been in the pipeline for decades, but much due not so much to the lack of available funding, but in our view, the lack of political will, failed to launch. Recognising the transformational opportunity that Enniskillen Southern Bypass offered, my former colleague and former DFI Minister, Nicola Mallon, demonstrated her determination to deliver fairness for Fermanagh. In 2021, she announced her intentions to proceed with the project, allocating £2 million to kick-start the project and advance site works. She did, however, make clear that the progression of this project would be dependent on future funding. That future funding didn't materialise. The caretaker minister whoever that was wasn't able to provide it, but fortunately the Minister we have now has been able to source it, and so credit where it's due in that regard. He did say it remained a priority and has demonstrated that it was and is. I'm sure any minister would rather be cutting ribbons on roads than cutting spending on roads. I welcome the fact that agreement has been given to release the funding, which will enable works to proceed and prevent increased associated costs should works be delayed any longer. The most recent storm at Stalemate, I can't go any speech without mentioning it, but it also denied us progress on the Enniskillen bypass, not to mention so many other flagship projects, leaving us at the mercy of the Tory government. The anger within the community, anger that my DUP colleague has expressed within the community over the decision to reallocate the previous multi-million pound funding commitment to account for the overspend in the 22-23 budget is still palpable. I hope news that this project has now been steered back on course will help alleviate that frustration. The community in Enniskillen and wider Fermanagh has been deprived of modern, sustainable and suitable road infrastructure integral to driving regional balance and future prosperity. By improving the connection between the A4 Dublin Road and the A4 Sligo Road, the Enniskillen bypass marks a first building block of many required to enhance travel links in this rural, in parts socially isolated county. The SDLP will ensure that focus does remain on providing a long-term plan for the infrastructural future of Fermanagh and ensuring that they don't miss out on the once-in-a-lifetime opportunity afforded by the All-Ireland Strategic Rail Plans. And I've tabled a motion for debate on that in the near future as well. The focus on active travel and inclusion of a cycle path alongside the bypass is of particular note and will prove vital in tackling the climate emergency, encouraging people to leave their cars at home and opt for a greener means of travel where possible and practical. I look forward to seeing this project progress at pace and hope the stop-start approach to it that we've seen for so long is put behind us for once and for all.
Thank you very much indeed. Colm.
Last can call you, and I want to welcome you to your role as well on this opportunity. And I'm absolutely delighted at the announcement in relation to this bypass, much needed, long fought for, and will be of tremendous benefit to the town of Enniskillen and the whole surrounding area in our constituency. By tackling this bottleneck at this section of the road, it will also allow for business to benefit from improved access and opportunities to our shops, and to allow people to enjoy improved journey times and hopefully attract people into the town of Enniskillen as well as facilitate their journey through. In fact, it has been estimated that the scheme will improve average journey times by approximately 50% and will take 40% of the traffic out of Enniskillen town centre, which is hugely welcome. I also agree with Mark in relation to the cycleway and the footpath being a key element of that. It is crucial that we make sure that the infrastructure is there for people to travel safely and walk safely within our towns and indeed between our towns and villages as well. And I have to say, in relation to Patrick's marks, I know we've had boundary reviews recently, but I didn't know it stretched as far as down Patrick. But having battled my way through Ballynahinch on many an occasion in a past life, I have to say I recognise your concern on that issue as well. It is clear also, Lascian Corlia, that this vital scheme will cut air pollution and congestion in the town of Enniskillen. And it's important to say Enniskillen is a very unique town. It's an island town, one of the very few, and that creates its own difficulties but also its own opportunities. However, air quality is a key issue and one that this will certainly help with. It has been estimated that there are up to 800 deaths in the 6 counties attributable to air pollution, so it is a significant issue, and it's of huge welcome that this scheme will help with that. One of Sinn Féin's key priorities is to tackle regional inequalities and to drive balanced and sustainable growth right across the island. In order to do that, we need the right type of infrastructure that allows us to achieve that regional balance and connectivity and allow local hubs to flourish and our areas to maximise their full potential, and there is huge potential there. So that balance includes equal access to opportunities and services, including vital services such as health, broadband and of course investment in our road network. Enniskillen Town and the people and business that make the town deserve to benefit from the type of investment that would allow the local community and economy to truly thrive. I couldn't let this debate pass, Lascian Collier, without mentioning, which also in our constituency, the vexed and vital issue of the A5, and that's another key piece of that infrastructure. And all of these additional pieces will drive us forward into what I believe will be a very, very bright future, and these are vital parts of that jigsaw. So in terms of allowing all of our local communities to thrive, the Enniskillen bypass will certainly contribute to that goal, and I therefore welcome that and welcome the opportunity to take part in the debate today.
Thank you, Colin. And I call on the Minister. And Minister, you have 10 minutes.
Thank you, Lascian Collier. And may I also congratulate you on your appointment to your role as well. I'd also like to thank Deborah Erskine, MLA, for initiating the debate on the Enniskillen Southern Bypass Scheme. And I also add my thanks to my executive colleagues and take this opportunity to recognise their commitment to the project as demonstrated by yesterday's announcement to provide the necessary funding. It's also important to note that it was one of the first decisions of the newly reformed executive, so I think it does show an intent in relation to tackling regional inequality as well. The £16.2 million capital funding agreed by the executive alongside the approved early release of £12.5 million from the Mid-South West City and Growth Deal provides security for the delivery of this critical infrastructure project. This is welcome news for both the Department and local businesses and communities in Enniskillen who are supportive of this much-needed project. The £2.1 million bypass will provide a new transport link to the southern side of the town, improving connectivity between the A4 Dublin Road and the A4 Sligo Road. The transport link will also provide 3.5 kilometres of active travel, as has been mentioned by a number of members, for walking and cycling, extending along the Dublin and Darrylin roads to connect the existing non-motorised user infrastructure. The scheme will also alleviate traffic congestion in the Enniskillen town centre, reducing delays, improving average journey times by approximately 50%, and bringing much-needed improvement to road safety. The scheme will also bring benefits to the town centre environment, improving air quality and reducing noise levels. This creates a unique opportunity to enhance active travel and place making measures in the town centre with reduced levels of through traffic. I think that's an exciting opportunity for Enniskillen, which is itself is a very picturesque town. It's a beautiful setting and ideally set for active travel, and that will involve obviously consultation with local businesses, communities and elected representatives on the best way to bring that forward, but I think it's ideally placed for such a scheme. While the constructions of major projects can significantly impact on the climate, I am pleased to advise that this scheme shows an overall reduction in carbon emissions in the long term, having beneficial impact on climate. In fact, the environmental impact assessment shows that the combined emissions for the proposed scheme after opening include the adjacent road network will have an overall reduction in emissions of minus 4.7% when compared against not having the scheme. Consequently, the scheme has a carbon payback period for the construction carbon emissions of 28.8 years. My department has considered ways in which the building of this important infrastructure can be mitigated through landscaping opportunities throughout the site, as mentioned by Tom, who's just come back. Landscaping plan has been developed, and we have already been working proactively alongside Ulster Wildlife to ensure a significant amount of native tree planting, hedge grow and wildflower planting has been incorporated into the design. As an example, if you look at the A6, it's a longer stretch of road, but there's 1.2 million trees planted along that road, which is going to have huge beneficial impact to biodiversity in that area. So it's amazing that even though we're building a road, and road brings with it opportunities but also challenges for the environment, we can do things to improve the local environment, so I think which is a really exciting part of this project. Funding certainly for the scheme will now allow procurement to commence, as I think Deborah had asked, in April 2024. And the ability for the department to meet this timescale means that the seasonal windows for earthworks as well as works over and in the water can be progressed to the most advantaged timeframes. Again, environmental concerns raised around the timeframe of constructing the road. The road itself will take, if procurement goes ahead in April 2024, we hope then construction starts in the spring, summer 2025, and with around a 2-year timeframe for building. Thankfully, to date, there has been no legal challenges against this project. As far as I'm aware, it is overwhelmingly supported in the local community. So I would hope at this stage we don't run into any legal difficulties, and if we don't, then construction can start within that time frame and be delivered quite quickly. As I've said, this is a significant milestone in this important project, and I welcome this. Is, as Mark has said, ministers would much prefer to be cutting ribbons and cutting budgets. So this is an easy one for me. I doubt there'll be very many easy debates in the chamber for me, but this is certainly one of them. In terms of some of the comments made by members, some of it I've covered in terms of my speech. In terms of the All-Ireland Rail Review, and I note there is a debate coming up in the chamber for that, and I note Fermanagh's absence from that, and it's something that I will be pursuing and engaging on in the time ahead. Gemma had mentioned the disparity in the treatment of rural roads. I hope to be able to announce in the future a dedicated funding programme for rural roads, because rural communities do and often are left behind in terms of infrastructure, and I would like to see our rural roads being treated in a more equitable manner. Patrick chanced his arm greatly with Ballynahinch and Downpatrick. I'm sure you can bring forward a debate on those measures, or write to me, and I'm more than happy to engage with you. Question in already, so I'm more than happy. We now know where we're going to have the tea and coffee after we cut the ribbon on the bridge. We're going to have it in the Fermanagh Unionist Hall to look to look at the Weirs Bridge. So that'll be. But in all seriousness, this project has taken into consideration the town centre. And I think we worked in collaboration here with the local council. I think there is opportunity now for the local council, ourselves and others and other agencies, to see how the town centre can benefit commercially, even in terms of the living environment, business-wise, from this project, because it is going to make a change. I believe it will be a positive change, but we just can't take that for granted. It has to be moved forward. The land ownership issue, all the land we require is currently currently been vested. Am I correct in saying that? So the land issues have been resolved. In terms of, I think I've covered everybody's comments in generally certainly in that way. But look, it's a good start. I'm able to stand here today as a result of a collective decision by the executive that funding is available for this project. All lights are green, and construction work will start in early summer 2025. Thank you.
Thank you very much indeed, Minister, and thank you very much indeed, Deborah, for bringing this debate, the adjournment debate, to the Assembly. Ladies and gentlemen, the Assembly is now adjourned.
Assembly Chamber. Sound. Assembly Chamber. Sound.